Hello, everyone. It's my great honor to welcome you to this global event on World Autism Awareness Day, hosted by the Institute of Neurodiversity, ION. I'm Charlotte Valeur, the Global Chair of the Institute of Neurodiversity, which we call ION. Since our inception in 2021, ION has grown into a truly global organization with over 30,000 members and supporters across more than 40 countries, and still growing. Our mission is to accelerate the creation of a world where neuro-minority people are understood, accepted, and appreciated. We're building a worldwide community that believes in the neurodiversity paradigm and, in addition, work to offer free resources and accessible content for everyone, wherever they are. This event reflects our values and our vision. We have representation from every region of the world in this event, and we worked hard to ensure balance across neurotypes and intersectional identities because inclusion must mean everyone, not just some. Having a voice is vital. Without it, we cannot build agency, we cannot drive change, and we certainly cannot rewrite the narrative around autistic people and other neurominorities. ION is here to amplify the voice of all of you. The Sustainable Development Goals, the SDGs, from the UN, offer a powerful framework for reimagining a better world. That's why we've woven them throughout this event, using them to highlight how neurodiversity and autism connect to global progress, equity, and justice. I want to say a huge thank you to all our incredible volunteers who have worked tirelessly to bring this event to life, and to all the participants joining us from across the globe. Your energy, experience, and insights are what makes this event truly special. Together, we're not just raising awareness, we are building understanding, forging a solidarity, and shaping the future for all of us. To all of you who are watching from around the world, please do help us cascade this event in all your networks so we can amplify the message of our delegates and increase awareness, acceptance, and appreciation of autistic people. And now I want to pass over to the UN to share a few words. Thank you.
Good afternoon. My name is Maher Nasser. I am with the United Nations Department of Global Communications. I am very pleased to join you for this annual observance of World Autism Awareness Day. I would like to express my sincere gratitude to our partners at the Institute of Neurodiversity, or ION. ION has a formal association with our department as an NGO, and we greatly appreciate all of the meaningful work that you do year-round and for convening this important event today, which we are delighted to be supporting. The focus of this year's event is the intersection of neurodiversity, specifically autism, and the Sustainable Development Goals, otherwise known as the SDGs. The clock is ticking, and we are now just 5 years away from the deadline of 2030, by which the SDGs were to be achieved, and yet there is still so much to be done. Since world leaders adopted the 17 goals in 2015, they have been our shared blueprint for achieving peace and prosperity for both people and the planet. And they're interconnected. Eradicating poverty must go hand in hand with improving health and access to education, reducing inequalities and strengthening economic growth, while also tackling climate change and preserving the environment. Without one, you cannot have the others. They are interconnected and they support each other. It is also important to emphasize, especially for the purpose of today's event, that inclusion is at the core of the SDGs. When world leaders adopted the SDGs, they pledged to leave no one behind. What does leave no one behind mean? You may ask. It means that implementation of the SDGs must reach all segments of society, regardless of gender, race, ethnicity, class, religion, and disability, among other factors. It means that we must overcome the discrimination that marginalizes and excludes certain groups and communities, including, in many places around the world, autistic people, and be inclusive of all if we are to achieve the SDGs. And it also means that the neurodiverse community, along with all other segments of society, rightfully deserves a seat at the table on decision making in matters that affect their lives, including on the SDGs. So the leave no one behind principle is crucial to the achievement of the SDGs. And it follows that the full participation of autistic and neurodiverse people in society is equally essential to advancing the SDGs. This core principle goes hand in hand with the fundamental rights enshrined in the Convention on the Rights of People with Disabilities, the foundational document on disability rights that guides us today. I'm excited to hear what our contributors today, from global experts and policymakers to advocates and autistic individuals, have to say about what we can do to help to create the world that we want, a world that is truly inclusive of autistic people. Thank you.
Thank you for being here today. I'm Charlotte Voller. I'm moderating this exciting first session in the World Autism Awareness Day called Autism and the UN SDGs, a global perspective. We have some great panelists from around the world who will introduce themselves after my brief introduction here. The theme is to explore how autism intersects with the UN Sustainable Development Goals and how different countries are incorporating neurodiversity into their efforts to achieve these goals. And we'll hear from the different panelists from different parts of the world on this. And thank you for being here, Rashida. Would you mind introducing yourself to the participants, please?
Thank you for having me. My name is Rashida Namalondo, and I am an actress and applied theatre practitioner based in Uganda. I am the founder of the Sophie Monica Institute, where we try to increase access and inclusion and participation in the arts for marginalized communities in Uganda. Thank you.
Fantastic. Thank you so much for being here. And over to Minaj, if you would like to introduce yourself, please.
Hi there. My name is Minhaj, and I am CEO of a company called SideUp, where I focus on leveraging data and psychological insights to drive meaningful change. I am an individual with Asperger's, which means I experience the world in a very unique way, often with deep focus, strong passions, and a different approach to social interactions. My interest in autism comes from both personal experience and a desire to understand and support others on the spectrum. I enjoy learning about the diverse ways autistic minds work, advocating for acceptance, and helping create a world where neurodivergent people feel valued and understood.
Danielle, would you please introduce yourself to the delegates?
Sure, happy to do that. My name is Danielle Kale-Gray. I am a journalist with Australia's Broadcasting Corporation, which is our public broadcaster. I self-identify as autistic and I am diagnosed as dyslexic and ADHD, and I am a mum to 2 autistic kids as well.
Thank you. Thank you so much for that. If I can pass it over to panelist Tony, would you start by introducing yourself briefly, please?
Yeah, I'm Tony Fish. Like, I suppose, so many neurominorities, I don't really have a career. I have a portfolio. I've built businesses, I've sold businesses, I've invested in businesses, and I'm also a local handyman. So I actually have a white van. I go out and do things like plumbing. So I have an incredibly diverse set of things that get me excited and out of bed every morning.
Thank you, Tony. Thank you very much. And Alan, would you like to tell us a bit about yourself?
Yeah, thank you, Charlotte. I speak slowly because English is not my native language. My native language is Argentino, Spanish, and I'm from Argentina. I live in Buenos Aires, and it's kind of an effort to talk in a different language that is not your native language, because you want to make yourself understand by other people.
Yeah.
And related to autism, to speak in another language, it's a kind of masking. I do masking in my life to work to adapt myself to the neurotypical rules. And I am a writer, and I publish myself a lot of books, essays, and fictions. I am a father, I am a husband, and I do a lot of things, a lot of things.
Excellent. Thank you so much, Alan. Thank you. And Kim, over to you.
Thanks, Charlotte. Hi, everyone. It's an honor and pleasure to be here. I'm Kim Shaw from Canada. I work as a consultant in the financial services sector and lead the Canadian chapter of the Institute of Neurodiversity, also known as ION. A few years ago, I underwent a cognitive assessment that revealed I have ADHD and dyslexia, which launched my journey towards understanding and accepting these neurological differences. Since then, I've been advocating for neurodiversity and systems change to improve the lives of individuals who think and perceive the world differently. There are significant overlapping traits of ADHD and autism, which make my work in neurodiversity aligned with the autistic advocacy, such as the experience of variation in cognition and sensory processing, for example, aspects related to memory and hyperfocusing. So as a leader in the neurodiversity advocacy, I aim to inspire hope by showcasing the potential of neurodistinct professionals and encouraging others to pursue leadership roles that can positively impact society. I too am a mother of two dyslexic, beautiful daughters, and I want to change the world for them.
Thank you. Thank you so much for that, Kim. Well said, all of you, and I'm delighted to have you here. So we're going to move over to questions, and I'll just read out the question and then ask one of you to answer them. So we'll go straight to one of the questions for you, Rashida. This is: what are the biggest challenges in ensuring that autistic individuals benefit from SDG initiatives, particularly in low-income or underserved regions?
Thank you for the question. So, to answer this question, I want to draw onto a case study in Uganda, or at least a situation in Uganda, which I could be a little more familiar with than the global one. So, in Uganda, despite all the initiatives, at least by volunteers and voluntary organizations to raise awareness on autism, it is still there's still a lot of stigma and a general lack of understanding. And so this lack of awareness has two issues. One, we do have parents and caregivers who are hiding away their children, their sisters, and in their houses, and are not allowing them to access, the public places or basic services. And a few of those people who are allowing the children, the caregivers, for example, children's sisters, brothers, to access school or public places, there's also still poor infrastructure, for example, for that kind of thing. If you've been in Uganda, it's extremely noisy. And so there's just like that lack of infrastructure. And it's also very cost effective. For example, if you look at our special education that has been put in place by the government, which is one of the initiatives to increase access to education. If you try to go to a private school, it's very expensive. And if you try to go to a government school, it is quite like overstaffed. So there's just so many people, and there's no attention given. So there's all that kind of crisis of the services, like poor services and poor attention given specifically for people who are autistic to access the services. So that could be one of the challenges.
Definitely. Thank you so much for that. That's really good insight, and it's so important that we hear from around the world what we are seeing in all the different countries, so we can maybe try to build on a global advocacy on a few points, like 2 or 3 points that will make a real difference. We're now moving on to question about SDG 3, which is good health and well-being. And the question is, how can global healthcare systems be improved to better support autistic individuals, including non-speaking and high support needs individuals? Daniela, I would like to ask you around this. It aims for universal healthcare access.
Sure. Well, one of the ways in which global healthcare systems can improve is when voters demand it. And the reason that I bring this up is that autistic needs are forming part of Australia's voting this year in the election. So as a country, Australia need to go to the polls before or on the 17th of May. The election hasn't been called, but the parties are starting to announce their platforms. The Green Party has announced that they would be going to the election on a promise of having all autism and ADHD diagnoses fully funded by Medicare, which is Australia's main healthcare systems.
Wow.
And this is important for a couple of reasons. So it's important because we know that this will be the first election where millennials and Gen Zs outnumber baby boomers, and that these are voters that are more interested in issues or values. So it's important for that. But it's also important because we have the National Disability Insurance Scheme, which is how most autistic Australians, particularly those with complex or higher support needs, access supports because of the costs that are involved.
Yeah.
And so having a diagnosis that's already funded would actually help some of those individuals potentially access more care, because we know that those with higher support needs are almost automatically accepted onto the scheme, and there has been talk about limiting the scheme. So I think it's important for that. And the other reason that I think it matters is that it shows that political parties put forward things that are popular. And because we have to vote in our country and we go take our citizens to court if they don't vote, having autistic needs on an election platform is an important way to show that this is actually something that matters to everyday voters.
Absolutely. That was really great input to have from Australia that other countries can learn from, which is the whole reason for us to try to come together and see what goes on in other places. I'll now move on to question around SDG 4, which is quality education. Quality education calls for inclusive and equitable education. So the question is, what are some of the best international practices that you know of in making schools and universities more accessible for autistic students?
Thank you so much for asking this question. I believe that improving global healthcare systems to better support autistic individuals, including non-speaking and high support needs individuals, requires a multifaceted approach. First, healthcare providers must receive specialized training to understand autism spectrum disorder and what it is, and its diverse presentations, ensuring respectful, patient-centered care. This includes recognizing communication differences and utilizing alternative communication methods such as AAC, which is a short for augmentative and alternative communication devices for non-speaking individuals. So that's one category. And the other is that healthcare systems should prioritize accessibility by offering sensory-friendly environments, flexible scheduling, and longer appointment times to reduce stress and accommodate individual needs. I'd also like to emphasize that integrating multidisciplinary care teams, including speech therapists, occupational therapists, and behavioral therapists and specialists, can provide holistic support tailored to high support needs individuals. And finally, policies must promote equity by ensuring affordable, universal access to diagnostic services, therapies, and assistive technologies. Collaboration with autistic communities to co-design services and policies is essential to address systematic barriers and create inclusive healthcare systems that truly support the well-being of all autistic individuals.
Minaj, those were very wise words that everybody can learn a lot from. Thank you. Thank you so much for that. I'd like to ask you that question as well.
There's a couple of things that have happened in Australia that I think might be interesting here for people to consider. One is that there's a project currently underway at Melbourne University that's led by neurodivergent staff to ask what staff from neurominorities, but also students, what they need and what's currently missing from the ways university operates. And that's gaining a lot of interest from other universities here in Australia, but also overseas. The other interesting development is that there is a lot of funding for different practices for autistic students in particular in South Australia. So 2 years ago, when the state had their election, they changed from a Liberal government to a Labor government. And part of Labor's platform was somewhere between $16 and $18 million for education for autistic students. And they have created a Ministry of Autism. And as part of that, and that goes across education, employment, healthcare, etc. But part of that is a promise to put an autism inclusion teacher in every public primary and high school. And they've done it mostly in the primary schools, and they're now doing a trial of 3 different models for how to do it in high schools. And the role of an autism inclusion teacher is not to teach the students, but it is to build the capacity in the teachers to work out how to help students and what it is that they need every day in their classrooms. Because what they have worked out based on the numbers is that there's at least one autistic student in every single classroom in South Australia in public education. So I think these sorts of policies are really interesting because they show that, again, it's voters that are demanding this of their governments, and that parties are potentially wanting to talk about how important this is rather than discussing the needs of students as a drain on the budget. It's the needs of the students as a way to attract votes. And I think that's an interesting dynamic.
It certainly is, and that's a great initiative. In one of the other World Autism Awareness Days, we had calls for having minimum 20% neurodiversity teachers in all schools, because we know that all classrooms are neurodiverse. It has all different neurotypes within the classroom, and that has been identified, at least for autism in Australia, which is a great step in the right direction. I would hope that those teachers would be neurominority teachers then that deeply understands what it means to be of a different neurotype. So, but that might not be the case, but that's something to maybe push for as well. Thank you for that great input. That's fantastic.
My pleasure.
We have a question around the SDG 8, which is decent work and economic growth. So it highlights the importance of inclusive employment. The question is, what policies or incentives have been effective in increasing job opportunities for autistic individuals worldwide? If you will start with that, Tony, please.
Yes, thank you, Charlotte. From my perspective, I suppose there's a number of activities that have gone on, which I'm sure the others may expand on who answer the same thing, which is there are a series of supported employment programs which provide on-the-job coaching specifically around autism, and such as Project Search, which has worked in the UK and across the US. And apparently, and obviously I don't actually have access to the data, but they claim employment rates are 60-70% for autistic participants. I'd love to test it to understand that it's true, because I'm a deep data person. I haven't had access to the data, so I will just do what they claim to represent it. Then you can move to the specialist programs such as Microsoft, SAP, who have specific autism at work programs. I know that Dell and Ford have also been working on this. So have people like JP Morgan Chase. And that's great, because they're actually specifically trying to help people who have a diagnosis within their programs to get employment, and actually helping them in the employment process, which is massive. The thing that I think is missing in so many countries, the one exception being Australia at the moment, which has the disability employment, which is actually to offer financial incentives to those who are going to recruit across the disability range. That's one that a number of countries are looking at, but we're still waiting to see them actually implement it. And I think in the current global climate, it's going to be very difficult for a number of governments to implement it. We've got huge amount of education and training programs, and I'm going to run out of time, but Ireland's ability program is probably a leading light in that one. I think there's great opportunities to align to the SDG. There's great initiatives. There's just not enough of them, would be my only thought.
Thank you so much for that, Tony. And Alan, what do you think about this one as well?
Thank you very much. Despite I work as a freelance writer, my fixed income is as an employee at the National Disability Agency of Argentina. So I can say that in my work, reasonable accommodations warranted by the Convention on the Rights of Persons with Disabilities have been made for autistic people with disabilities, including myself. My country, Argentina, has a 4% employment quota law to guarantee the employment of people with disabilities, including autistic people with disabilities, in the state institutions. I also publish and sell my books independently because I have not yet had opportunities as a writer in the publishing industry. I think everything comes later to me than to non-autistic people of my age because I spent too much of my life in different therapies for my mental health. I teach also behavioral finance and I make my classes accessible to autistic people because I believe that many autistic people could work in the financial industry doing short-term trading. Trading could be used to create investment cooperatives for autistic people. Some organizations related to business spread the idea that hiring autistic people can give a company a competitive advantage. I think this is a good idea, but it requires awareness campaigns about autism as a neurotype rather than a condition or a disorder. In relation to personal selection process, I think it is important in a job interview to anticipate to an autistic person how long the interview will last, how the place will be where he or she will have to go, what the questions will be about, and how many people will participate in the interview. To put in short words, I think we are in a shift paradigm.
Yeah, thank you. Thank you so much for that. I agree with all of that, definitely. And it's some great examples that you gave there. Thank you so much. So for Kim, I'm going to ask you, how can international collaboration and knowledge sharing help bridge the gap in autism research, advocacy, and policy implementation across different countries?
Yeah, great. Thanks, Charlotte. Working together globally and sharing knowledge offers enormous potential for improving autism research, advocacy, and policy across different countries. A great starting point would be working with organizations like the Institute of Neurodiversity, which is already networked globally with country chapters to foster collaboration and knowledge sharing among regional members. International collaboration and knowledge sharing are mechanisms for 1, collective problem solving, 2, innovation, 3, cooperation, and 4, community. Let me expand by what I mean by these mechanisms. First, collective problem solving. By sharing the lived experiences of neurominorities, cross-cultural insights, and different perspectives across the various socioeconomic regions, we can develop creative approaches to support research, advocacy, and policy for autistic and neurodiversity inclusion where such activities are underdeveloped. 2, innovation. This phenomenon occurs when organizations are inclusive and led by neurominority or neurodistinct individuals. These groups bring a variety of thinking styles, including creative, divergent, nonlinear, and paradoxical approaches. By expanding collaboration and leveraging each other's cognitive diversity, across borders, we can effectively achieve common goals that support research, advocacy, and policy on a global scale. 3, cooperation. Engaging with diverse stakeholders, including autistic individuals and families from various regional and cultural backgrounds, enhances participation and fosters social cohesion globally. Both are essential for building trust in today's complex and uncertain world, which is crucial in research, advocacy, and policy outcomes for autistic inclusion. And lastly, 4, community. It is the cornerstone of social movements driven by people for the benefit of others. Building global communities is essential for humanity's survival and prosperity in the age of artificial intelligence and digital economy. Connections formed within these global communities establish a foundation for building human and social capital that supports research, advocacy, and policy development, autism, and neurodiversity. These 4 key, I would say, crucial aspects are the underpinnings of international collaboration and knowledge sharing. Thank you.
Fantastic. Thank you so much, Kim. Communities is what we're all about at ION. I was thinking of a world where you have a mesh of networks of neurominority individuals and our allies coming together and supporting each other. We're on the road to that, and when we have more of that, I think it will be greater for a lot of us. Now, Tony, your comment on the same question, please.
Well, first of all, I want to support Kim and what you just said as well, Charlotte, which is the amplifying autistic voices globally through international self-advocacy networks such as ION. Absolutely an underpinning. So brilliantly points well made. I suppose a different perspective would be that we really haven't got standardization and data sharing together around autism globally. We haven't got common definitions, not only common definitions which people jump to, it's actually the ontology of the data, the structure of the data. And because we don't have the same ontologies, when we try to combine them through a systematic study, we can't, because actually we're using different data sets. We get very confused ways through it. So we need to create a data standard which allows us to have the shared view, which would allow us to do global and international research. The second part of that then comes down to this subtlety of the cross-cultural variation, which we really haven't got to grips with. And part of that comes through one of probably your other questions to other panelists around food and how food absolutely changes who we are and what we do. And it's not actually changing who we are and what we do. It's actually the way it manifests itself. So we have to look at traits differently through different lenses, and we haven't got that level of complexity within the data set. So we carry on missing, and therefore we find individuals are either overlooked or preferenced, which is creating lots of social issues within. The next part I think that we've got to consider is how we do policy globally. And we have global international companies, we have global supply chains, yet we completely fail when it comes to policy at a global level to deal with any level of diversity in the way that we think. The last thing I'd probably come back to is just reiterating where we started from on what you said, Charlotte, and what you've said, Kim, which is we have to amplify the voices by being global advocacy networks. And this sort of discussion is how we start it. And it's finding people who want to come and go, do you know what? I'm really interested in data. I want to pick that up and run with it, because that's the people we need.
Yeah.
Thank you.
And we will very happily set up a committee globally that can do that. With the people who's interested. So anyone listening in, do contact us if something like that would be of interest to you. Now, for you, Alan, the next question. How do we ensure that autism advocacy efforts on a global scale remain inclusive and culturally sensitive, addressing the diverse needs and perspectives of autistic individuals in different regions?
It's difficult to answer because I don't see the future yet, but I'm working on this. I'm working on my visions, with my visions and the voices I hear. I think that autism is part of mad cultures, and the international autism community is transforming society's representations of autism. When we talk about math cultures, we are not only talking about the importance of arts in cultures, but also about the history of the autistic community, their education, and their own ways of expressing themselves. I think that the social imaginary about autistic people is changing, but we have to recognize that there still are tensions, conflicts. For example, some artistic expressions of the autistic community are still classified as art brut, a classification that was invented by medicine during the Nazi era in Germany. I know associations of families of autistic people who promote the idea that the autistic people have neither abstract thinking nor the ability to create metaphors, and this idea is a therapeutic bias. In my country, a lot of progress is being made in recognizing autism as an identity rather than a disorder. So, it is often associated with social disability, which makes it possible to claim for all the rights of autistic people, not only the right to health, all the rights. Ultimately, to ensure that autism advocacy efforts remain inclusive and culturally sensitive, I think it is necessary to recognize how autistic people's ways of communicating using plain language, pictograms, or easy reading are legitimate, just as it is necessary to recognize and legitimate the ways in which autistic people move their bodies and express themselves silently or just with sounds. There are many ways to participate in community and cultural life. Autistic people have our own ways of participating that may not be shared by non-autistic people, but should be recognized and respected. So, thank you very much.
Absolutely. Thank you so much. Right up my street, Alan. I'm very much looking at the culture of neurominorities. There's a third culture that's not currently recognized. There's a third kind of mind, and there's a third kind of intelligence, and it's not recognized yet. So we gotta talk more about that. In fact, it seems that the military is one of the places where they recognize this the most and actually use us and want us to be part, so they're sure they cover all the different intelligences of human beings and artificial intelligence. So there's some interesting perspectives in that. So the next question is, if there was only the one policy change that you could implement globally to better align autism inclusion with the SDGs, what would it be and why?
Well, if I could implement one global policy change to better align autism inclusion with the UN SDGs, it would be the establishment of universal access to inclusive education and lifelong learning opportunities for autistic individuals. Now, this policy would directly support SDG 4, which is the quality education, while intersecting with other goals like SDG 3, which would be good health and well-being, and SDG 10, reduce inequalities. Now, inclusive education systems must be tailored to accommodate diverse learning needs, including non-speaking and high support needs individuals, by providing individualized support plans, trained educators, and accessible learning environments. This policy would also mandate the integration of assistive technologies such as AAC devices and sensory-friendly classrooms to ensure equitable participation. By prioritizing education, we empower autistic individuals to develop skills, achieve independence, and contribute meaningfully to society, breaking cycles of exclusion and poverty. This systemic shift would foster greater understanding, reduce stigma, and create a more inclusive world that aligns with the SDGs' core principle of leaving no one behind.
Minhaj, I really appreciate those words. So the next question for you, Kim.
Thanks, Charlotte. Yeah, it would. If there was one policy change I could implement globally to better align autism inclusion with the SDGs, it would be mandating the inclusion of autistic voices in policy development.
Yeah.
It would mean adhering to the global principle, nothing about us without us. This principle would require autistic individuals, their supportive families, and communities to be involved in decision-making processes when designing systems that impact people and places. Their representation is crucial for accepting and adopting policies that affect their lives and well-being, including areas where they live, learn, work, and play. So this global policy is essential for the sustainability of human rights because it focuses on how individuals are treated concerning their neurodiversity. Beyond human rights protection, including autistic voices in human capital formation for a sustainable world has the benefit of fostering a more inclusive society. Many individuals engaged in sustainability resonate with rich inner experiences linked to neurodiversity, notably autism. These individuals are often sensitive to the changes impacting people and the planet. They share a deep sense of responsibility toward their communities and the land, perspective that has long been expressed in the wisdom of indigenous people. This approach to policy change for the inclusion of autistic voices centers around several SDGs, particularly SDG 3, good health and well-being, ensuring healthy lives and promoting well-being for all, including autistic individuals at all ages. SDG 9, build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation by tapping into the autistic and neurodistinct talent. Excluding and undervaluing the autistic voice ignores the essential role of cognitive and sensory diversity, which forms the basis for emotional intelligence and is crucial to human functioning and social cohesion. Thank you.
Thank you so much, all of you, for all your insights and for telling the world about the insights that you have and you have seen and experienced. That's much appreciated.
To make society understand the importance of the more careful look at the Black population with disabilities, to inform, to debate in Broadway, to think about the public policies for the Black and autistic people like me. We are dignified and they deserve support and access to rights.
Fund us, invite us to develop the projects that we need as neurodivergent people and wish we had growing up. Give us a platform for our voices and political participation. Nothing about us without us.
Have more autistics self-advocate and also back the need to listen to actually autistic people. The change needs to begin in the school system for non-speaking autistics to pursue education and contribute to society. Not speaking doesn't mean not thinking. Not expressing doesn't mean not feeling. Not talking doesn't mean not having anything to say.
One approach would be to focus on teaching neurotypical people how to interact with autistic adults.
One of the major things that needs to be done in ensuring that there's a lot of policy work is for people to listen to our voices. We as autistic people need to be at the center when it comes to advocacy that affects us, in line with the Human Rights Convention and also under the CRPD.
It is time for policy on autism diagnosis to be reassessed to reflect the actual needs of autistics, because autism is not just a word, it's not just a concept, It's who we are.
Go about advocacy in their own way. So whether that's like creating a TikTok that's relatable to them and then turns out to relate to a load of other autistic people, or whether it's like advocating for themselves and saying no to plans with friends in loud places. Like advocacy takes so many different shapes and forms. Like
when people think policy advocacy, they do think of like changing laws or changing the world or like changing it all right now. And I think for us, like I think what can make the biggest impact for autistic people is like, how can we advocate for ourselves just in our own life right now?
People understood and supported the inclusion. That is the only thing where I learned about many things about inclusion, and it started sensitizing it, and peer sensitization should be there in every company when they hire any person with autistic, and give them peer sensitization. And
today, only a few hundred instructors, primarily located in North America, are trained to teach typing to 31 million non-speakers globally. In the coming months, Communication for All will launch C4A Academy, a program of internet-based instructional videos to teach typing to non-speakers anywhere, free of charge. Families will have the tools and support they need to learn how to be a communication partner for their non-speaking member. Lessons will demonstrate and explain each step in the process for a communication partner to coach a non-speaker to overcome their motor challenges.
Hi everyone, and welcome to our panel discussion on SDG 3, Good Health and Well-Being. I'm Hazleen Ahmed, your moderator for today's 40-minute session. We will be exploring how inclusive healthcare systems can better serve autistic individuals and promote mental health and well-being. This is a mixed neurotype panel with majority autistic individuals. Our panelists are Julio Eduardo Weiss, Rafael Asuaje, Andrea Palacios, Aaron Decker, Audrey Chard, Rob Holman, and Teresa Haskins. Please introduce yourself, including your name, country, and interest in autism. Let's begin with you, Julio.
Yes, my name is Julio Eduardo Weiss. I'm from Paraguay, in South America. What interests me about autism is my nephews. They all are affected somehow by autism. They were raised by my sister, but they spend a lot of time with me and my children, like I was the principal nurse when they were very young. Now they are grown up already. And as you know, here in Paraguay, our healthcare system really doesn't do much about this particular issue. In South America, it's very hard. We are still struggling by basic attention in our healthcare system.
Rafael?
Hello, everyone. I'm Rafael Asuaje. I am originally from Venezuela, but I live in Chile since 2018. My interest in autism is to better understand and support neurominority individuals, especially from my experiences in life. I was forced to leave my country due to economic and political reasons in 2017 to help my family, and I have to adapt to a new country, new cultures, and new ways of living to fit in. So that's my way I want to contribute in that way. I also believe in being inclusive, all of us as an entity around the world, and I also like to appreciate ways of thinking of people around all of the world. Thank you.
Thank you, Rafael. And Andrea?
Hello, I am Andrea Palacios from Panama. I'm a psychologist, and I'm very glad and happy to be here as part of this beautiful panel. So thank you very much for having me.
Erin, would you like to introduce yourself?
Hi, yes, thank you. My name is Erin Decker, and my pronouns are they, them. I am an autistic job coach and a researcher from Ontario, Canada. My main interest in autism stems from my personal experience in navigating the world as an autistic individual. This has driven my work in my master's and in my job coaching and future research studies to improve the lives of the autistic community and other people with disabilities in this moment and for future generations. My master's thesis focused on the heteronormative barriers to autism identification. And today I'm excited to share insights from both my lived experience as an autistic person and my research background in autism with you all today. Thank you.
Thank you, Erin. Thank you so much. Moving on to Audrey, would you like to introduce yourself, please?
Hi, everyone. I'm Audrey Chad, and I'm also in Toronto, Ontario, Canada. I'm the founder of my outlet. It's a hub for neurodiversity, and we support individuals, families, and organizations with achieving better outcomes and inclusive environments. We do this by providing a variety of programs, mentorship and employment opportunities, education, workshops, and advisory tailored to the needs of our neurodiverse and neurotypical audience. You can find us online at channelmyoutlet.com. And the original interest that I personally had in the topic of neurodiversity stems from being from a neurodiverse household. There's 3 out of the 4 of us, and we've all individually had very different lived experiences and recognize that each one is unique. And we're very, very focused on supporting the community and, as I said, but achieving better outcomes for neurodiverse and neurotypical individuals by allowing the neurodiverse population to achieve their potential.
Thank you, Audrey. Rob, I'd like to hear from you.
Hello, everyone. My name is Rob Holman. I'm the founder of the U.S. chapter of the Institute of Neurodiversity, which we call IONUS. And my interest stems from the fact that I have 2 neurodiverse children, and they stem from the fact that there's neurodiverse individuals on both my side of the family and my wife's side of the family. And I've developed education, and it's been a learning curve on how to work with the neurodiverse community, but also to help the neurodiverse community work with the neuronormative community.
Excellent. Thank you so much. Over to you, Teresa.
Thanks, Hasleen. Hi, I'm Dr. Teresa Haskins from the United States, and I'm working with Rob and IONUS. My work focuses on neuroinclusion. I have worked with leaders to create environments where neurodistinctive individuals can thrive. I've spent my career advocating for systemic change, ensuring that autistic individuals not only have the support they need in education in the workplace, but they're also valued and respected. I'm a professor, I'm a speaker, I'm a consultant. I work with businesses and government agencies to try to bridge the gap between policy and practice, pushing for solutions that go beyond awareness to drive real change. My interest in autism is both professional and personal. I'm a neurodivergent parent to twice exceptional sons, and I'm really passionate about reshaping systems to try to make a more inclusive, accessible world for all of us.
Thank you so much, everyone. So let's begin this session with our first question. I'm going to open it up to Erin. Erin, what are the biggest challenges autistic individuals face in accessing healthcare services, and how can this be addressed?
Thank you for that. Autistic individuals face significant challenges in accessing healthcare, but also in the quality of care that they receive, if any. These challenges contribute to poor mental and physical health outcomes. And while there are many barriers, today I'd like to focus on 2 key issues. The first one is that many autistic individuals, particularly women and gender diverse people and people with other marginalized intersecting identities, are often not taken as seriously or maybe even disbelieved by healthcare providers when they're sharing their experiences. These communication differences and thinking differences tied with gender and neurotype biases can make it difficult for medical professionals to fully understand their concerns, which can lead to dismissal or misdiagnosis. To address this, healthcare providers can practice active listening and valuing autistic experiences and really listening to what that person has to say and try to understand their perspectives. Recognizing their own potential gender and neurotype biases to try to combat that in the meetings with patients, and ask targeted questions for clarity, and understanding autism-specific symptom descriptions and definitions, and conditions that may be very rare in the general population, but are much more likely to be experienced in the autistic group. The second thing I'd like to talk about today is access to gender-affirming care. Autistic individuals are 2 to 6 times more likely than the general population to identify as trans or gender diverse, yet they often face barriers to accessing this gender-affirming care. A common misconception is that autism impairs their ability to consent or to understand gender-related decisions, but this is not the case. The autistic community consistently advocates for their capacity to make an informed decision about their own care. To address this, healthcare providers can provide accessible, gender-affirming care for autistic individuals without autism being a diagnosis that would remove them from accessing this care, respecting autistic people's capacity for consenting and self-understanding around their own gender, and incorporating autism and gender diversity intersectionality in training. By addressing these barriers that I've mentioned earlier, improving communication practices, and ensuring access to these care within these healthcare systems, we can make meaningful steps towards equitable and more inclusive care for autistic individuals.
That's brilliant. Thank you so much, Erin. Would you like to take this question, Julio?
Yes. As about in my region, the biggest problem is they are not recognized as autists. So it's very hard to say you are or you are not. So thereby, our healthcare system doesn't really have politics about this, on how to handle it. They through the fact that we have more urgent, let's say urgent things, they really don't give much importance to this particular issue.
Thank you.
I would say this.
Are you there, Julio?
Education is the key for a better attention in this particular issue. So the problem is not that they are not willing to do it, they just don't know how to do it. And all the information, all the data they have is very, very old, In South America, we are very behind of new work techniques, let's say so. So information will be the key to give a better attention to the people.
Excellent. Dr. Teresa, what is your response to the question?
I completely agree with Erin. There's definitely an area to address with intersectionality of gender identity and autism. But when I was thinking of the question, I actually think that a larger, more holistic problem is that most healthcare providers aren't trained in autism. So this leads to misdiagnosis, dismissal, and fragmented care. And what I think makes things even worse is that the burden of navigating these systems, especially in the US, falls entirely on the autistic individual and their families. There is actually no structured pathway for care. And so most, especially adults, seeking diagnosis or support have to really figure this out on their own. The waits are really long, and this is often years after being misunderstood by the medical system. So the other piece that I see, and I think one of the most significant gaps, and I'm experienced this with my own family, is that mental health care is fragmented and needs aren't treated in a holistic, interconnected way. Psychiatrists focus on medication, therapists on talk therapy, and the overall wellness of the patient is ignored. So autistic individuals are left to piece together their own healthcare plan, to like interconnect their therapy with the psychiatrist. And that may not be an experience that's globally shared, but it's definitely an issue that we're facing. And that's really overwhelming for the patient because you're seeking professional guidance and often left to figure out your own program plan to create a holistic need. So in my perspective, we need a fully integrated, autism-informed approach to care, where professionals across the medical and therapy domains work together, not where autistic individuals are forced to do it alone.
Thank you. And I believe a personalized care as well is what is quite essential. How can healthcare professionals be better trained to understand and support autistic patients, particularly in mental health care? And Andrea?
Healthcare professionals should be supported every year with all the information and innovative practice on how to support and be there as a support system for autistic individuals. How? By letting them know how the autistic condition is and how can we treat them with respect. I think one of the important things is to remember that no matter what, they are human beings. They have a character, and there is difficulty of them by be there in this world is that we don't have the patience to understand them. We don't have the patience to listen. We don't have the patience to create a better communication with them. And that's why we get anxious, we get stressed. We sometimes don't know what to do, only because we disconnect from this human part. So my advice is to remember that they're human, you are human, and we need to create a bridge between us and them, because we are already trained in our fields to support them. But because we don't know, and it's always on a spectrum, and it's always changing the movement, we disconnect from the daily and from the automatic pilot. But we need to come back. We need to breathe. We need to be in our center, so we can give them what they need. So we can give the support they really want to have. So connect with your human side and remember they're also human beings. They're just trying to communicate and be a part of this beautiful community and world that we live in.
Thank you, Andrea. Go back to you, Erin.
Healthcare professionals can be better trained to support autistic patients, especially in the area of mental health care. And one of those areas of focus can be around understanding communication differences between neurotypes, the non-autistic and the autistic ways of thinking and communicating. Doctors and nurse practitioners and a lot of clinics often use a really fast-paced approach to understanding the issue and getting into a treatment plan. And some of these questions can be really broad, like, how are you feeling? And these types of questions for an autistic person may be a bit too broad to fully understand. So what I suggest instead is asking specific questions to bridge that gap. So, for example, I saw in your intake that you mentioned concerns about anxiety. Can you tell me specifically how that felt for you over the past 2 weeks? Instead of asking how we're feeling in general, where we could think about all the different feelings we had and all the different things that came up, instead we can really hone in on specific pieces. And there could be follow-ups about how it might have impacted work, school, socially, sleeping, feeding, all of these different aspects of our lives when we take this approach. This approach may take longer and may take adjustments to the systems that we have in place. Most consults are around 15 minutes, and we may need sometimes even double that time to get to the real heart of the issue when working with autistic patients. But through a targeted approach with asking specific questions and really taking the time to go through it with those individuals, we can develop formal autistic communication skills courses for healthcare practitioners to develop this better support system. in this kind of formal course, we can employ autistic individuals to create the curriculum and to conduct those training sessions, which can ensure autism-friendly communication skills are integrated into these healthcare settings. We can also train healthcare practitioners to use direct language and literal language and avoiding really vague or abstract kinds of questions, which can lead to confusion or not getting at the heart of the issue for that autistic person. And all of this kind of revolves around educating professionals on what it's like to bridge that communication. And throughout all of these different initiatives and approaches, I really encourage us to involve autistic people from the very beginning. And this kind of phrase, nothing about us without us, when we're developing these kinds of programs and policies, we're really looking to include autistic voices and perceptions along every step of the way to ensure that what we're doing to promote autistic inclusion within these healthcare practices are being created by autistic people for autistic people. Thank you.
That's fascinating. Thank you. That's in that way they feel that we feel that we're being heard and listened to. I would like to get the opinion of Andrea. What is your response to the question? Next, we're going to move on to question 3. I would like to ask Audrey, what role does early diagnosis play in promoting long-term well-being for autistic individuals, and how can we improve access to support?
Thank you, Hasleen. So I always say that information is power, and a diagnosis provides a framework with a wealth of information upon which to inform ourselves and to make good decisions. But neurodiverse individuals, their parents, and other stakeholders must be aware that a diagnosis is when all the hard work truly begins. This is when informed decisions can be made and resources can be sought after and communities and relationships can be formed. An early diagnosis is one piece of a very important puzzle that allows for the compounding effect of small changes. The book Atomic Habits by James Clear makes this point so extremely well. Small changes, which can even be indiscernible by those who know someone best, have the potential to make a big difference, positive or negative, over time. Identity formation starts at a very young age. So the earlier an individual learns about themselves and their surroundings, the more comfortable they'll feel in their shell and the more able they will be to advocate for themselves. And the more likely they will be to develop meaningful relationships and find community, which all contributes positively to good mental health. So in terms of how we can improve access to support, we need to educate the neurotypical population. We need to identify and engage with champions for neuroinclusion in all facets of our life, from teachers to CEOs to janitorial staff. This is a very personal topic. And so to find the people who are primed and ready to make change or are already doing so, and to support their efforts for a greater impact will go a very long way. In general, it's imperative that our systems become easier to navigate, as was touched on by my fellow panelists. We need better coordination by healthcare, education, and employment systems, and we need policy development at the government level desperately to coordinate these functions and see that care is provided and education, and that those opportunities are created. And one example that I would offer is when you look at teacher education and the percentage of teachers' college dedicated to learning about how to teach and support diverse learners, it's stiflingly low. In my jurisdiction, this percentage is close to 0, if not 0. And if it's optional for those who want to opt in to learn about it, chances are that those who have a personal stake in learning about this topic will take it, and those who are less informed will opt out or not seek it out. And so this is where It's not setting our education system up for success, and by extension, it is not setting up our employment systems for success either. So, to summarize, we need to improve access by continuously educating, by empowering and supporting champions of neuroinclusivity, and by improving regulation and policy.
Thank you, Audrey. Raphael, be interesting to hear your point of view on this question.
Thank you. Well, I agree with Audrey. I believe that early diagnosis is crucial because it allows autistic individuals to receive the right support and accommodation from a young age. When diagnosed early, individuals can access to different kind of therapies and interventions that help them to communicate, develop social skills to the world, and have sensory regulation. I believe also that leading to a better quality life, so they don't struggle a lot. Also, without an early diagnosis, many autistic individuals struggle with misunderstanding, like, for example, as Erin said, with different type of questions that are asked. Also, some challenges in school, for example, work environments. So early identification also helps families to understand their child's needs and strengths, reducing all the frustration that comes without not understanding or not knowing how it's going on exactly. I also believe that to improve access to early diagnosis, healthcare systems all over the world needs to reduce the long wait times and provide affordable assessments and solutions, so many families don't struggle to get out proper diagnosed, and also having access to the right professionals and trained professionals around the world. Thank you.
Thank you for that, Raphael. Moving on to the next question, which I will direct to Rob. How can healthcare settings, such as hospitals and clinics, be adapted to accommodate sensory sensitivities and communication needs of autistic patients? Over to you, Rob.
Thank you. Well, I think the key word here is empathy. And to be empathetic to the patient, one must understand where the patient is coming from. And in order to do that, we need to know what the patient feels, thinks, hears, sees, feels not only emotionally, but physically as well. And in order to do that, you need to interview people who could be patients. And also, I think it's important to understand from an empathetic perspective how the patient may feel or experience their time at a hospital or a care facility by interviewing caregivers, doctors, nurses who are neurodiverse themselves. I know that they've conducted experiments where in order to understand the environment, a neuronormative doctor or nurse experiences a space where the light is brighter, the sound is louder, the colors are more extreme, and from doing that, they understand where the or how the patient could be experiencing that environment. And from there, we could probably realize that softer tones, color tones, softer, quieter experiences, less bright experiences would benefit the patient because of their heightened sense of awareness and sensitivity to sound and light and all that. So again, I think empathy is the key here.
I love that. Thank you so much, Rob, for that. What is your response to the question, Andrea?
I love this question because for me, is just make them be part of the redesign of the centers, of the redesign of the practice. And how we can do it? By asking them, by watching them. Just like a little bit of a scientific project. The thing that I do is to incorporate them in how can we change stuff for them to be better. Because we already have our training. We already know a little bit. We already know where to find it, how to find it. And we live in this beautiful era that with one only click, we can have a lot of information in different languages and just translate it and to be able to have a lot of resources. So to make it better in all these places that we live in, we need to include them. We need to make them part. We need to ask them, how can I make this better for you? How can I make this more clean? How can I make this more useful? How can I make this more satisfying? How can you be better and improve and learn from this? And how can I do it for you? So creating this bridge, creating this communication, making them be part of this, I think is the better solution ever. Because they have a beautiful insight all the time. They have the information that we need. And they are the population that we also work with. So make them part, ask them. Or if they cannot say anything or they are afraid and you have a great idea, just practice with them and watch them. And so you can know if it's something that is going to work or not. But make them part. And it's not only a creation that you do to feel good and to help. We need to make them part all the time because this is something that we do for them. And to make them part of stuff is wonderful because they also learn how to navigate in this chaotic world that we live in. So make them part. They have all the insight that we need.
Thank you, Andrea. Let's move on to question number 5. This is a really interesting question. What are some effective mental health support strategies for autistic individuals, particularly in managing stress, overwhelm, and anxiety? Very important question indeed. What is your response to the question, Julio?
Well, I would say the first thing is to make them feel that they are just going through a moment, not that, hey, you are different, you are this, you are that. You are somebody just like anybody else, but you have this little issue, and there, through that, you will make the stress go much lower. And then you have a series of different treatments. Like my nephews, they make a echinotherapy, for instance. Like they were interacting with horses and nature and things, and this brings the stress level really down. But if you are in a, let's see, in a hospital, in a clinic, in something connected to a lot of machinery, this might be very scientific, but it's not very, I don't know how you call it, your soul is not very psychological good. So you must find a point of equilibrium between the science and the heart. That's at least
Absolutely.
how I see it.
Well done. Yeah, well done. It's a good point. Over to you, Raphael.
Thank you. Well, I think that one of the most effective ways to support autistic individuals' mental health is by creating somehow structures and somehow predictable environments. Many autistic individuals, for sure, experience anxiety when faced like uncertainty or having like unclear routines. I know this from friends that experience that as autistic individuals. So like having structures and things like are predictable somehow for them can help them to reduce stress. Also, like as Rob mentioned, like sensory regulation. Like for example, having some sort of like soft noise, soft colors, and reducing like noise, like loud noise in the environment, or using noise canceling headphones can also help to provide some relief on sensory overload. Also creating like safe and quiet spaces where individuals with autism can like retreat, and when they feel overwhelmed, could be a potential and helpful tool and a strategy for them to reduce some things like anxiety and things like create stress in different kind of ways. I believe also that traditional health treatments such as like talk therapy is not always as effective unless some people are adapted to that need. But therapists also should focus on like concrete structure questions and approaches, like to like for them to be understood, and encourage that all those kind of like questions to professionals in the same field as well. Thank you.
Thank you, Raphael. Audrey, based on what you've shared, would you like to respond to the question and Raphael's insights?
Yes, thank you, Hasleen. And I wholeheartedly believe agree with Raphael's insights there. And I think what I would add is that it's so important to take care of your physical needs first. And it's easy to forget those things, but good nutrition, sleeping well, and exercising regularly are so foundational to allowing the gateway for everything else to follow in a positive direction. I think it's very important to find your community and support from those around you who understand you. And finding that one or two people who the autistic individual can trust and confide in for important issues is really valuable. It doesn't need to be a therapist, a teacher, or a parent. And that person doesn't have to have the answer to the question or the solution to a problem, but they need to be able to actively and patiently listen. They need to be able to help the individual reflect, and to the extent they're able to ask probing questions to help the autistic individual understand themselves and their needs better, along with those around them. It's important to have someone around them who avoids making any assumptions and who can ask simple questions like, what can I do to help? The individual themselves should be willing to experiment with different solutions to find the ones that work for them. For example, meditation and mindfulness practices may work wonders for some for some individuals, but not really inspire or work well for other individuals. So that ability to experiment is really important. And lastly, the individual should endeavor to be upfront and proactive about communicating their needs for support and what they need to get to successful outcomes. This may involve support from those around them who know the individuals best in terms of practicing and articulating what those needs are. This is particularly important in a workplace environment, but also in other settings like school and extracurricular activities. There's a lot of misinformation and assumptions out there, and it takes educating on the part of the neurodiverse community to allow those around us to better understand our needs. And at the end of the day, meeting basic human needs is fundamental to managing stress, overwhelm, and anxiety.
Thank you so much for that very thoughtful insights. We shall move on to question number 6. And I shall direct this question to you, Dr. Teresa. How can policy changes help create more autism-friendly healthcare systems? And what best practices have been seen in different parts of the world?
We need policies that really are going beyond awareness and actually are funding solutions. Some countries do have sensory-friendly hospitals, integrated mental health services, and multidisciplinary care covered by insurance or government programs. And even if these systems aren't perfect, they at least provide a path to diagnosis and support, because we're taking a world lens here. And being that I'm sitting in the US, I can tell you we don't have that, and not every country has that. In our country, insurance is tied to employment, so access depends on the quality of your job, not your medical needs. And it can also vary by region, but I do think other countries have that challenge as well, that care across regions and different provinces or wherever you are in the world could change. So sometimes families are moving from place to place to try to get better access to better providers. And one of the things that I think about where policy really could make a change is that there's really nowhere in the world where autistic informed training is a universal requirement for all healthcare professionals. The only place that I can think of is the UK has introduced some mandatory autism training for some of their providers, but not all. And so when we think about that, when we think about that our healthcare professionals are not necessarily required to understand autism or other neurodivergencies, it's going to make sense why we continuously to see gaps in our mental health care systems. There are some best practices, or what I like to call promising practices, and that includes sensory-friendly ERs in Canada and the Netherlands. Go. That's great. And we had already talked about that earlier with bright lights and the impact of sounds that Rob walked us through. There's publicly funded autism assessments in Australia and parts of Europe, right? And like Raphael said, early diagnosis is important. So if you can have access to those assessments, it's going to be really important. And it could really significantly impact positively outcomes. And then just mental health services that are embedded in primary care, which is found in Sweden and Scotland. In many countries, mental health care and your standard physical health care are not embedded together. So you often have to find specialists to get that kind of support. So when we look at the countries that are embedding these policies and requirements in their healthcare systems, we're seeing how meaningful those supports are to the autism community. And it really helps get us on a better pathway to ensure people are receiving the help they need. And so these examples show progress, but they are exceptions. They're really not the rule, especially when we look around the world. The other thing that policy could help with, not to go on a tangent, but autistic burnout right now is not recognized as a legitimate medical issue. And it's actually, when we look at the research, its prevalence is becoming more. So because of that recognition, we're also seeing those individuals getting inadequate care. Because like Raphael said, oftentimes if you're hitting burnout, they'll take you to talk therapy, which may or may not be effective for you. So if we do not have policies implemented, it's clear that institutions are less likely to act. So in the end, if policy doesn't change, the system won't either.
Fascinating. And it's about knowledge exchange, isn't it? It's a setting like this that we are probably, heading that way. Rob, would you like to respond to Dr. Teresa?
Sure. I think a good example to look at internationally is the Americans with Disabilities Act, the ADA. And the reason why I think it's a good example because it's based on inclusion and it was created by those with disabilities, even though I object to the word disabilities. I come from an arts background, so I'm going to recommend a documentary entitled Crip Camp, like Cripple Camp. And it's absolutely fascinating. It's about a summer camp that was created in the 1950s with or for children who had disabilities like polio and found themselves in wheelchairs or crutches or what have you. But I was surprised to find that those children from the 1960s, 1970s realized that they couldn't get up the stairs at their colleges and universities. And as was happening at the time, they had sit-ins, or as they call them, lay-ins. And that eventually created the Americans with Disabilities Act, and the kind of the founder of that, young woman who actually passed away a couple of years ago at age 65, was a strong proponent of that. And the reason why I mentioned that should be done is, again, we're talking about not only empathy, but inclusion. So including those, or having a seat at the table, if you will, for those who are neurodiverse is important. And I'd say the other word too is access. So in order to understand where the neurodiverse are coming from, of course, is to be empathetic to their quality of life and their situation in life. And after that is to allow them to be included in that. But it could only really happen from within, and that's why we have the Institute of Diversity, and that's why we have a global conference here now. So to advocate for them is to, and for us is to understand, and that's why we're doing this. It's coming from within as opposed to being told from the outside how it should be. And my humble prediction is the DSM is probably going to be outdated very soon. I don't know how it's going to continue as long as those who are at least from the neurodiverse arena, how it's going to continue on when neuronormative people are dictating how people should be treated.
Wow, what a way to wrap up this panel discussions with this very thought-provoking question and prediction. To all the panelists, I would love to hear from you. What one solution would you propose to improve the lives of autistic people? Julio, would you like to answer this question?
Well, at first, I wouldn't say they need to improve their life. As for my experience, they feel like their life is as complete as my life is. What we should do is just see them like our equals and let them see us as equals, just with a different point of view. Because that's all about. It's just something, it's a barrier that has been artificially mounted. I have never felt that much difference between my nephews and me, or between somebody that has a real severe autism problem and me. You just must erase the barriers that we create ourselves. That's how I think. I don't know if I'm right, but that's how I see it.
Thank you. Thank you, Julio. Let us begin with Raphael.
Thank you. Wrapping up like what everyone said, I think one of the biggest solutions could be to increase accessibility and accommodations in environments. My background is basically on UX, UI design and web design, and everything is based on experiences. And the world that we live on right now, it's more oriented to most likely major neurodiverse people that, for example, are not adapted to like the whole environment overall. So I will say like having sensory friendly spaces would be a one thing to have for all of us, like either neuro minorities, neuro majorities, as well as an entity. So, and that will goes from healthcare system, education, even things like a website to be accessible for everyone with different options to navigate. That will be a huge difference. And to utilize channels like this, for example, like this conference, to spread the words on the things to places where probably these things are not addressed like properly, could be as well helpful. Thank you.
Thank you, Rafael. Something so simple yet so impactful. Over to you, Andrea.
Well, one solution that I can share is more for us than for them. It's for us to remember and be really mindful to help, to listen, and to understand and comprehend so we can really help them. I don't see them as something that we need to handle, to fix or something. It's just a different kind of connection in us as human that we really need to understand and we really need to accept. So treat them with respect. Remember, they have a heart and they have a spirit and they have a soul and they really want to connect with us because they don't really understand how to connect with them. So we have the key to empower them and to help them in a very beautiful way. So remember, we are humans and we all need love and to be listened and to find our place in this planet.
Erin, what about you?
Thank you. So mine is that these systems weren't designed with us in mind, autistic people. And so as we make changes towards adapting the world and all the different systems we're a part of to be more inclusive of autistic people, I encourage that every policy, inclusion effort, any kind of steps we make towards creating a more inclusive, accessible world for autistic people is upholding that principle I've mentioned earlier, nothing about us without us. It was also part of the documentary that was described earlier, Crip Camp. This idea that from within the disability rights movement that our voices be central to the changes in these processes, ensuring that these policies are actually reflecting our needs and our lived experiences and will create futures that are collaborative together and that will work for autistic folks, non-autistic folks, in a more universally designed world where we can all successfully navigate it. So my end piece is do it with us, alongside us, together, and that our voices are critical to all the different steps that we take to make the world a more autism-friendly, accessible environment. Thank you.
How beautiful is that? United and strong voice. Over to you, Audrey.
Thank you, Hasleen. And I think my response is very complementary to Erin's as well. My call to action would be to challenge everyone watching today to take every opportunity they have and also to create new opportunities to actively listen and to seek to understand an autistic individual's perspective. Each perspective is different, colored by an individual lived experience. We can only improve the lives of autistic and other neurodiverse individuals by increasing societal awareness, understanding, and fluency in this area. Once we do that, as individuals, organizations, and societies, we can effectively make changes that will improve lives. And that starts with continuously listening to and enriching our understanding of the neurodiverse individual.
Brilliant. Rob, what is this? What is your one solution that you would propose to improve the lives of autistic people?
Well, it's two things really. One is to listen for the neuronormative community to listen to the neurodiverse community. And again, allowing them to speak for themselves. And the other really is to advocate for ourselves as well. It's hard to believe that only 40 years ago, 50 years ago, if a child was diagnosed as having autism, the pediatrician of all people would tell their parents to just have the child institutionalized and basically forgotten. That is over, and that has really stemmed from parents of those who were diagnosed as such saying, no, I'm not going to allow that to happen, and changing course and changing from within. We're still in new territory. I mean, this is only, for the past 40 years ago, where people are advocating for themselves, and their parents or family members are doing the same. But the changes have been profound and continue to be. I look forward to seeing what happens over the next 5, 10, 20 years for the neurodiverse community.
Such a poignant reminder. Thank you so much for that, Rob. Let's end with Dr. Teresa. What is your one solution that you would propose?
I don't know if it's a solution, but I do think it's a statement that people need to hear more. And it's that you are not alone in this, that there is support out there. And if you're having a hard time finding it, I'm looking at many faces on the screen that would be more than willing to help you. So one of the biggest hurdles I faced in my early journey before I tried to understand myself was to help my children. It was that I didn't feel the help was out there. Rob even mentioned, oftentimes you're finding out about this through your pediatrician, and it's a lot. They give a lot more problem statements than answers. And so it's not a solution, but I can tell you that one of the biggest challenges autistic individuals and their families face is finding the right resources and support. They're given a lot of resources and support. And I think my recommendation is if it doesn't sit right with you, if it doesn't feel right, then it's probably not right for you. And the experts are well-intentioned, but they're not always the experts in your experience. And reaching out to those that might have lived experience and familiar issues, maybe to direct you better than the people with the degrees behind their names. And so I really think a key solution is increasing awareness to families and impacted individuals that the mental health and community is here to support you, but with the caveat that service isn't always equal. So you don't have to navigate this alone. And organizations like ION exist to help you find the resources you need, the community you may be lacking, and to create a collective voice so that we can help you advocate for the changes you need. I just really believe that if we can come together as a community, we can not just ensure that autistic individuals get better support, but we can really make sure that we can realize the outcomes we deserve.
Yeah. Thank you so much for that. And if it's not for Ion and this recording, I wouldn't have met each and every one of you. So I really appreciate that. As we conclude this critical discussion on creating inclusive healthcare systems for autistic individuals, I'd like to express my gratitude to you, our esteemed panelists, for sharing your expertise, your insights, your personal experiences. It's clear that autistic individuals face unique challenges in accessing healthcare services, and that addressing these barriers is crucial for promoting mental health, well-being, and overall quality of life. Through this conversation, we've highlighted the need for comprehensive training for healthcare professionals, early diagnosis and support, sensory-friendly healthcare settings, and tailored mental health strategies, and a lot of empathy and kindness and listening. We've also emphasized the importance of policy changes and best practices that prioritize the needs and perspectives of autistic individuals. In the words of autistic advocate and researcher, Dr. Temple Grandin, the world needs all kinds of minds. So let us strive to create a healthcare system that values, includes, and empowers autistic individuals to thrive. Thank you again to our panelists and to our audience for your engagement and participation. As you said, together we can create a brighter future where autistic individuals receive the compassion, inclusive and supportive healthcare they deserve. Thank you so much.
Working from home must be an option for all. Taking that away discriminates against many disabled people.
The proposed solution is to support the neurodiverse with typical problems that may hold us back, and to educate and provide information to the neurotypical so that they can be more sympathetic to our needs. If they can better understand our issues, they can be more forthcoming to helping and supporting us into becoming more involved and integrated into society.
Understanding neurodiversity is a social problem that we all have a duty to address, and we shouldn't leave that problem to the people least equipped to address it. This is an inherently upside-down reality in the world today.
New inclusive hiring efforts are great, but please do not forget, we are already here. So what I would recommend is building out informal networks and ERGs to provide your neurodivergent employees with the psychological safe space to openly express themselves, to come together and exchange ideas and experiences. Please do find ways to communicate together. Let's start building a better tomorrow together.
What we need, I think, is normalize the aspect of autistic people in the workplace, having, more panels like this, higher visibility to autistic people, being seen and heard, and to show that it's completely normal to have autistic people in the workplace, and autistic people belong in the workplace and are great contributors. It will be much easier to avoid this misunderstanding.
So I think even making standard for employees within the workplace to go through some sort of diversity training would be beneficial to help set the tone for inclusive environments, be implemented in a way where it's like infused into the roots of the organization and just taken seriously. It's extremely important for people like at the top of the organization to lead by example and set clear expectations of all employees.
I think conscious efforts, because we're so passionate, I think it's so important for managers to make conscious efforts to prevent burnout. My manager, and she sometimes even has to be firm with me to not overwork and maintain my productivity rate as a result. So therefore, setting clear boundaries of what our expectations and our demands are can be very helpful.
And so when employers do their best to create an entire culture of supporting all of their employees and their differing strengths and needs, and they're creative about removing those barriers for everybody, it creates an environment where autistic employees can thrive without having to single themselves out as being disabled. And by allowing autistic employees to receive that support using those same channels of communication that every other employee is using to get what they need, I think it allows for that really true inclusion, not some separate process that we have to go through just to get what we need to be productive in the workplace.
The most important thing in this, I feel, is that neurotypical people need training for how to work with neurodivergent people. Including a primer on what the innate autistic social skills are, not expecting eye contact, interpreting questions directly and not thinking they're rude because they're coming from an autistic person, expecting neutral tones and a neutral face, and ask them about their feelings. If it's important, so if it's important what they feel about something, to accept that maybe they don't know right now, because that's the alexithymia kicking in, and they could tell you later.
Hi, everyone, and welcome to our panel discussion on inclusive education aligned with SDG 4. I'm Hazleen Ahmad, your moderator for today's 40-minute session. We have a distinguished panel of experts who will share their insights and experiences on exploring inclusive strategies for autistic students in schools, universities, and other educational establishments. Together, we will delve into the challenges, opportunities, and best practices that can help create a more supportive and inclusive learning environment for autistic students, enabling them to reach their full potential and thrive academically, socially, and emotionally. This is a mixed neurotype panel with majority autistic individuals. Our panelists are Catherine Gilmard, Mesa Obeid, Pallavi Malik, Ayanwole Boluwatife Joshua, Alia Bully, and Natasha Van Staden. Please, can you introduce yourself, starting with Catherine?
Okay, me. Hello, I'm Catherine Guimard. I am France and I'm global. I am French, raised in England. My interest with autism is that I have 4 neurominority children. Found out later on in life I was too, over 50. I found Iron at its start in 2021, October, and 1 month later I founded Iron France. To be surrounded by high-flying corporate peers has allowed me to see that I am, in fact, a global thinker, visionaire, and also to talk with peers that encourage you and support your ideas, you know, where we talk and this becomes a plan of action, has really stretched me to all my capabilities beyond any capacity I could have thought possible. I advocate for this now because I want my children to know what that feels like. Thank you.
Mesa?
Hi everyone, my name is Maisa Obeid. I'm originally Palestinian Jordanian based in United Arab Emirates. My interest in autism and sensory environment. Thank you everyone.
Thank you. Next we'll have Pallavi.
Hi everyone, this is Pallavi here. I'm originally from India but based in UAE for almost 10 years now. My interest in autism lies because I've been in special education and have been working with children for almost 10 years now, and that's how I advocate for autism. Thank you.
Thank you. Joshua, you're next.
Okay. Hello, everyone. My name is Ayanwale Bulatspe Joshua. I am from Nigeria. I'm a neurodiversity advocate, and the reason why I have like for people with autism is because I have a lot of them over in Africa, and also I study special education, so I have to deal with a lot of people like that. Thank you.
Thank you very much. Alia, would you like to introduce yourself?
Thank you. My name is Alia Booley and I'm representing ION South Africa. I'm from South Africa, and my interest in autism is that I'm a late diagnosed autistic mother to 2 autistic sons. I'm glad to say that they are thriving at this moment, but I do believe it comes at a great cost that I don't think any family should have to be. I believe that inclusivity is needed in our society, and that we should do everything that we can to remove barriers. Thank you.
Absolutely. Thank you so much. Natasha, would you like to now introduce yourself?
Thank you, Haslin. Hi, everybody. I am Natasha van Staden. I am representing ION South Africa. My interest regarding autism is that I have friends, and my closest relative, my sister, my niece is autistic. And I do believe that every single child needs the opportunity to have a better schooling and educational opportunities.
Thank you very much. So we shall move on to the question. The first question for this panel is for Catherine. What does a truly inclusive education system look like for autistic students? And how can we move closer to that goal?
Okay, thank you, Hasleen, for the question. So we often hear words like truly inclusive education, have access to quality education, but they remain just that, words. They sound good in reports, policies, conferences, and I believe they do move the needle forwards, but they lack the raw emotion needed to drive such a change. If we allow ourselves to feel for just a minute these emotions, as Alia was saying earlier on, we begin to understand what must change, and that is societal norms and expectations. We also talk of valuing neurominority children, and no, that's segregation for me, because we segregate them to include them. So no. And I think that parents in truth want their child to grow, but not suffer constantly. So I did a market research, and these are the little points that we should avoid, like transform schools into something that is more ludic, fun, and not military. Not to force, to treat us like humans and not retards, and to have caring vocational teachers, because teachers remain the pivotal point of any educational system, right? So my solutions is a project-based system where you have one project with lots of subjects included in it. So, for example, and you can start this at kindergarten, is like we'll build a pond for the ducks. So when we're building the pond, right, we're using math, then geology for the earth, then what are the earthworms, so all this biology, and we can build on this as time goes on, right? Get deeper and deeper into chemistry and physics, etc. But it's very inclusive and includes everyone, quite easy to implement, and we're moving from the academia of 19th century, where the social norm is to sit for 8 hours because we're producing factory workers, to 21st century academia, where we have to use all the tools we have at our fingertips and have a sort of more global view, not only of the project itself, but of life afterwards. I think this really will produce a society that makes it more fun for everyone, and that is more inclusive of children and people like us. We won't have to say people like us, we'll just be doing whatever it is we're doing. So to ensure this happens, I would welcome to sit on any roundtable, sit with any government official, and I wait your questions, ladies and gentlemen. Thank you.
Well done. Thank you very much, Catherine. Now I'm going to pose a question to Mesa. Mesa, what is your response to that question?
Well, thank you so much. I really echo what Catherine mentioned, like, what is truly inclusive? Is it something we just use it like as a trend, or is something more than that? When I think about really what is truly inclusive, it's a journey. We never have something like a destination. Yes, today we reach to target A and that's it, and we are truly inclusive. Accessibility and inclusivity is a journey. We need to continue improving this. But when I think about inclusivity for education, always I would like just to take it from another perspective, to think about where it's really start. Does it really start from the classroom or start from the first day for kids in the school? I believe it should start earlier and earlier. Let's check websites for school. Do we have any statements for parents that we welcome kids with autism? These are the facilities that we have in our school system. We are not asking schools to have a huge list of accessibility facilities for kids with autism. We are just asking simple question to share with the parents. What do you have? What do you offer? Just to make it very easy and simple for them when they started their journey to find inclusive school for their kids. And then after that, do they have in their social media representation for kids with specific needs, kids with autism? What do you offer? Do you celebrate these days? And then from there, in the registration day, do they come and ask you for the interview if you require specific accommodation? I want the inclusive environment or school or education that parents feel that they are welcomed and they can come and share that their kids have specific needs, autism, and this is what they require and this is the accommodation. And then from there, also, again, I echo what Catherine mentioned, why we don't have universal design for learning, why we don't include everything in one package and try to provide multiple representation, multiple way of engagement to cater for everything. And I can really guarantee if we started to think in this way, it's not only for kids with autism, this will be very beneficial for everyone, all students, everyone, regardless of their abilities and backgrounds. If I can just have a quick response how we can reach this, I truly believe in training and awareness for everyone, for school, teachers, parents, kids. Everyone should be involved and be part of the training and raising awareness.
Wonderful. Thank you so much, Mesa. We shall move on to question 2, and the question is for Joshua. How can schools, universities, and other educational establishments better support autistic students in their learning and social development, and what training should they receive? Over to you, Ayan Wale Boluwatife Joshua.
Okay, thank you so much for that question. The first thing I want to establish, the first point, is creating an ecosystem and enabling environment. Creating a supportive, enabling environment for individuals with autism, children with autism, or students with autism. If students can find themselves comfortable in an environment where their gifts can't, in an environment where they are safe, in an environment where they can express themselves, definitely they will get better. So the first thing we need to do, the first thing universities, schools, and other institutions, educational establishments, and parastatals, what they need to do is to create an enabling environment. Let the environment be more accommodating. The second thing is we have to create a personalized learning. What do I mean by personalized learning? Let the learning be streamlined to what the student really needs. The learning should be student-centered, should be student-oriented. The learning should not go above what the student is interested in. Autistic children with autism or students with autism, the learning process should be what they really want and how they can thrive more in what they want. What am I saying? I'm not asking us to always dance to their tune. No, 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 that's not what I'm saying. But we should also give them the right and the ability to have a tailored, personalized instruction. Another thing we can use to help them is creating a mental health avenue. Mental health avenue by bringing mental health professionals to assess them. Universities, colleges, institutions, we should be able to have professionals who are well grounded in mental health, where people with autism, students with autism, children or individual with autism can go over there to have a free assessment and check themselves. Oh, I'm having this, I'm having a meltdown, I'm having this, I'm having that, I need this, I need that. We should all make this thing accessible to them. With the help of this, the students will trust us most, and also they will be of their best. The last thing I want to establish is creating a social development. Social development in the sense that I can remember vividly where I'm going to making Africa as an example. There is an isolation culture for children, for students, individuals with autism in campuses, in universities, and other parastatals. Even the governments are not helping matters. Individuals with autism, children with autism, they isolate themselves. There is an isolation culture. We don't need to do this. These are some of the major problems. The best way we need to address this is let's try to bring them together. Let's encourage them. Let's create a culture that supports each and every one of them, where they can have the freedom to talk, we can have the freedom to express themselves, and they can have the freedom to express their free will. And so the second part of the question, what training do they need? Now, they need a constant training of, they can have a bi-weekly training. And also some of this is one of these things we are doing, advocacy training. If you know about autism, you have to research about autism. You have to know what autism is all about. And if you are a regular teacher, you have to build in that direction so that the students you are teaching can get in tune with what you are dispensing out. In summary, government, students, parastatals, educational institutions, and all other stakeholders that are involved, they should please provide necessary environment, personalized learning that will support individuals with autism. Thank you.
Thank you. Thank you so much. Pallavi, do you have a response to this question?
Hi everyone. I just want to agree with Joshua that the first thing is for schools and universities to be autism friendly is creating an environment, to support autism. And the first thing is, like Joshua said, that everybody has to be aware and trained in autism and neurodiversity. For that, everybody needs to know what is flexible teaching methods. If you need to make the university and school, you need to have flexible teaching methods. You need to have sensory friendly classroom, sensory environment, also assistive technology. That is really important, because with autism, like you need, like, under the umbrella of autism, you might have non-verbal students, you have other kinds of, who we are using speech to text or text to speech, visual schedules. So technology is really important. And just like Joshua said, I would like to say, for all these things to happen, the essential training and continuous professional development is really important. Teachers need to have those training. If you need to support students, you need to understand what is a person with autism going through, how is the classroom can be, with different kind of sensory issues. How can you make, like, the environment friendly? How can you have classroom accommodations? And also to have clear communication instructions and strategies. So at the end, to have all these things to be executed and implemented, training is essential.
Thank you very much. You've touched on the next part, actually, the question 3, and maybe you would like to add more to that in terms of what role do teachers and educators play in fostering an inclusive classroom, and what training should they receive? If you haven't discussed that already, please add on to that.
As they say time and again, that teachers can make or break your education. The teacher is the most important person who plays a crucial role. The teacher has to make the classroom welcomed, make the student feel respected, and also basically empower the student to succeed. For that, I think the first thing is that you for to create a inclusive classroom, you need to understand what differentiation is. To have differentiation in place, how do you differentiate your teaching learning materials, how do you differentiate your instruction, and that is really important. You need to have the accommodations and modifications in place. That is how you make a classroom inclusive. Again, you also need to have a plan in place. You need to understand that what are the individual education goals for that student, and you need to have that adapting teaching methods to accommodate the different learning styles in a classroom. So you need to understand the students, their backgrounds, their abilities, and that is how you will differentiate your strategies to make the class accommodating. And the most important thing is, for all this to happen, is again to have the training in place. So I think it's important for educators and also for the special educators to have that training in place, so you can make the environment as student friendly as possible.
Thank you. I'm very keen to hear what Catherine has to say. What is your response to this, Catherine?
Okay, well, as I agree with her entirely, the teacher is the predominant influencing factor, and that was the findings in my mini market research. And I also recall in England in the 80s at university, I had many friends that went off to do teacher training, and they came back and they said, oh, in my curriculum, I got a bathtub filled with moss and flying skeletons. And I was a chemistry major, so I was like, wow. How does that teach us anything? But I was still eager to be in that class, right? Because it sounds exciting. So when my own children went to school in the early 2000s in Paris, I was on every school board, every parent rep for kids, many hours spent in the schools. But to my very great disappointment, the French are very much, French and maths, and that's it. We cater for bits and bobs. Anyway, so if we look at the factors involved in, for me, a newer inclusive academia of the 21st century, we have to take into account the child. Okay, so when the child goes home, the child plays games. Okay, that's just a fact. So in their games, they're kings, emperors, queens. They're building cities, towns, continents, worlds. They're soldiers. So their mind is completely different to what a child was back in the day. Again, we have to change societal norms. That is really something I feel very strongly about. And there was a school I was fortunate for one of my children to attend in Bordeaux at the time, a pilot school for all of France, where this 4-year curriculum of the college, 11 plus, was done on merits and skills, not merits, sorry, skills and competencies. So the children whipped through this in 2 years. So they're ready for the next part, and they're 12. So society is just not adapted for that. We have to change what is normal in society, right? Schools, I've talked about who wants to sit for 8 hours in whatever environment. And please, do we really need to start at 7 a.m.? Again, so I propose solutions that, as I said, are project-based learning, and these projects of building the pond, we could do on different continents. For the Parisian school, for example, we could have one with a school in the Andes, different continent, different ways, and one in sub-Saharan Africa in the desert. So again, the children will learn different languages, different skills. How are they doing that? Where do they get their water from in the desert? And all these sort of different mind training skills, which is all we really want. We're not producing factory workers. We want them to be able to use all this knowledge they have afterwards in the workplace. And also because they, each child will be naturally drawn to, or I like to dig, so I'm going to, get all the digging in. I prefer to not get my hands dirty, so I'll just do the write up. Every child will find its place. Obviously, we make them change around. That's the teacher's role. And hats off to them. But I think it's more inclusive, and we can also include day-to-day activities like sewing. You can learn manual skills like knitting needles, crochet needles, a sewing needle, the fabrics, where does it come from, how's it made, in the Andes and in the sub-Saharan Africa it's completely different, in Paris, blah blah blah. And then you need the 3D when they're making jackets or the skirts. You need 3D in chemistry, by the way, so this is all really, really important stuff that you can start very, very young. So with an inclusive project base, and you have the subject matters coming in, and that's, to be determined, and teaching life skills. We're not sitting for 8 hours. We're changing the societal norms. But, we've got the world at our fingertips. When they go home, that's what they do. So let's, try and train them for that from the very beginning. And I think, for us, and all my children said to me that's what they would rather have had. And I think that's why I went into chemistry, because it's very cerebral, but I do practical lab work, right? I didn't know I was a neurominority at the time, but it still makes society as a whole. And it means that we want to be part of society, and society wants us to be part of it, because we are good at, building holes in the ground or whatever it might be. So again, waiting for any roundtables, guys. I'm here. Thank you very much.
Absolutely. How? Getting hands dirty and climbing mountains. Why not add climbing mountains to that? Well, now we're going to move on to the next question, and this is about technology. And I'm going to ask Mesa this question. So Mesa, how can technology and assistive tools be leveraged to improve learning experiences for autistic learners? Over to you, Mesa.
Well, thank you so much. I think this is one of the most important questions, because we have technology nowadays all over, in-house, outside, in modes, in the school, and in the education system. From my experience on STEAM education, I saw that the technology did a huge transformation when it comes to education, not only for kids or students with autism, but also for parents and also for teachers. If I can give you an example, I remember 5 years ago, for example, or even 10 years ago, when we used to do assessment for the assistive technology for students with autism, and we found out that they require communication support, literacy support, and also executive function support. For all of these three needs, we have to identify standalone assistive technology. And then we have to make a choice which one is the most important, because it's very hard to go to school with 3-4 devices and try to use all of these. And students sometimes refuse to use it because it looks different than other students. However, nowadays with the technology, and the most importantly with the built-in environment and accessibility features that comes as a standard with most of devices, operating systems, it makes it much easier for students and teacher and also the parents. For students, they can use multiple assistive technology in one device, and it's the same device. Also, they use it to access education and access their course materials. For teachers, it's very easy, because they don't need to learn about a new small device or assistive technology. It's the same laptop, but I need just to adjust a few accessibility features, or even I just Google it and find how I can change it. For parents, I don't need to buy a lot of devices, financial, challenge. And at the same time, also, again, it's very easy. Let me also give you an example about these built accessibility features. We have the immersive reader in Microsoft. This is a free tool, comes in all of Microsoft native apps. Immersive reader, it's changed for you the size and text spacing and letter spacing. You can change the background color and the size of and the type of the font. You can also put screen masking, and then the students with autism, they can focus on specific line or specific paragraph to focus. It has also picture dictionary. So if the student used to use communication board just to understand text and picture, it will immediately show him the difference. Also, it can translate. So imagine this is something free. You can use it exactly with the same device like other students. You have lots of options of speech to text, text to speech free for you. You can use it on your phone, your device, your laptop. We have a very nice also features, guided access in Apple devices. Like if the student get distracted while using different apps, because sometimes also technology could be a distraction for students, specifically with kids with autism. So this is guided access. You can just as a teacher just put like time, and the students need to finish the task, and then after that you would be able to use different functions or different apps within the device itself. So the technology really plays an important role to support and help them to get access to different assistive technology features for free. And parents, everyone's very easy for them to use it and to access it. Having said that, it's very important to know and to have a plan when we introduce this technology. We don't want also to add extra assistive technology or extra features that plays as a distraction more than as something to support the student. And this is where it goes again to what also Joshua said, personalized learning in experience, teacher training, parents training. It's very important to bring things in a specific tailored approach. Is not just to say, okay, we have technology, you have text to speech and use it. And I can tell you from my experience in the past 10 years, when I started to introduce text to speech or speech to text, it's not a success like from the first session. You have to plan a very tailored approach and try to use like step by step. And I can tell you, if you use this, like within like 1 month, 2 months, you'll start to see the student, he's excel in using these assistive technology, and he can show you the power of these technologies.
Thank you, Mesa. So it's not one size fits all, isn't it? You don't want to leave anyone behind, but at the same time, it needs to be personalized to the actual needs. So I think Alia will have something to say about this. Alia Bulli, what is your response to the question? Thank you.
Absolutely. I love what Mesa was saying about all of the technology that is out there. And I absolutely agree that technology can assist us. For myself personally and for other students, being a student myself, I've used these technologies within my research and my thesis that I'm writing. So text to speech, absolutely, that works. And Microsoft is now coming up with all these applications. We don't need a separate application for ChatGPT, because now I'm in the process of also working with Copilot to see what are the differences, and it's absolutely amazing. It does really take away the time, because for those learners that do have a challenge with time. So for myself, my challenge is organizing myself. My challenge is time, So if I can use technology to cut away the time in delivering a task, then why aren't we making these tools accessible to autistic learners? But then also, what Mesa was saying, we need to have a structured approach, because not everyone is the same. I have one son that doesn't take to technology, and technology does cause anxiety and overwhelm because of all these different applications. So we do need to be cognizant of not doing a one size fit all approach with technology, but then at the same time, we could leverage of training, just training learners, training students, training our teachers, especially how to use these tools as well. Thank you.
Thank you very much. Natasha Van Staden, we haven't forgotten you. We'll be leaving this question for you now. So we're off to question number 5. What are some effective mental health support strategies for autistic individuals, particularly in managing stress, overwhelm, and anxiety? A very important question. Natasha, we're excited to hear your answer.
No pressure. So for me, I think that every single person is completely different, and you need a personalized approach when you actually give them advice or tools to regulate themselves. We need to move from implement the shift from fixing to empowering an individual. And I just have a couple of points that I want to highlight in terms of regulating yourself as an autistic person. It's the number one is sensory regulation. If you know that your child or the teacher knows that a child is sensitive to sound, recommend noise cancelling headphones. Create an environment whereby you're limiting the noise levels within the class environment. The other one is emotional regulation. When my niece had a meltdown at the school, they said to her, just phone her mother so that we don't want to deal with this because it's not our problem. So post that event, post that meltdown, we actually taught her how to do some breathing exercises, because that's the one thing that we all can do. We know how to breathe, but we just don't know how effectively to breathe. And that was one of the important things. When she's feeling like she's tense, is to identify where is it in my body that I'm feeling a little bit tense, and why is it stress, and how do I regulate my breathing so that I can feel a little bit calm again. It's a journey. It's not a tick box exercise. It takes a while to actually get the hang of it. The other one is workplace and educational adjustments. Having flexible schedules in place and extended deadlines, because the majority of in mainstream, there's always the culture of like everybody is the same. When we go into university, when we go into schools, we're all the same, we're being dealt with the same, but we're actually very, very much an individual on our own, and we all process information completely differently. So it's important that schools and workplaces actually have mentors in place to improve a individual's well-being, especially an autistic individual. And the other one is around predictability and having routine and consistency. Don't inform them an hour before the time that something has changed. They're not going to handle that very well. It's about communicating effectively and communicating in not just in time, but in a specific period, so that they can process the information and actually get to the point where you want them to be.
Thank you. I like the breathing technique. I use that a lot. Joshua, would you like to, very quickly respond to that question? Yeah, thank you, Joshua. Thank you, Natasha.
Okay. What I want to add to what Natasha has said is that's creating a space, a safe space for them. We're creating a safe space. Now, a safe space in the sense that a place where they have sensory issues, or where they are burning out, or they are just coming out with their different behaviors. They can just isolate themselves, relax, have the time for themselves, and they come back. Once they come back, that particular avenue, that safe space for them, will let them to regulate their behaviors, will let them to regulate their sensory burning out, and also will give them a proper ability for them to come back. The second strategies I want to emphasize is family support. Family support. And out of research, it is well established that families or peers, friends, colleagues of individuals with autism, they don't support them enough. If it is brother, if it is sister, they just neglect them. This can add to their anxiety. This can lead to more burnout. So what we need to do is families need to round about them, support them, encourage them, and also reduce their stress. And the last thing which I want to talk about is the use of visual card or visual schedules. Visual schedules or the use of visual card. And we can improvise through the use of flashcards. For example, let them know quite well that, let them know their routines. With that, there will not be anxiety. Oh, I'm going to do this after this. I'm going to do this after that. I'm going to do this after this. It would have been registered in their brain. It's not going to be a big problem for them to be cracking or for them to be looking, oh, I want to do that, I want to do this. They will be relaxed and know what they ought to do at the right time. Thank you.
Thank you very much. Yeah, it just sometimes takes one person to have to believe and to know that, you know, there is a possibility and there's hope. Thank you very much. Excellent answers. Moving on to to our next question, going back to Alia Buli. The question I have for you is, how can collaboration between schools, parents, and autistic individuals themselves create better education outcomes? Thank you, Alia.
Thank you. Thank you so much. I'd like to approach this question when I answer it, two-phase approach. We need to look at the problem first, and then we can perhaps look at a possible solution and what the current lived experience is here in South Africa. The problem at the moment is that most of our schoolings, our classrooms are 30 to 40 learners in a classroom. So that is one teacher to 30 learners, sometimes 60 learners in a classroom. Another problem, decisions about autistic students are made without them. Schools dictate policies without consulting autistic students or their families. There are no mandatory autism training for educators, and this means that they lack the skills to create inclusive learning environments, everything that we've chatted about here. Many private schools, even those claiming to be inclusive, still fail in their leadership to understand what autism and neurodiversity is about. It's so treated as if autism and those who are autistic are the problem. And so the solution at the moment is that the only way that we can help you is if we remove you from the school and put you in a special needs school. However, the problem with that is that these schools, which are special needs schools that we have currently in South Africa, our students only have access to these schools to the age of 18. And the challenge that we have at the moment is what happens with those young adults who need to integrate into society. I've spoken to so many parents that have sleepless nights because they are at home with the young adult children, 18, early 20s, because they are not being given any opportunities to integrate into society. Solution, let's talk about solutions. For me, there's two that I've picked out. I mean, the list could go on. We could speak about this forever and for days. But we really do need to establish autism-informed school policies with autistic input. We need autistic voices that must be in every room when education policies are being made. Schools should have parent and student advisory panels to help design individualized learning strategies. And then number two, make autism training mandatory for all educators. Because like one of our panelist speakers said, the most important individual in that student's life for that 4 or 5 hours that the student is at school is the teacher. So we need to get to a point where we reframe and rethink about how we think about our autistic learners, see them for who they are, that they can add value to our society instead of putting them and casting them aside. So we do need to upskill and empower our educators and make autism training mandatory for all educators. In South Africa, teachers are not required to go or to undergo any kind of training autism specific that is aligned to the current research. And training should not be built into teacher certificate programs, but we really do need to assess. We need advisors, we need those that can advocate for autistic learners with lived experiences and actually assess and establish where are we, what is not working and how can we make this work together for the betterment of all mankind.
Absolutely. Well said, Alia. Well done. And a lot of these methods that's being used today to even assess is very backward. We need to, improve on that too. Natasha, we shall close the questions with you. No pressure. What is your response to that question?
I think Alia has covered most of the important points that from a South African perspective. The one thing that I just want to add to it is that there needs to be a level of awareness and amongst our communities, amongst the teachers, and also at a policy level. Because the narrative in South Africa is still that we don't have autistic children. We have naughty children. That's what we got. We have disobedient children. That's what we've got. And I think if you don't have the financial means or you don't have the knowledge in terms of what autism really means for your child, and you can't see, you can see the differences how your child during his development age or her development age, you are never going to know. You're just going to push it aside. And then from a perspective of engagement, I think there needs to be a regular communication between educators and the family, parents, because there's always that breakdown in communication, right? So there needs to be a two-way communication and keeping each other up to date on a regular basis. And then there needs to be that community support networks. Because within a community, if you have a network of people that you know is going through the same thing, because otherwise you feel all by yourself, like in an island, I'm the only person who's experiencing this problem. But like if you've got a community around you, I think that will actually just create a different narrative within the community, and that will spread obviously across the country and across our continent, if I can put it that way. And then the last thing that I want to highlight is what I've picked up is that we don't have transitioning plans in place for our kids. And that can be neurominority or neurodiverse children, is transitioning from primary to high school, transitioning from high school to higher education. So it's like we don't give our children the actual tools to actually transition through those processes, and also from universities to in the workplace. And that's where the struggle actually happens, because like it's a little bit messy when we're going through transitions, and it makes it so much more complicated if you are feel like you have you're not the normal child, and you've got other challenges that you're facing. So in closing, that is the few points that I want to raise in terms
Absolutely. Thank you, Natasha. And I want to plug this in. That's why we have the Institute of Neurodiversity, because, being part of this big global community across many countries, this is what we're doing. We're sharing our knowledge and taking us through all the way. We don't, look at gender or age or, it's everyone. We are neurominorities coming together to make this world a better place. Thank you so much, Natasha, for ending this panel so well. But before we go, I would love to hear one solution, just one solution that you would propose to improve the lives of autistic people. Shall we start with Catherine Guimard? One solution. And very
one solution. I still maintain the project, because then we don't have half of what these brilliant people have been talking about that are on the actual ground doing this. And I think we need to talk to G7 and move it up a notch, because we have to be present at the table.
Thank you. And Mesa, you're in the right place, Right country, what would you have in terms of the solution you propose?
Well, thank you so much. I think sensory environment and to build a standard for sensory environment in schools, attraction, airports, wherever we are visiting, is the sensory environment to start to think about it and consider it.
Thank you. And Pallavi, you work in schools. What is the solution from you for the school?
Like I always say that schools and universities are all protective environment. The world out there is not protective. It's harsh out there. So it's really important to teach those transition skills to students when they go out in the world. That is really important to prepare them with the right skills, life skills, functional skills for the adulthood and the world outside, because world out there is punishing, it's not protective. So we need to have those skills inbuilt in the students when they go out there.
Yeah. And moving forward to Nigeria, Joshua, what is your one solution for this world for autistic people?
Okay, entrepreneurial center should be built across different institutions because most children or students with autism, they are very artistic. Some of them are artistic, some of them are very gifted in the music and different. So I will support that entrepreneurial center should be built across different parastatals. And with that, we can remove the isolation culture. Thank you.
Thank you. Alia?
I'm going to take a bit of a philosophical approach here, since that I'm from South Africa. Nelson Mandela, our hero, he fought that every child has access to education. Today, 30 years later, we have children in classrooms, but it's not enough. I think that we need to meet children where they are. It's not enough that education is just accessible. It needs to be equitable. And so we need to make, if there's one thing that I could change and one solution that is actionable, is making sure that autistic voices are in the rooms when decisions are being made that impact our learners. Thank you.
That's really powerful. Getting the voice out. Natasha, we shall end with you again.
I think that upskilling our educators, because as Pallavi said,
Pallavi, yes.
Pallavi, as she said, it's basically a teacher changes your life. You're in the classroom. So if the teacher is not upskilled, you will have a completely different experience in the classroom versus a teacher that is upskilled and understand what she is dealing with in the classroom. So I would definitely training and upskilling for teachers across the board. That would be my solution.
Thank you. Thank you, everyone. As we conclude this insightful discussion, I'd like to express my gratitude to you, to our esteemed panelists, for sharing your expertise and perspectives on creating inclusive environments for autistic students, autistic people in educational establishments. It is clear that fostering a culture of acceptance, understanding, and support is crucial for promoting academic success, social integration, and I think most importantly, emotional well-being. Thank you so much. Thank you for this, and let's hope for the best.
Thank you.
Thank you, Hasleen, for hosting this. Been brilliant. Thank you.
Hi, everyone, and welcome to this panel on workplace inclusion and SDG 8, part of the
Hi, everyone, and welcome to this panel on workplace inclusion and SDG 8, part of the United Nations World Autism Awareness Day 2025. A very warm welcome to you all. And I know you're joining from different time zones, so thank you for that. I'm Ipchita Sen. I'm a steering committee member of ION India, and I'm also a co-founder at Neuropower. And I'm honored today to be moderating this discussion on how we can build truly inclusive workplaces that empower every talent equally. We know that 1 in 5 people worldwide are neurominorities, representing a range of cognitive and thinking styles. Our panel today reflects that diversity, bringing together voices from across the neurodiversity spectrum. As we mark World Autism Awareness Day, we take this opportunity to focus on how businesses can move beyond accommodation to genuine inclusion, including workplaces where autistic and other neurominorities can thrive, contribute, and lead. I'm joined today by a fantastic group of panelists who bring multicultural perspectives, lived experiences, and expertise in fostering neuro-inclusive workplaces. Our panelists today are Jeremy from Australia, Anjanea from Singapore, Katie from the Philippines, Jonathan from Hong Kong, and Madiha from Malaysia. So let's start by hearing a brief introduction from each one of them. Shall we start with you, Katie?
Sure. Thank you for that, Ipchita. My name is Katie J. Adriano, and I'm the founder of KJ Gady Solutions. And my journey in neurodiversity advocacy has been shaped by both personal and professional experiences. Now, along the way, I connected with Thrive, which is a UK-based mental health and neurodiversity training provider. And they're dedicated to helping at least one person with me greatly. So I now work with them to deliver CPD accredited neurodiversity awareness programs in workplaces across the APAC region. And beyond that, I'm also in the process of establishing ION in the Philippines. So I'm excited to be part of this discussion and I look forward to it. Thank you.
Thank you, Katie. Jonathan, if I can ask you to go next.
Hello, thank you very much. It's Jonathan. So I'm just so happy to be here with all of you today. My neurodiversity journey started in 2018 and 18 and 19. Yeah, because as I learned about myself being neurodivergent, first with ADHD and then with autism, and since then I have the privilege of sharing my lived experience, working with different institutions, and through the process, I deep dive into the neurodivergent community, working with different community members to create a new inclusive community. I'm happy to be here so sharing what we can do to create an autism-friendly workplace.
Thank you. Anjanea, shall we go to you next?
Hi, my name is Anjane Sharma. I'm 18 years old, currently living in Singapore. I'm in the last year of my high school. I'm about to enter the workforce, and I'm very, very excited to actually hear what all of you have to say in this panel discussion today. When I was young, I was diagnosed with non-verbal learning disorder and thus was classified on the autism spectrum. There was once when I came home and I said, "Look, mom, these fingers represent all of my friends. They're very close to each other, and this is me, the thumb. I'm sticking out, I'm alone, I'm not understood." And this is just an example of a trend that many neurominorities actually have to deal with. And this is what has motivated me to step into the role as the youth ambassador at ION. I'm also very glad for this amazing opportunity to share my perspectives on the world stage.
Thank you. Madiha.
It's an absolute pleasure to be here. Loved hearing all the other sharings. A little bit about myself. My neurodiverse journey started when I was quite young and I couldn't really understand it at that time. But in the end, it's always about really adapting and adopting different skill sets and surrounding yourself with a supportive team. So today, I'm the president for IO Malaysia, and I'm also the founder and CEO of Plus Vibes Group, which is a mental health platform that spans across Asia. We have over 60,000 members, and with that, I have lots to share in terms of mental health in corporates, youth, and this very much includes the relationship between mental health and neurodiversity, where we see real life cases of neurominority talent struggling to get jobs, as well as the challenges for youths and working parents who are neurodiverse. So I'm looking forward to sharing those experiences with you.
Thank you. And Jeremy, please.
Hi, everyone. I'm Jeremy from Australia, 36 years old. I got diagnosed with autism 7 years ago and ADHD 3 years ago. And I work in many different hats, as someone with ADHD tends to do. But the main one that's relevant here is I'm the founder of Focus Bear, which is an app to help adults with autism and ADHD to focus better. And I'm also doing a PhD looking at the characteristics of attention in people with autism and ADHD. Great to be on the panel.
It's so wonderful to have all of you on board. I'm really looking forward to a very engaging discussion, lots of learning, seeing that you have such varied background and experiences. So let's get started. Madiha, I'll come to you with the first question. You're a founder, you've interacted, as you were saying, across many different sectors. What do you think are the key benefits of hiring autistic individuals, and how can businesses tap into the strengths of neurominority talent?
So this is a really good question because I feel that not many know the skill sets of neurominority talent. So if I could set the stage into first sharing the unique skill sets of autistic individuals, which some might even know includes pattern recognition, includes attention to detail, deep focus, analytical thinking. This one's quite interesting. Strong ethical and rule-based thinking and enhanced visualization. Now, keep those skill sets. There are many others, but keep those skill sets in mind. And with these skills, you can already see how businesses can benefit from the strengths of neurominority talent. What we've seen today is that autistic employees excel in structured, detail-oriented tasks, and they have exceptional memory, creativity, and analytical thinking. And if I could share two examples, one would be SAP's program, the Autistic Work-Based Program, and another one is Ultranauts, where the entire company is 100% neurodivergent. And the reason being is because they acknowledge the unique strengths of four that can benefit software testing, data analysis, cybersecurity, which are all very much attention to detail and highly ethical and rule-based thinking tasks. So the key benefits you can see there, if we're looking for certain skill sets, if we're looking for certain industries, for example, those are the talents that you should tap into. And how to tap into these talents? The first, maybe perhaps companies are not even sure or not even aware on how or where to source for these talents. What we have seen companies do is access NGOs. There are many NGOs supporting neurominority talent, and that's the first step. The second would be to offer different types of interview sessions that benefit neurominority talent. And we'll move on to that, as I know that is the next few couple of questions. So those are my thoughts.
Jeremy, you're a founder too, and as you said, you wear many different hats. If I can come to you with the same question, things that you want to add?
Yeah, I'd love to. Great to hear those examples that Madiha gave. I think as well as that, it's important to think about the quote from Dr. Stephen Shaw that when you've met one autistic person, you've met one autistic person. So it's a bit hard to say that everyone is going to have all of these strengths, but that's the idea of the neurodiversity paradigm, that the benefit of engaging people with autism and other types of neurodivergence is that you get access to a different type of thinking than you would find in other parts of the neurodiversity spectrum. And it's important to have all types in there because we've got complex problems and they aren't easy to solve, and they're much harder to solve if we have groupthink. So I'm the other strength I'm going to add that was kind of touched on in terms of the rule-based and ethics is a willingness to call out when the emperor is not wearing clothes, to say when the company is doing things that don't make sense, when other people might be afraid to do that. And I think that's really valuable from a whistleblower perspective and then from an innovation perspective. And just quickly, in terms of tapping into that talent, we're going to talk about recruiting practices, but I think it's important to recognize that they're already there in your workplace, but they might just be scared to actually speak up. I definitely felt that way in my earlier career. I was afraid I'd get fired if I was transparent about my neurodivergence. And I'm really glad that my current employer is able to let me actually disclose that and be part of a community within the workplace.
I think you make a very important point about, both sides of both parties need to be brave, and it certainly needs courage and determination to make that change. I'll ask Katie. Katie, you work with a lot of organizations. I know you work in many different geographies. So maybe some perspectives that you want to add.
They captured it perfectly, like Jeremy and Madiha has mentioned. Some of it's very important to stress that it's just some of the. And for me personally, what I'm trying to do is not really put people into buckets, just like what Jeremy said. If you've met one autistic person, you've just met one autistic person. So when we do this training, we normally refer to like a DJ mixing desk. So some of our knobs are calibrated differently, and it doesn't necessarily mean that just because we have the same, setup for mixing our music, that they all have to be calibrated in the same way. So some might be turned up. So let's say for, memory, I have issues with my working memory and my short-term memory. So the blanket statement of that autistic individuals have excellent memory would be detrimental to me because I do have issues with my memory. So I'm really glad that Jeremy brought that up. And just remember that every single person has a different calibration when it comes to the strengths that we have and what we bring to the workplace.
And that very nicely brings me into my next question, which I'm going to address to Jonathan. Talking about putting people in buckets or some of these other very traditional structures and methods of workplaces. What barriers do you think autistic individuals face in traditional workplaces, and how can organizations create more inclusive environments?
Thanks for this. So I believe that one of the challenges is let's start with the recruitment process. So for example, let's say you are autistic and then you apply for a job and then and then you get assisted. Yes, you want to hire someone to help you to solve issues. So you focus on the skills. But why do you care so much about facial expressions, the capability to socialize? Yeah, and then if you if you believe that the capability to engage clients well is crucial, then why not include this on the job description? So the first challenge, the first one is you need to make the scope. You need to make the assessment requirements very, very clear, because quite often, in general, there can be challenges for the neurodivergent to understand hidden social rules. And then the then the second is I would rather say to create an inclusive environment, organizations need to be clear over what they can provide to create a real inclusive workforce. So it means commitment to sound policies, well-planned programs, well-informed people, and real inclusive place. Then it means regular stakeholder engagement, and it means that you need to create a safe space for people to share about themselves. Because what I observe is for people who are not neurodivergent, they openly talk about their neurodivergent conditions when they reach the top of the social ladder, or when they are the top members of the company. But at the end of the day, you have lots of people in the middle. Then the company needs to be operated with these people. Then 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 it means that you need to make it safe for people to talk about their needs, talk about what they can, what the companies and they can do better to create a real inclusive workplace. Because such a workplace will be highly productive, eventually getting more business from clients from different walks of life.
Yes. Uh, and I think I'd like to bring in Anjanya here. As you told us in your introduction that you're finishing school, you're probably going to look for some opportunities, maybe internships, etc. Hearing everybody speak on the panel and from your own experiences, etc. What are you thinking about?
Yes, I think everybody on the panel has given some very good points about the workplace and the inclusion ideas that can be implemented in the future. However, I think the biggest worry for me would be the barriers that autistic and us neurodivergent individuals actively face. So the main barrier here would be labeling us without actually getting to know us. There is a very, very big taboo around the word autism or around neurodivergent. And I think it's, as I'm thinking about, entering the workforce in the future, I'm hoping for a culture where people are encouraged to get to know neuro minorities, where there is basically socializing conversations and activities that happen where neuro minorities are not judged, but they are rather understood as they are in their in their senses, for all their imperfections and for all our differences. After all, we too crave deep, meaningful social relationships just like the rest of you all. I also am thinking about how workplaces can better embrace neurodiversity. As Jeremy said, when you've met one autistic person, you have only met one autistic person. This highlights how there is a difference in thinking by neurodivergent individuals, which has actually led to more innovation. We can just reference Alan Turing's innovation of the computer as an example. I would also like to highlight that workplaces should consider adopting the mindset that diversity in neurodivergence is not equal to a disability at all. And so these are the key things that I'm thinking about when it comes to me joining a workplace and me potentially shaping the future world of work.
Thank you. I think, there is a lot to think about for somebody young who's just about to enter the workplace, and what we can do different. So, of course, inclusion and that is important, but it's also important to have these people in the workforce first and foremost. So, Jeremy, if I can and come to you again, asking you about how can hiring practices, do you think, how can they be adjusted to be more accessible to autistic job seekers?
I'll throw out a few ideas, and before I go into them, I want to say that I think these changes are actually helpful for everyone. There's the principle of universal design, that changes that benefit neurodivergent people tend to actually help everyone, because we're the canaries in the coal mine. Interviewing and going through through the recruiting process is typically a very stressful process. I think it's more stressful for us, but if we can look at the hiring process from one overarching principle, which is the principle of least surprise. We should try and map it out so that job seekers know exactly what's going to happen. Jonathan pointed out how important it is that the job description be accurate, that if you really need someone who's going to be incredibly gregarious and go out in a sales role, then make that clear. And don't just say, we need excellent verbal communication skills. Make it really concrete about exactly what does someone need to do. Do they just need to talk to their colleagues from time to time? That's fine. If you want me to go and talk in front of 20 people every day, that's going to really tire me out, and I don't want that job. So that's number one, update the job description, make it super concrete. Number two is to send the interview questions in advance. And people might worry about that isn't that going to let people cheat and prepare for it? But that's kind of the point, that if you want to hire someone who's really good at impromptu speaking, then hire a stand-up comedian. If you want someone who's going to be a good programmer or a chef or something like that, I don't think impromptu speaking skills are what differentiates them as a candidate. So if you let them know what they're going to be asked in advance, they can prepare, they can come up with some good answers, and you can still ask them drill down questions afterwards. And the final point I'll suggest is underemphasize the interview process and instead look at ways that you can assess someone's competencies through work trials and skills demos. I think that's a far better way of assessing someone's competency. And that's what I do when I'm hiring people for my company.
You make some really important points, Jeremy, there. I think any of us who have been in the corporate workspace, we know the cookie cutter, cut and paste job description that goes out. So yeah, absolutely. That's really, really important. And Madiha, can I ask you, you mentioned earlier on that you have some thoughts about this. So over to you.
Definitely. Just like Jeremy mentioned, I seem to feel like the reason companies don't hire autistic individuals is because the current interview structure, if I may say so, is not very kind to neurominority talent. And the reason being is because, it's very impromptu. It's very, I would say, tense. And what we've done here is that we do have therapists, specialists who are certified in as a counselor, as a psychologist, as a psychiatrist, but we give them task-based assessments. So yes, they do come for a physical interview session, and that's where they share that they are either autistic or they are a neurominority talent. And that's where we're like, okay, but what are your skills? You're certified, right? Okay, that means you can provide the services. Okay, let's give you a session to do it. And some of the sessions are chat-based, so virtual therapy. And we've seen some exceptional, amazing therapists who have scored, I would say, close to 5 out of 5-star ratings, because being able to show empathy through text-based is their skill set. But in other places, when it requires face-to-face therapy, they don't excel. Now, it's about identifying the strengths and weaknesses there. So that is something that we do see. So in terms of hiring practices, in our case, it's about task-based assessments and programs. I do believe giving them the questions in advance does prevent anxiety or nervousness and all these kind of things, which is the same case in any individual. So allowing this kind of leeway and allowing this kind of flexibility for neurominority talent, that's where you really get to see their strengths rather than, amplifying their weaknesses. So it's about adjusting the hiring practices, I do believe.
Right. And if we move on from hiring to actually then what happens once you're in the workplace, because hiring is one thing, and then we did talk a little bit about inclusion earlier on, but I'll come to Katie. And Katie, if I can ask you, what workplace accommodation can make the biggest impact on the productivity and well-being of autistic employees? What can companies do better?
I just want to quote what Madiha said earlier, like, to hire individuals who are neuro minorities. Most of the time, people think that it has to be something that requires a lot of money. But most of the time, actually, at this point in time, there may be neuro minorities in the workforce that are already there. They're just not aware of it. So for me, like the most full accommodations are often low cost yet highly effective. So having a supportive leadership and mentorship, a neurodiversity aware management style that offers, structured support. If the company is able to get a workplace need assessor to give them recommendations on what a neuro minority individual in the workforce would need, and then the leader and works with the individual with regard to opportunities. I've experienced before where we have people forcing people to get a promotion but never really ask the person, do you want to a people leading position, and they get forced to be into this role of a manager just because of their performance without asking the person, is that something that you want? I've been in organizations like that before, and it was really difficult to manage because right after that's been done, I ended up leaving because I didn't want that. You didn't talk to me. I know higher pay, but that's not what I'm here for. And then the second one I could think of is, and Jeremy touched up on this earlier, instructions, breaking tasks into manageable steps, and avoiding sudden changes without notice. Like, I know that the business world, it's important that you acknowledge that it changes rapidly as much as possible. If it's something that's related to task of a neurodivergent individual, please send notice or let the person know that there will be changes. I'll leave the others for additional ones.
Jonathan, if you want to add to that, I know we discussed this a little bit earlier, and you have some interesting thoughts in there. And Anjanea, I'll come back to you. I'll come to you after Jonathan. Yeah.
Yeah. So I would like to highlight this point is social events in the company. When I work for another organizations, and then upon disclosing my neurodivergent conditions, I met with the medical board, and literally I will assess my readiness, my mental fitness to work, and then what recommendation could be provided to me. And then one of the recommendations was, don't make me feel obligated to join any social events in the organizations. And then and then there was the Lunar New Year banquet, and then I decided to join. Uh, and and then I told people that I enjoy food, and I enjoy eating different dishes. And then it got me thinking that and I mean, all the companies, be them large or small, organize social events from time to time, or team retreats or other forms of or different forms of events. Then let's make it inclusive. Then it means that invite your new divergent team members to be a member of the committee. Make something fun, make something inclusive, and this process can help the team members to learn more about each other, eventually enhancing staff morale. So and then the other point that I would like to add is workplace productivity assessor. Then in for some companies they provide career coaches, for the companies they hire occupational therapists, clinical psychologists, or industrial psychologists to do the assessments. Their professional expertise is valued, but equally important is to have the voices of the neurodivergent heard. Because at the end of the day, these professionals are great. They, however, they make recommendations and the company decides. But equally important is if you care about the neurodivergent team member, his or her voice.
Yes. That's an important point, right? It's just not about letting you choose what you want to participate in, but also to make it such that you do want to participate in some of the things that you like. Absolutely. Anjane, you had a point to make. Yes, briefly, please.
I would like to highlight Jeremy's point about the current status quo of interviews and how I feel like they are personally a bit too cookie cutter. And that is something that definitely needs to change in ensuring the workplace is both inclusive and actually ensures the well-being of employees who might be different from the rest. I think that just because you don't turn out fine in a cookie cutter system does not mean that you're incompetent. You may just not be a cookie. They may be a cake, but ultimately the autistic and neurodivergent employees are definitely just as good. I would also like to again reiterate my point on how different thinking and thus innovation within the company is something that must be valued. So getting to actually know and understand the inner workings of the brains of neurodivergent employees through spending time and not judging is also something that is very important. When I step into the workplace, I would like to see counseling sessions as well as spaces for me to self-regulate myself during the workday. Such spaces can include rooms for meditation and potentially gyms that will allow neurodivergent individuals like myself to actually let off their excess energy and steam before dealing with the work tasks. I would also like to highlight an example yesterday that highlighted how big tasks can be very, very difficult. Yesterday, I was still starting my preparation for today's panel and I was absolutely freaking out. I was breaking down. I was wondering how am I even going to do this? And I had half a mind of backing out. But my amazing mother here helped me break down the task. And actually, because of her and the help in breaking down the task, I'm able to be here and deliver something hopefully of quality. And that is something that will happen time and again to other neurodivergent individuals. So I please pray that employers will continue to help employees break down the tasks into simpler bite-sized chunks so that neurodivergent individuals can actually deal with it as things come along. I would also like to highlight the importance for streamlined communication. It is very difficult for neurodivergent employees to have to deal with many things coming from multiple platforms. And it might make sense for either companies to send the same thing across all the platforms or consider switching to just one platform for all communication purposes. Thank you.
Thank you. And absolutely, I think, the point that you make about how tasks can be handled by different minds, they handle it in different ways. And that's a bit about organization, culture, and the genuine inclusion as we like to refer to it. So maybe if I come to you, Matihar, and ask you this, how can organizations shift workplace culture to value neurodiversity and move beyond mere compliance and just checking the box to genuine inclusion?
So I love this question because it taps into what Jonathan and also Anjanea mentioned, which was the voices being heard. And by the way, Anjanea, you're doing an amazing job. Really good insights. So yeah, you can take that deep breath, I can see. But in the end, it's always about communication, hearing the voices, giving the opportunity to speak out. But it also comes from top-down approach, which is the leadership to employee approach. A lot of the communication around issues that are stigmatized, I would say, or there's a taboo, whether it's mental health, whether it's neurodiversity. The communication around those topics in the workplace is very much limited. So people generally don't understand. And when you don't understand something, you just simply avoid it. So I would say the shift has to be consistent in the sense where communication on neurodiversity is ongoing, where you get to hear neurodiverse talent speak up and share what they are good at, their strengths or their weaknesses, or perhaps what makes them comfortable or uncomfortable, so we understand better. And it's also about the last one, which was what Anjaya mentioned, which was the counselors. Having counselors to support not just neurodiverse talent, but every single individual. And in that sense, it's accommodating to everyone in the workplace. So it all goes back to communication, whether we're willing to have that consistent communication from top to down approach, where we prioritize, where we acknowledge, where we see and hear all employees and not just those who are slightly more open or louder or more stand out more. So it's about giving every single person a space in that organization.
Voices, so to be heard. What else, Jeremy? What other accommodations, what other discussions should organizations be having to move to genuine inclusion?
Find this a really hard question to answer because I don't understand culture in general. It's one of those, basically, the way that I've heard culture described is the unwritten social rules, which are the ones that I can't understand. And that's why I think it's actually really helpful if we can begin by trying to articulate what is the culture, what does it actually look like, what are the values as well, and go beyond things like equality and detailed work, make it really clear about what does that look like on a day-to-day level. That's what helps me. And the other thing is, Jonathan talked about social events, and they're often a key part of organizational culture. It's partly how I interact with my colleagues day to day, but it's also about if we do a team building event or if we have a social function, how can those be made more neuro-inclusive? What I find really hard here in Australia is that there's a lot of emphasis on drinking events as a way to bond. And I don't like them for several reasons. Number one, I don't drink. Number two, I don't like really loud spaces. And that tends to be where it happens. We'll go to a pub and I feel overstimulated and I feel worried about people saying inappropriate things because they're drunk. So I really support what Jonathan was saying about letting neurodivergent people feed into the agenda for those social events. Because the ones that I really like are when my colleagues and I went out for a walk together and I could have a chat with one or two people. That's manageable for me. And that meant that I got to know them and I did feel included as a result of that.
And it seems like these are, very manageable things that an organization can do. It doesn't seem like it's very difficult. And absolutely, what is culture? If you and especially for organizations that are working across countries and languages, etc., it is so important. Anjanya, if I can very quickly come to you on this, anything that you want to say about inclusion very quickly?
I would say the matter of shifting from compliance to inclusion is just about a mindset change. I strongly support all the points that were raised before, such as a less cookie cutter infrastructure, top down approach from leadership down to the employees, as well as destigmatizing the neurodiversity and communication, strength sharing, and understanding. There have been so many brilliant points. But I think the mindset shift is the most important. As I'm referencing my thumb analogy, let the organizations think of the world like a hand. It is the differences in our fingers and and the differences that our thumb shares from our fingers that actually make the hand unique, make the hand able to function and basically help humans do things that are really important to them. Just like that, it is the differences from individuals to individuals that actually allow for a diversity of perspectives, ideas, and innovations to actually happen. And that diversity is what makes the world a better place, and it's actually what makes us human after all. So that is something I would like all corporations and companies as well as employers to actually think about when they are hiring, so that hopefully diagnosis and being neurodiverse will not negatively affect someone's reputation in the workplace or affect someone's chances at actually getting that job that we all need. Thank you.
That's really, really well articulated, Anjanea. Thank you. Thank you for that. And I'm coming to the final question on this panel. We talked a lot about, what the gaps are and what we can do to improve. Jonathan, if I can come in and ask you, are there some companies, what are some successful case studies that you maybe have come across or you've experienced that have benefited from hiring autistic employees?
Okay, let me give you two examples. So the first one is from an international NGO named Generation. It has an office in Hong Kong. It's funded by McKinsey. In Hong Kong, it has a special program. It aims to provide in Hong Kong. This is what we call special education these young people with opportunities to work in the IT sector. I had the privilege of delivering a presentation for the program participants, most of them being neurodivergent. Simply say, there are tech companies writing the curriculum and delivering the curriculum, and Generation serve as a bridge between these content providers and employers. And what I found out is, for lots of the graduates, they have chances to join the newsletters, and then through the process of working with different companies, most of them being a small and medium-sized enterprise, these graduates manage to boost their confidence, and then upon graduation, they take up jobs, and then through the process, they learn about how to talk about their needs, how to really work with different different colleagues, and then the colleague themselves also came to realize that for some of these neurodivergent colleagues, the reason why they may need more time in order to feel as a part of the company is because of the past experience. And then at the end of the day, working with neurodivergent, it's not necessarily about working with neurodivergent individuals. It's really about getting to know the people in your workplace. And then the second example I can give is Rosewood Hotel in Hong Kong. It has an Italian restaurant, and it has the program with a local NGO named Love Express. And autistic individuals get trained. They get on-the-job training in the Italian restaurants. Some of them get hired by the restaurant at the end. And then to facilitate the successful employment of these autistic individuals, the hotel organizes neurodiversity or ASD related training for the restaurant team members. And then through the process, both sides learn more about how to embrace each other, and then for the more experienced team members, they also become not more than just comfortable, but they also learn about how to work with the autistic colleagues through effective coaching. So simply say, it's really about cross-sectoral collaboration, assistance after employment, So and then follow and then tracking the progress of these autistic talents and share the story with the community.
I mean, we've been talking about this, right? That change can only happen if you are ready to make that change up here and in your heart, a little bit of mindset change, a little bit of wanting to collaborate and embrace different ways of thinking, right? Katie, if I can come to you.
I think it was Madiha who mentioned it earlier. She mentioned SAP, that German IT company. In the US, there's JP Morgan Chase. So if you do a nice little quick Google search, there are several studies there. In the Philippines, the Autism Society of the Philippines has worked with several organizations like corporations to provide work for people who are autistic, and they provide training, and they also provide like boutique programs with the company, boutique workshops and training programs for the organizations that they work with. So when Maria said earlier that it is there, that it's available to provide, um I'm sorry, to source neuro minority individuals to join the workforce, we just really need to have to look for them. The support is there, the hunger to help the community is there, mostly because um the unemployment rates among individuals with autism, I just checked it, in 2025 are estimated to be alarmingly high, ranging from 50% to 90%. And so plus, majority of the case studies that I've seen are in the US. And with everything that is going on, I'm just hoping and praying that these programs do not stop. These programs that truly help the autistic and neuro minority community will continue. And again, what you just mentioned is about mindset. It's about going back to respecting each other as human beings. So if we just realize that we're all humans, I truly believe that the world would be a better and safer place for everybody, while acknowledging, our differences.
We are running out of time, but I would still like for all of you to just do a quick 30-second closing statement, because we talked about a lot of things. It seems like voice, collaboration, mindset, courage. These were some of the things that we were talking about. So, quick 30-second comment from each one of you. Jonathan, if we can start with you.
Thank you very much. So simply say, for neurodiversity friendly or autism friendly workplace, there are three ingredients: cross-sectoral collaboration, flexibility, and commitment. They are all. I mean, it takes the whole. Not the whole village, it takes the whole community to work together.
Thank you. Madiha.
I think from this conversation, you already see the real life perspectives and experiences. We often think that, accommodating to, there's a perception that we have to accommodate differences in view that it's a weakness, but actually it's more of understanding the different needs and the full potential of neurodiverse talents. And I do feel that sometimes companies feel that, oh, it's only the huge companies and MNCs that can do something about it. But actually every single small company, SME company can accommodate. It's just about the awareness. It's about knowing where to find, and it's about knowing what kind of specific skill sets you actually need. So I do hope that with this advocacy program, more companies will start to explore, more companies will have a different perspective of neuro-minority talent.
Thank you. Jeremy?
What I'd like to leave with is what I mentioned earlier around universal design. that it's important that these type of accommodations, changes to both the recruiting process and the experience of work, aren't limited to people who have a diagnosis or people who are prepared to disclose their diagnosis. I really struggled in my early career because I didn't know that I was autistic at that point, and I would have actually really benefited from some of the accommodations that we've talked about. And there are many people who are only getting diagnosed quite late in life. Organizations can help them by making sure that these changes are applied to everyone, because they don't just help autistic people, they help everyone, regardless of if they're neurodivergent or not.
Thank you. Katie.
So for me, I believe that inclusion shouldn't be limited to a few industries or regions. It's something we must all commit to, especially in the APAC region where awareness is still growing. So taking real action to make workplaces genuinely neuro-inclusive for everyone requires fostering a culture of genuine understanding, something that is not just surface level because it's written on a piece of paper. With regard to accommodations, um, programs like this around the advocacy and awareness building will help provide accommodations in countries where it's not available because of the restrictions in the law. So I'm glad that there are programs like this to help people realize that it's not that hard to think about how we can support the neuro minority community. We just need to get together and get it done.
Last but not the least, I want to come to Anjanya, who really, at 18, he's coming into the adult world. And what is the world that we are, going to show the new generation as they come into the workforce? So last comments from you, Anjanya.
Thank you. I would like to highlight the role that every single company, individual, employee, and employer would play in actually fostering positive change, especially SMEs who make up the bulk of employment in countries like Singapore. If I could close off with one thing, I would like to say embrace and do not label. After all, there have been many, many instances of diverse individuals contributing to innovation that has shaped our world. I hope that our current initiatives will continue and that there will be many more initiatives to help the world achieve UN SDG 8 about inclusion, especially when it comes to neurodiverse individuals. I also hope to see ION Philippines get off the ground very soon.
Thank you so much. And as we close today, thank you to my wonderful, wonderful panel today. So as we wrap up, one thing is really clear. Inclusive workplaces are for everyone. They benefit everybody, neurodiverse, minority, neurotypical, everyone. We've discussed barriers, progress, and real steps that organizations can take to move from accommodation and true inclusion. I think this is a term that comes up often in our discussions about what is true inclusion and how do we achieve it. And awareness isn't enough. Action is what drives change. We talked about courage. It's about changing mindsets, rethinking workplace culture, ensuring that neuro-minority talent isn't just included, but truly valued. So thank you, our panelists today, for your insights, and for all of us here. We hope to do better as we go forward. And thank you, everybody, for being a part of this conversation on World Autism Awareness Day. Let's keep the momentum going, everyone.
Hello, everybody. I'm delighted to be here today. I'm Charlotte Voller. I'm the moderator of the panel on the SDG 10, Reducing Inequalities. Our panel for this session is a mixed neurotype panel with most non-speaking autistic people. Our panelists have written up and pre-recorded their responses to the questions using AACs or augmentative and alternative communication tools. Welcome to our panelists. Panelists are Aditi, Tarun, and Elizabeth. Aditi and Tarun are from India, Elizabeth are from the US. I'm going to have Aditi introducing herself briefly.
Hi, I'm Aditi Somaranarayan. I'm 19. I am an author and I write slice of life stories. Incidentally, I'm a non-speaking autistic and I use Avan, a text-to-speech app on my iPad to talk. Now, did that statement make you do a double take? Welcome to the land of non-speaking autism. I, along with my friends Elizabeth and Tara, hope to spend the next few minutes bustling a few myths and talking about all of the things that could be done differently to enable us non-speakers to learn, work, and live to the best of our ability.
Thank you so much, Aditi. And for Tarun, I'll read out your biography. I'm Tarun Paul Matthew, a 19-year-old non-speaking autistic adult from Kochi, India, who types to communicate. I consider myself to be a free thinker and a totally peace-loving individual. I enjoy everything connected with music. Something that interests me a lot is studying math, and poetry is another fascinating hobby. I'm a keen observer and student of the natural world and love watching nature documentaries, especially about life underwater. I'm passionate about advocating for my community of non-speaking autistics, Purple Ambassador, Autism Conclave, National Trust New Delhi, and panelist at India Inclusion Summit, Bangalore, co-author, Talking Fingers, and Voices of Non-Speaking Indian Autistics. I was selected for the International 100 Youth Ambassador Program in 2024. Welcome, Tarun. And Elizabeth, would you like to introduce yourself?
Hello, I'm Elizabeth Bunker, Executive Director of Communication for All, a charity with the mission to ensure non-speakers with autism worldwide have access to communication and education.
Thank you very much, Elizabeth. Elizabeth also has a LinkedIn group with us that's called Communication for All, should anyone wants to join that group as well. So we have 10 questions we're going to go over, and each of our panelists will answer them in turn. So question 1 is, what are the biggest misconceptions about non-speaking autistic individuals, and how do these misconceptions create barriers to equal opportunities? Aditi, if you would start with your thoughts on this, please.
Honestly, what exists is a laundry list of misconceptions about non-speaking autism. The biggest one of them all is that we possess less intelligence and do not quite understand much. Trust me, nothing could be further from the truth. What we have is an inability to talk, not an inability to understand. Just like a small percent of neurotypical people have intellectual disability, a small percentage of non-speakers have intellectual disability too. But the assumption that every one of us does is erroneous and dangerous. Because we don't have access to appropriate education and work opportunities as a result of this assumption.
Thank you very much for that thoughtful reply, Aditi. Tarun, what do you feel the biggest misconceptions are?
The biggest misconception is that non-speaking autistic individuals do not understand anything, that they don't feel anything, can't think for themselves, not even give ear to listen to someone communicating with them. They are looked at as medical mysteries to be solved. This highlights a belief of them not to be looked at as people even. Foolish to think then that it would be easy to open some equal opportunities for individuals who are non-speaking autistics. Only barriers in their paths. Others on the list of misconceptions are that we wouldn't love socializing, like solitude, that asking to stim only indicates our lack of interest in socializing and that we are totally lacking in manners and rude.
Thank you so much for that. That's great insight. We can wrap it all up in the end of it. And yeah, those are bad misconceptions that are being met all the time. So thank you so much for spotlighting that. And Elizabeth, what's your response to the question, please?
Hello, I'm Elizabeth Bonker. The biggest misconception about non-speakers with autism is that we have an intellectual disability. We have a motor disorder called dyspraxia, not a cognitive one. We may not be able to always control our bodies, but our minds understand everything going on around us. I learned to type when I was 5 years old, was mainstreamed in first grade, and today I live a happy, productive life. That is what our nonprofit, Communication for All, is working on to make possible for all non-speakers. You can teach non-speakers to type with our free resources.
Fantastic. Thank you so much for that, Elizabeth. It's interesting that you're all experiencing exactly the same, and that's definitely something that needs to be addressed around thinking that you have an intellectual disability, which is not the case for any one of you. So question 2, how has access to AAC, which is short for augmentative and alternative communication, devices and communication boards impacted your ability to express yourself and participate in daily life? Elizabeth, would you start with your thoughts on that, please?
My life went from hopeless to hopeful when I learned to type. Schools routinely give students a so-called talker device, AAC, with pictures on it. We support this approach for very young children, but all students that are 5 years and above should be given the opportunity to learn to type. We have so much to share with you, and we need all 26 letters to do so. I access my AAC with the support of a communication partner. AAC is critical to expressing myself in advocacy presentations, books, and music, all with the mission to free non-speakers from suffering in silence.
Fantastic. What a good solution that all 5-year-olds should be given an ability to type. Great, great solution. Taron, what do you feel about this question too, please?
I am looked at as a person, as a capable individual like my peers. That instantly not only changes others' perspectives about me, but it also leads to them making changes through their actions. Nothing would have opened more doors for me to participate more in life than me telling my story using my AAC device.
That's so good to hear. Thank you so much, Taron. And Aditi, over to you, please.
Communication is a basic need, and not being able to communicate is super frustrating. But speech is not the only way to communicate. There are multiple ways in which a person can communicate. I communicate by typing on Ava. This is my voice, and having a voice is very empowering. It has helped me express my knowledge and my interests. It has helped me carve my identity.
I love that. It has helped me carve my identity. And you certainly have a very big identity, Aditi, for over the years I've known you. So question 3, what challenges do non-speaking autistic individuals face in accessing AAC tools or other communication tools? And how can we improve affordability and accessibility? If I can start with you, Taron, please.
This is challenging due to the costs involved, as well as lack of awareness. Having smartphones gives many people better opportunities, but need for professionals who are trained to support non-speakers can become the fine line between access and active use of AAC. Look to give money to buy AAC tools. Make sure all professionals get trained to support AAC users and train parents too. Much needed is to create awareness about AAC tools and highlight AAC users.
Fantastic. I'm hoping that us doing this, that you are telling your story to the whole world in this event is going to help that a lot, hopefully, Taron. So, Aditi, what do you feel about this?
The biggest barrier to accessing AAC stems from the myth surrounding AAC, the myth that introducing an alternative mode to communicate will take away the initiative to talk. And sadly, this is a myth that is promoted by some therapists. We don't talk because of the inability to talk and not because of an unwillingness to talk, speech, and communication are two different things, and AAC aids in communication. The biggest way to remove this barrier is to address this myth, especially among therapists, so that they stop discouraging the introduction of AAC. At least from the perspective of India, the availability of less expensive tablets that support AAC apps, combined with few CSR initiatives, have made AAC more affordable and viable. But I do believe that providing tax cuts on tablets purchased for AAC will also help in making AAC more affordable.
Fantastic. Thank you so much for that, Aditi. And Elizabeth, I'm sure you have a response to this as well, as you engaged with this already.
Colleges like Rollins, Harvard, Columbia, UCLA, and UC Berkeley are leading the way for the inclusion of students who type to communicate. The enormous challenge we face comes from K through 12 schools that routinely deny non-speaking students access to their AAC of choice. The Americans with Disabilities Act is clear in mandating effective communication, giving priority to the student's choice, yet schools force families to fight for years in court. Communication for All is working to change this discrimination, so every typer can access mainstream education, which is their civil right.
Fantastic work you're doing at Communications for All, Elizabeth. Really well done on this. That's spot on. So question 4, how can schools, workplaces, and healthcare providers integrate AAC and other communication supports to ensure inclusion of non-speaking individuals? If we can start with you, Aditi, please.
I think the use of AAC for non-speaking autistics should be as normalized as the use of hearing aid for the deaf or braille for the blind. Schools should normalize the use of AAC in the classroom very organically, so when the others answer a question orally, the AAC user should do it using their device. Of course, this does involve sensitizing the educators about different aspects of using AAC, like the fact that it takes longer to type than it does to talk, so we need to be given that time and space. Communication boards are an excellent way to make schools, colleges, playgrounds, hospitals, public transport, and more accessible to us non-speakers.
Yeah, communication board is such a simple thing that is actually possible to put in places public if you're out. Even non-speakers have times when they can't really speak. A couple of times I've been in hospital and I literally couldn't speak and tell them what I was feeling and the pain and this, and there was no way, no help, no ability to actually express it, which I found very difficult to deal with. Elizabeth, what do you feel about this?
We need to accept typing as equal to speech, because typing allows us to be educated, to find meaningful work, and to get the healthcare we need to live happy, productive lives. When schools deny us access to our AAC, we are not able to be educated, and our lives are filled with unnecessary anger and frustration.
Thank you so much. Really to the point. That's great. And Tarun, what's your response to this question, please?
Perhaps they can start off by creating awareness about AAC. They need to highlight regarding use of AAC not just by people with disabilities, but also so commonly by everybody. Lots of people make use of hand gestures while communicating. Most people use text to communicate today. All AAC. This needs to be emphasized more. Schools, workplaces, and healthcare providers can have programs for their employees to experience using an AAC themselves. Look to also state publicly that they support AAC users.
That's amazing input. Thank you so much for that, Tarun. Really good input. So question 5, what are some of the most effective communication tools or methods that has worked for you? And what advice would you give to those just beginning their AAC journey? Over to Elizabeth first, please.
If you know someone who has minimal speech or can only say rote words and phrases, please go to our website Communication for All to find everything you need to teach them to type. Our C4A Academy has written lessons, instructional videos, a Facebook group with almost 1,000 members, and the stencils you need to get started. We start with stencils rather than a keyboard because the letters are bigger for us to learn how to reliably touch them with coaching and practice.
Thank you. Thank you so much. And Taron?
I have high degrees of general anxiety that only shoots up when typing to communicate, hence communicating complex thoughts. For that, I use typing on a keyboard, on screen or physical, both work fine. I only use my right hand index finger to type, as using both hands and all 10 fingers is not possible because of the amount of motor coordination involved. Presently, I use Proloquo 2 Text, Cough Drop, Speech Assistant, and Avast AAC applications for typing. I'm likely to use mostly gestures for simple day-to-day needs. Gestures limit me in the content perhaps, but don't make me as anxious as typing. To my fellow non-speaking autistics just starting on the AAC path, I wish to say this. You have a long road ahead. Be very strong and brave. Never stop believing that you can. Fall many times, but be courageous and never fail to get up, always to try once more. Never give up trying to slam the belief that non-speakers cannot understand, cannot feel, nor think. Just remember your fingers are mightier than all the speaking people in the world.
That was beautiful. Thank you so much, Taron. And Aditi, what are your response to this question?
Technology-based AAC works the best for me. I type on the keyboard mode in Avan. Besides providing me with a voice, it has also made typing on a laptop and using the phone so much easier, since, well, the keyboard is pretty much the same. Text is how emails, WhatsApp, LinkedIn, and most social media apps work. In effect, staying connected and networking has become so much easier. The key to using any kind of AAC is consistency. AAC is not something whose use is limited to classes or therapy centers. It should be organically used across environments.
Thank you so much for that. The next question, which partly you have already touched on, Taron. So how can society shift its mindset from focusing on speech as a primary form of communication to embracing diverse ways of expressing thoughts and emotions? Maybe you will start with this, Taron, please.
Maybe by presuming communication does not effectively happen through speech alone in today's world. People communicate using text much more than speech. The only reason why social media is booming most. Once we get people to realize this, likely, it will force society to change its thinking, looking to give equal importance to the other modes of communication instead of speech only.
Perfect. Yes, I agree. Aditi, your thoughts on this question?
This is a good question. All it takes is a shift in the society's mindset. And this shift is not all that difficult to achieve when we take a minute to think about how much time in a day does a neurotypical person spend using text to communicate and just be effective at what they are doing. Email, WhatsApp, Discord, and all networking and social media apps like LinkedIn and Instagram are text and picture-based. When people use so much technology and text to communicate every day, why is there so much of hesitation to give us autistics an alternative and reliable mode of communication? We don't talk because it is very difficult for us to talk. Not because we don't want to or we don't understand enough. The day the larger stakeholder group is able to understand this better, the access to AAC will become more seamless.
Fantastic. Thank you so much. Thank you so much for that, Aditi. Certainly, you and me are communicating on social media every day, which I always enjoy doing. So it's absolutely right. There's so many different ways. And finally, Elizabeth, what's your response to the question?
We need to change the way the world sees non-speakers with autism. We are making progress with movies like Spellers and Michaela's Voice. You can watch Spellers on YouTube. Non-speakers have so much we want to say, and no amount of speech therapy will get us to speak. It's just like the New York City school system telling my cherished friend and mentor Judy Human that she had to walk to attend school. Some of us cannot walk and some cannot talk. Embrace our differences.
Absolutely. That's why we need to get to all of us to embrace all our differences. So question 7, what role do families, caregivers, and educators play in supporting non-speaking autistic individuals in developing and using communication tools effectively? If you would start with that, Elizabeth, please.
Families and caregivers are the primary force that unlock our silent cage. That is why we offer C4A Academy to families around the world, free of charge. We just returned from an advocacy trip to Calcutta where I presented at the Parivar National Conference. Parivar is a parent-led organization for families with autism and other developmental disabilities. We received great interest in C4A Academy for teacher training and for Parivar families. Families around the world are giving non-speakers a voice.
Thank you so much, Elizabeth. Those are fantastic resources that Institute of Neurodiversity also lift for people to look at and use. And they're freely available, as Elizabeth says. I think that's really, really important, that people use what is available already. Taron, what do you think about this?
Most important role that they can play is to be a good role model and to also remember that every non-speaking autistic has to be given access to communication modes and tools in addition to speech. They need to understand that it is the communication that matters and look to give equal importance to the other modes of communication instead of speech only. They also need to make sure to provide the necessary support needed to learn to use the communication tool effectively. Be open also to listen to what the non-speaking autistic is communicating.
Thank you, especially the last bit, Taron. Be open to listen. We are telling them all of these things, and now they need to listen. Aditi, your response to this one as well, please.
I think the family, educators, and speech language pathologists play a significant role in helping an autistic individual find the AAC tool that is appropriate for them and help them achieve confidence and ease in using the tool. It begins with acknowledging the need for AAC, helping to explore multiple options before finalizing on the most appropriate one. Independence can be achieved only when the AAC tool is used consistently across environments. Parents and educators play the vital role of advocating for the use of AAC across environments.
Excellent. Thank you so much for that, Aditi. We're moving on to question 8. How can technology be leveraged to improve communication accessibility for non-speaking autistic individuals? And what innovations excite you the most? If we can start with you, Aditi, please.
For one, I'm here, talking to you, all thanks to technology. So in a sense, this digital voice is my own true voice. Technology has been life-changing for me on multiple levels. I believe that technology possesses the power to open up the world for many non-speakers, including those with significant support needs. Utilizing technology for AAC, the use of AI to ease in the process of typing, linking the AAC app to digital assistants like Alexa, linking the AAC app to email and WhatsApp, and using AI to tweak the voice to sound more authentic and expressive are some innovations that excite me in the future. I hope to see the AAC app linked to wearables that measure vital biomarkers, like the smartwatch, so it can raise an alarm when something is not okay, or for whatever it is worth. Maybe link it to, say, Neuralink, for those with very significant support needs for whom no other form of AAC works. The possibilities are endless and the need is very real.
Well, some very exciting innovations for sure that we'll hope we're going to see more of. Taron, what do you feel about this?
The effect technology does make is what AAC is realizing for non-speaking autistics in the present. In the next stage, only follow-up would be of being able to pass the idea or thought through wearable devices from the brain or mind to the speaking device.
That would be very exciting, Taron. I'm all up for that one. I want to have some of that too. Thank you. And Elizabeth, finally, what's your response to the question?
non-speakers with autism in the world and only an estimated 10,000 who have been taught to type. Communication for All uses the internet to teach non-speakers to type around the world. When I say type, I include touching letters on a stencil or letterboard and pressing them on a keyboard. Of those 10,000 typers, only a small fraction type on a keyboard because it takes a lot more motor control. For that reason, the focus needs to be on teaching typing on low-tech stencils with larger letter targets. Someday AI and virtual reality keyboards may help us, but now the focus needs to be on teaching communication partners how to coach our bodies.
That's a very good solution for that, Elizabeth. Thank you so much for that. Question 9, what are some policy or advocacy efforts needed to ensure that non-speaking autistic individuals have legal rights to communication supports? Can I start with you, Taron, please?
Both communication through the mode of the person's choice and the freedom of the individual to determine their needs, basic legally binding human rights.
That's right, spot on. Elizabeth, what do you feel about this?
The Americans with Disabilities Act is crystal clear about our right to effective communication, which is defined as equal to communication for people who do not have communication disorders. Schools must follow the law and actively support typing with communication partners for non-speaking students. As for policy, the U.S. Department of Justice should clarify its ADA guidance to include communication partners. Stephen Hawking would not have been able to access his AAC if it was lying on the table.
That's a very good point. Thank you very much for pointing that out. And definitely, we must make sure that the different countries in the countries that the law that is there to protect all of us is actually being followed. Aditi, finally, what is your response to the question?
Thanks for asking this question. From the Indian perspective, we actually have brilliant laws. The Rights of Persons with Disabilities Act of 2016 recognizes autism as a disability and mandates inclusive education and accessible public spaces and whatever it takes to ensure equal participation of disabled in the society. The new education policy of 2020 mandates that students with differential learning needs get the necessary accommodations and support in the classroom to facilitate optimal learning. In short, as per the existing laws, access to AAC for a non-speaker is mandatory. But when it comes to the question of implementation of the laws, we fail in a monumentally miserable manner. I had the opportunity of contributing my perspective to the NOLSA Committee report on accessibility, which was the basis for the historic Supreme Court of India judgment in the Rajendra versus the Government of India case, where the Supreme Court mandated the government to make the public spaces, educational institutions, and employment accessible in 3 Mahine. Some of the pointers that I suggested include establishing of communication boards in public places and making AAC more accessible by providing tax-cutting devices purchased for the purpose of AAC.
That's a great solution that we've talked about several times, Aditi, you and me. As a bare minimum, make sure there are communication boards everywhere in public places that can be used by everyone. And then we've got to push for the laws to actually be properly implemented. It's not good the implementation fails, but there's very clear laws to protect all of our human rights. So we definitely need to advocate harder for that. So the final question for the three of you, what would you like to say to people who assume that non-speaking means non-thinking or non-understanding? This is a very direct question, but I think we need to get that out there. Elizabeth, would you start with that, please?
Speakers have a motor disorder, not a cognitive one. We understand everything going on around us. We just can't get the words out of our mouths. Non-speakers need access to communication and education. We have all the resources you need to get started free of charge on our Communication for All website. Communication is a human right. Please join us in supporting communication equality and giving all non-speakers a voice.
Thank you so much for that, Elizabeth. Very clear answer back to the world. Tarun, what's your thoughts here?
Not speaking doesn't mean not thinking. Not expressing doesn't mean not feeling. Not talking doesn't mean not having anything to say. Look to just see the person behind the label. Likely, there you would get to see the mirror image of yourself, a thinking, feeling, and loving human being like you.
Spot on. That's a really good answer to that. I think we should put some of these on billboards and put them up in different places for everybody to see. Aditi, as the final one, what's your response to this?
You have just witnessed this panel and heard our perspectives. Surely your opinion would have changed by now.
Excellent. Great finale for this one. Right in there. Exactly that. You have put your voices out to the world to see and to hear. And there shouldn't really be any difficulty in understanding all your messages. From because we don't speak doesn't mean we don't think or feel or are just like all other human beings. Let's please follow human rights, follow the laws that are already in place, and make sure that we can all communicate in all the ways that we need to communicate. Thank you so much, all three of you. Those were excellent responses to the questions on how we can try to make a reduction in inequalities for everybody, and especially for non-speaking autistic people. Thanks so much for being here today. I've really enjoyed hearing all of your responses. Thank you. We will now move on to Gayatri Vatsan. I'm so sorry if I'm not pronouncing this correctly. You're the parent of a non-speaking autistic child, and we really wanted to hear from a parent and a carer what their experiences around getting appropriate support for yourself and for your child have been. So if you wouldn't mind just introducing yourself to us.
Hello all. Hello, Charlotte. I'm Gayatri from India, in Bangalore right now, that is in the south of India. And I'm here because I want to share my experience as a parent, as what happened with my son Krishna post his diagnosis. So, Krishna presented as a neurotypical child till he was about 4. And at 4, an experience at school set off or triggered, I could say, a lot of separation anxiety, very severe separation anxiety, in fact, to the extent that his father or I had to carry him 24/7. We couldn't put him down for 2 minutes. We could not put him down for him to eat his food, to change his clothes, to take a bath, nothing. So this trigger led us to consult with the doctors to find out what was the issue with our child. And there were a lot of tests that they did. Tests is not the correct word. There were a lot of questions that we answered, a lot of questionnaires that we filled. It was a 5-day process. And at the end of it, they said that Krishna was autistic. He was on the spectrum. He could attend a quote unquote normal school with a shadow teacher, and he needed speech therapy. And that's it. Move on. Next, please. I guess you can imagine that as a parent, I was completely at sea. My husband was completely at sea. We had heard of the term autism. In vague terms, something that you would read in a newspaper article or something like that. That's about it. We weren't familiar with what it meant at all. The doctor, yes, she did explain to us that autism is a developmental disorder which mainly impacts socialization and communication. It didn't make any sense whatsoever to us. In practical terms, in daily life, what does it mean? No idea. But anyway, so we moved out of a very crowded, very pressurized hospital environment too. Yeah, because there were a lot of patients, the doctors are under a lot of stress. I do understand that part. But still, as a diagnosis, there needs to be, in retrospect, that I'm sharing this, there needs to be a lot of support around this aspect itself, the first aspect. What exactly does the child need? Which kind of therapies? How do I access them? Where do I access them? What is the next step? What do I do beyond that? And who else can we speak to? Which other parents, which other groups, any place, any organization or individual who can help us further outside of the medical environment? Maybe parents who face the same thing, maybe there are other other autistic adults or anyone, any neurodiverse individual, some person who's been through this journey, who has experienced it, and who can talk to us about it. Not yet. And I don't know. I don't even blame them at that time. This was in 2018 that Krishna's diagnosis happened. And we moved forward from there because till that triggering incident in the school, he presented as a neurotypical. Usual, a bubbly, bright 4-year-old, very talkative, very inquisitive, very curious, completely quote unquote normal again. Then we went from there to hunting for therapies, speech therapy, because after a point he regressed to where he was having a lot of self-talk but was not communicating. Speech therapy was not the appropriate solution at that point because after a year or so of this, he regressed again and became nonverbal. He became nonverbal post hernia surgery after the administration of anesthesia. Is my personal opinion. Again, the doctors do not support this, the medical community does not support this. But morning of the procedure, this child was very verbal, very vocal, very communicative. Afternoon of the procedure, switched off, completely stopped talking. And that was almost 7 years ago. Till date, Krishna is 11, he does not speak. He only makes sounds. He regressed progressively year on year, and when we went for second opinions, third opinions, etc., we were told that this was childhood disintegrative disorder. There isn't much that we could do about it, but we needed to wait till he reached puberty and hope that the regression stopped at that stage. And CDD is part of the autism spectrum now. And just go for therapy for his sensory issues, go for occupational therapy, for life skills training, go for ABA therapy. If he doesn't speak, go for speech therapy. All right, it was a huge journey again. We went through each and every painful process. And I would still say that today, Krishna is not like the 4-year-old he was in 2018. He's like the 1-year-old he may have been in 2015 if he presented as autistic at that time, but he is not. The 1-year-old Krishna was much more capable of handling his own life than the 11-year-old Krishna. But today's 11-year-old Krishna is much more aware, has so many more feelings, has so much of suppressed rage, frustration, and helplessness, which he manifests as self-hurting. And I, as a mother, am not able to help him there. The therapies, wherever I have taken him, have failed till now in just teaching him to use something else, like an AAC device, for example, for basic communication. Just yesterday, he had a pain episode, he had a self-hurting episode, and I was asking him, like, Krishna, where is it hurting? Just show me, I'll do something for you, please. He paused that self-hurting and pointed at his feet very slowly, very carefully, very deliberately. I said, are you sure? Is it your feet that are hurting? He pointed again. Yes, his feet were hurting because he had hit them so hard, they were black. So I know that they were hurting because I was busy blocking his head. I didn't want him to damage his head. And the pain was because of, excuse me, the pain that triggered the self-hurting was an internal pain. It was a dental pain. But the way he identified it seems to have been different from how he pointed, because he could have shown me his teeth. He did not. He showed me his feet, which were the immediate external hurt that he was experiencing at the time. But he can communicate, right? This means that he can communicate very well. And perhaps I'm not doing the correct job, or I'm not the trained person, or I don't know. Because I'm available all the time, he expects me to, know him better, to understand without his needing to speak. Perhaps, I don't know. But access to a service that can teach him how to communicate basic things, I'm hungry, I'm in pain here. That for me has not been there. And
that's a real shame, because those are the things we need: the basic ability to communicate and need to have help learning that, just as we sometimes learn speaking a language, right? And if that's not available, if the focus is on other things, or there's something mentally wrong with us, or whatever it is. That's not what we need, right? We need to learn how to be able to communicate our basic needs so that they can be addressed. But there is this override as well. As soon as you have an autism diagnosis, everything wrong with you is that, right? And do you experience that as well for your son?
Absolutely. This entire recent pain episode has been due to a dental issue. He needs an extraction, he needs a root canal, he needs a drilling.
Yeah.
Very unfortunately, this diagnosis came about after 3 months of my child suffering pain.
Wow.
And my telling the doctors, even doctors of some of the other disciplines, like his gastroenterologist was saying that it should be dental pain. I think it's dental pain. But the dentist said it's not dental pain. He's autistic.
Yeah.
Okay, forget it. So
Like autistic people can't have dental pain, right?
he's autistic. So any behavior or anything which I, as a mother who doesn't know any better, thinks is pain is not pain, but it's a presentation of autism. Is very unfortunately an overwhelming opinion, a perception perhaps.
But
So
what I've heard so far from so many parents, and also non-speaking people who remember from when they were younger, before they have access to something that helps them communicate, is that the reaction we have, a lot of us, and I experienced that myself when I was young, and I didn't really speak the first 12 years because mainly because it was just too difficult and it was scary, right? So it was easier to not say anything. But I also had migraine and I was banging my head against the wall because my head was hurting. Of course, it from the outside doesn't make any sense that I would do that because it will make my head hurt more, but it will make the pain more logical to me because I now understood why it hurt. But actually, the migraine didn't go away, obviously, from that. So it's just a different way of thinking that isn't understood, isn't it?
yes, you shared that you suffered from migraines, you still suffer from migraines. Last year, till from he was around 6 to 9 years old, Krishna suffered from severe migraines. And it's very lucky that I got a doctor who agreed with me because the way he behaves, the self-hurting patterns are different when the issue is different.
Yes.
He knocks his fingers or he knocks his knuckles when he's annoyed with something or he wants to say no.
Yes.
But when he's desperately, crazily hitting his head and I am not able to control him, definitely I should be stronger than a 6-year-old, however angry or however desperate he is. I could not control him. I couldn't block his head. That is some issue with his head and probably pain. I cannot find a logical reason why, when already his head is hurting, he would hit it and increase the pain. But that was the reason why, because he was not doing it 24/7.
No.
It was spasmodic. When the pain hit, a very calm, quiet child would leap up and go hit his head on the wall.
Yes.
Repeatedly, crazily, scream, cry, roll on the floor. That is 100% pain.
It's about pain management, and so I don't think we will do these behaviors if it's not because we have some pain and we don't know how to deal with it or how to seek help for it.
And that's absolutely another service that I'm still desperately hunting for, pain management.
Yeah.
I know that he's in pain and it's different parts of his body that are in pain at different periods of time. How does he cope with it and how does he express it in some way, anyway? Definitely he's smarter than all the diagnostics that are happening to him and all the medical practitioners that I take him to. He knows his own body. He knows where it's hurting. How does he
shows it, but in his ways, right?
Yes.
So he must show it, but
nobody believes him or his mother.
no. Yeah.
I'm the only one who believes him. His father is the only one who believes him.
Yeah.
But medical fraternity says, no, he's autistic. Please put him in a psychiatric hospital for 2 weeks. He needs a stabilizer.
No.
How will you handle him? That was another question which I needed to vent about. How will you handle him cannot be the first question. How will you handle him is an important question, yes.
Yeah.
How can he handle it is the first question. How can he deal with it is the first question.
Yes.
If a child is driven to such extremes, there is a very good physiological reason for that. Apart from, depression and mood swings, which are also very real, which are also very true. But very frankly, I don't think very young children experience those. You need to have a certain mental progression and a certain, grasp of the world about you to start presenting for something like either depression or bipolar or something like that is my personal opinion. Of obviously not as anyone with any medical experience. I have seen Krishna go through separation anxiety, severe separation anxiety. He didn't hit his head and scream and cry for that. He clung to us. That's it. He screamed and cried if we tried to put him down or change his clothes or if we tried to take him for a bath.
Because you were the safe, you were the safe place for him.
Yes.
And he couldn't explain enough why the other things were not safe, but it comes from experiences that has shown him it's not safe, and then he will cling to what's safe.
Absolutely. And it's understandable. It's a little bit of, common sense is all that I feel. These children do present behaviors which are very different, maybe different from the neurotypicals, but again, each issue has a different behavior. Migraine, head hitting, dental pain, head hitting, anxiety, clinging, or maybe, just staying in a place or something. I don't know. It seems pretty intuitive to me and pretty commonsensical, but it is dismissed outright right now because if I say this child is autistic, oh, okay, autistic children will be like that.
Yes. No.
Autistic children don't have tummy ache, they don't have toothache, okay, they don't have headaches, they don't feel hungry, but they're just autistic. So that very sadly is a perception that needs to be changed. So because of this perception, I cannot access proper medical services for my child. I cannot access proper therapies for him, despite therapies being tailored for children on the spectrum. Still, the so-called tailoring is something that I have a lot of, feud with. So, and everything from stimming, from preventing stimming, again, my pet peeve.
No, it's bad. No, we need to be. It's our way to reduce our anxiety. If we try to stop a stimming, and I know there's some therapies out there that wants to effectively convert us to become so-called neurotypicals, right? But that's not, why should we do that? We're not born that way. Leave us to be what we are. Try to understand us better, right?
Yes.
And appreciate the differences that we present with. I mean, how hard can it be? Why are you so afraid of differences? Why do we all have to be the same, right?
No reason whatsoever.
No.
Only reason you prevent a behavior is when it's literally injurious. You're going to hurt yourself, you're going to hurt someone else.
To protect them.
I think the first step is protection, and the second step is to figure out why. It's never without a reason. It's never because, okay, I'm in a bad mood, I'll go hit my head today, which is unfortunately. Yes. So
I'm so glad to hear that from you, as with all your experiences with this, because it's my personal experience as well. I would have self-injury experiences because something is wrong. Not for no reason, never for no reason. Yes. It could be that sometimes it's in the emotions that we feel pain and that comes out. And that is, by the way, the same for all human beings, that we have emotional pain we are trying to show or deal with physical pain. It's not unique to autistic people, right? And this is like, you just look at what all human beings do and understand that it's in principle the same, and it might be displaying differently, but the principles of what we do around dealing with the pain we feel are the same, right?
Yes. And the other myth is, I do feel it's a myth that autistic children have a high pain tolerance. Is it a high pain tolerance? Or is it that they don't express it the same way? They don't know that they're supposed to cry and maybe, go running to mama and say, I've got
Doesn't mean don't feel the pain.
They do feel pain.
We do.
How can you've got a nervous system, how can you not feel pain?
And we do feel, and it's shown when sometimes some people try to treat us with needles and stuff, we feel it really intensely, more intensely probably than your average person. And that's not recognized, but we might not express it in the neurotypical way, and then they don't understand us. Then we have no pain because we don't express it like you. What's wrong with you? Why do you think everybody does it like you? Right? That's what we want to say to these people who are trying to help us, but actually are somehow just deciding weird things on the basis of how they are themselves, as opposed to going, okay, here's a different person who experienced life differently. I mean, I believe with the medication that our sensitivities to everything, the environment, sounds, noises, everything, also goes for medication. And we need to have more research, right, on this. I don't know how your son is on medication, but I'm hypersensitive to any medication. I literally don't, I've never taken any in my life other than paracetamol and Nurofen. That's all. Even going through 3, cesarean sections, that was the only painkillers I had, and it was enough because my body is so sensitive. I didn't need opioids or morphine and this, and I'm actually totally allergic to it as well. And then they go, but we don't have anything else. I said, just give me that. And they forced it. So once they just gave it to me anyway. So I woke up, they gave me morphine anyway. I woke up, red everywhere, everything itching. It was horrible. And I was like, I told you. Oh, but it's not normal that you can do this without extra. I said, look, I told you what I wanted and you ignored it and you gave me something I told you I couldn't deal with. How does that, and I don't know if you experience this with your son as well.
Krishna is hypersensitive to all medication. I don't even give him Crosson or paracetamol when he has fever because it usually runs its course in a couple of days, and he's fine after 2-3 days.
Yeah.
The entire issue with his medication began because of this pain, because of investigations which he cannot bear, and so he needs sedation. He hates sedation and he fights it with every ounce of will in his body, and there's a lot of will in that tiny little body of his. So with all the sedation, this kid is literally not able to sit, not able to stand. He's reeling like this, but his eyes are wide open and completely alert.
Yeah, wow.
Happens after, I think they gave him 6 to 7 injections for just inserting an NG tube for a constipation management procedure because he cannot withstand drinking that much water. He really needed to, clean his bowels, and therefore we went to the hospital for this. Therefore, the sedation, therefore the anger, the helplessness, the frustration, and his father and I feeling that we'd betrayed him, We knew that he didn't want it. And forcing it on him just because he's little and we are big. And that felt so bad. That felt so bad. But we didn't know what else to do. And he reacts very badly to this. He's comfortable. It affects him in a way that he's not able to express and I'm not able to guess. And it totally disturbs his balance, his happiness, his mood, his eating, everything. His entire system is screwed up. It's thrown upside down after these medicines. I don't give them as best I can. I've been fighting giving him risperidone since he was 4 years old. Oh, he's autistic. He's not peeing in the washroom. Give him risperidone. Okay, doctor, and I will not give him. That's about it. I've stopped arguing right now. Frankly, I've stopped arguing with doctors. I've stopped arguing with therapists because I'm so tired. It's like I'm just repeating myself. It's like I'm a recording machine on repeat, and it doesn't make any difference to anybody. So I just listen. I take something if it makes sense to me, if I'm okay with it. Otherwise, I just say okay and then go on. And, I don't give him.
But you are now repeating it to the world, right? You're now repeating it to the world, so we can all experience. And we really, really appreciate you being here and sharing all this. The last point, we're coming up to the end of this. The last point I wanted to hear from you, do you have just like a key thing that you wish that the doctors, the therapists, the educators, the hospitals did differently? Just like, what would be the first thing you would like them to just get?
To accept that the child is actually feeling something very physiological, to understand that the parents have a better perspective simply because they're spending more time with the child. They might not know the reason, but please take them seriously. Please examine the child for issues. This is for doctors. That, like dental pain, like gut pain, because maybe you haven't food enough or something like that,
Yeah.
before we go off and say that this child is autistic, so please put him in the psychiatric hospital.
No. Yeah. Unfortunately, many doctors do that. Unfortunately, around the world, many of us do get omitted, and many of us do not come out for a long time. And
that's very disturbing to hear.
We cannot be dealing with that. So thank you so much for being here and for doing this. We really appreciate it. It's been great speaking to you. And I look forward to staying in touch and following the progress that hopefully you will have as part of this global community as well, where we can apply some pressure when we all come together to get the systems to accept and appreciate us for who we are and what we are. So thank you so much.
Yeah. And thank you for having me. Thank you so much. It's been an honor. It's been a pleasure to speak.
It's our pleasure indeed. Thank you.
Hi everyone, I'm Maria Dominique and I'm a bridge engineer at Jacobs. I'm also the Neurodiversity Global Lead as part of the ACE network. And ACE is an employee-led network that stands for Access, Connect and Empower. And we focus on supporting our employees and promoting accessibility to everyone. We connect and empower the people with disability or other physical, cognitive, adaptive challenges and their family, friends and those who provide care to others. See, I wanted to start by highlighting that our company has core values, which includes challenging the accepted, aiming higher, and living inclusion. And at ACE, we believe that our network ensures that Jacobs is truly living its core value. By putting inclusion at the heart of everything we do, we are enabling our people to embody our other values and work towards a better environment. So some of the things that we do include raising awareness, promoting allyship, giving reasonable adjustments, hosting events, fundraising, but above all, holding our leaders to account. Today, we have some of my colleagues who will introduce themselves and they will be speaking about inclusive design. George will start with a personal view on how urban planning and community design can impact autistic individuals, and our inclusive design team will focus on how we deliver inclusive cities and communities for everyone in our projects. Thank you very much. Over to you, George.
Hello, my name is George Wader. I lead the cities team at Jacobs. I'm an architect and I've also recently been diagnosed with both autism and ADHD. I wanted to share a little bit around my background. I think it's important that we're open and share our lived experiences, because I think it can allow us to design better cities, design better places, reconsider the buildings that we live and work in every day and look at improving those. So having a background as a designer, I think being autistic and ADHD has had its positive sides. It's given me a very unique perspective on the world. It's allowed me to see a lot of things that other people just don't see. But it's also had a lot of negative aspects to it as well. So a lot of things that people maybe don't see is that the struggle often on a day-to-day basis around energy levels, considering particularly sensory situations and the impact of things like overcrowding on trains, impacts of noise, background noise in workspace, bright lights such as the sun in your eyes, things like smells, things like wayfinding around buildings, which can cause issues if they're not designed particularly well. And all of these things do have an impact on my mental health. And I think since COVID, there's been a lot of positivity in terms of having a flexible way of life, being able to work from home a lot more, but it also puts pressure on in terms of the hybrid office working lifestyle and being always switched on, working longer hours. There is a balance really between the positive and the negative. But I do think since COVID's sort of been a reset period where we've been able to re-examine the way that we do things day to day and perhaps challenge things that we just thought were normal really beforehand. And I think previously we've been guilty of having a one-size-fits-all approach to how we work. And I think now we need our buildings and our public spaces, our infrastructure to catch up with us. And we've become more flexible, more agile in how we work in terms of office working, but our buildings really are still lagging behind, and they need to catch up with us. I think by sharing things like this, our own lived experiences, we can begin to dream up a better world where we have buildings that are more inclusive, infrastructure that works for us, and I think generally better places. So let's be open, let's share our experiences. Everybody is different, and I think we can only design places for everybody if we collaborate, if we share our experiences, and if we talk about it. So I'd like to hand over now to Rachel, who will talk a little bit more about inclusive design more broadly.
Thank you very much, George. I'm going to start with a quick introduction. My name's Rachel Smalley, and I am the Inclusive Design Lead here at Jacobs. So, what is inclusive design? Inclusive design is a term that's often used, sometimes misused or overused, so I always think it's good to start with a definition. Our one-liner is on the screen at the moment, which is inclusive design is about making places work for people. We tend to then expand on that one-liner with the quote on screen, which is our approach to inclusive design is people-focused. We consider how people will feel in an environment and how we can give them the best possible experience. Inclusive design should be seamless and invisible. People should not even know the environment has been carefully shaped to be usable, inviting, and comfortable. They will simply have a better experience. So this slide possibly makes what we do sound quite logical, intuitive, and possibly quite simple as well. To do inclusive design well, it's actually a very complicated equation, if you like. It takes a lot of work, thought, and consideration, and a lot of kind of engineering of environments. We do the complicated equation to provide our clients with the simple answer of places that work for people. So, how do we do this? We capture what we do and our approach to inclusive design in the 5 principles, which are on screen now. So firstly, we make sure environments are people-focused. We do this by acknowledging the difference in how people use the built environment and provide choice for them. We ensure environments are welcoming and work seamlessly for users, subtly and invisibly meeting different requirements, avoiding segregation and promoting participation. So it's important that environments are usable, so we create quality environments that people can enter, use and exit safely and comfortably. We ensure environments are relevant. We do this through celebrating diversity and difference and ensuring that end users feel accommodated and acknowledged. And future-proofing is a big part of inclusive design as well. We design to meet and exceed the expectations and requirements of current and future populations. So you will have noticed going through these 5 principles, I've just mentioned people and end users a lot. But who do we mean by people and end users? So in terms of the who piece, we take into account or consider, admittedly, slightly longer one-liner than the last one, but we take into account any end user group for whom the design of the built environment could potentially impact. On screen, we have a few of those end user groups now. So age, we take into account a range of age groups, including older people, young people, and children. Disability, we take into account people with a range of requirements, including physical, sensory, hidden impairments, and neurodiverse conditions. Gender, we take into account people of all genders and personal identities. Pregnancy and maternity, so people who are pregnant or have very young children. Faith and cultural background, so people with a range of faith and cultural backgrounds. And each of these groups on screen at the moment, and many more to be honest, all experience or use the built environment in slightly different ways. So it's really important that the built environment takes their requirements into account. You'll notice we actually have an expanded list at the bottom of the screen relating to disability. We take a very broad approach in terms of disability. We go beyond traditional access for disabled people, which tends to focus in on people with mobility impairments and wheelchair users. Instead, to be honest, this isn't a fully comprehensive list, but we would take into account the requirements of people with ambulant mobility impairments, wheelchair users, people who are blind and partially sighted, people with learning disabilities, people who are deaf or have a hearing impairment, people with mental health conditions, people with neurodiverse conditions, and people with cognitive impairments. So, how do we do this? How do we create environments which work for the who on the last slide? We utilise lots of guidance, codes and standards. The guidance, codes and standards we use will vary depending on where globally the development is, and also what the development is in terms of its use or uses. On screen at the moment, we just have a selection of a few of the guidance documents that the team often use or refer to. There's quite a few on there because there's actually no single source of guidance when it comes to inclusive design. This is mainly because of the range of end user requirements we take into account being so broad. But also because of this, on larger developments, we tend to produce bespoke development-specific inclusive design standards or requirements documents. These tend to pull together relevant guidance, codes and standards and set the bar in terms of inclusive design for that development going forwards. So, how do we do this? There's a big difference between accessibility and access for disabled people and inclusive design. The first bullet point on the screen at the moment explains we consider a diverse range of end user requirements. This goes back to our who slide, and we take all of these end user requirements into account as a package at the same point in time. We do this to avoid any end user conflicts or unintended consequences, so we iron those out at design stage. The second bullet point explains we integrate inclusive design at the earliest possible point in the process. And this one's really important to avoid a kind of retrofit approach, or as I call it, a sticky plaster approach, which is a fix on an already kind of consented or decided scheme, as kind of these sticky plaster fixes rarely represent the best solutions for end users compared with an environment which is shaped around those end user requirements. The third bullet point on the screen explains we create solutions that are seamless, integrated, and often invisible. Again, going back to the second bullet point, we avoid those sticky plaster solutions, and it's also worth pointing out that they often end up looking quite incongruent with their surroundings and their setting. And knock-on effect of this is it could potentially cause some resentment. So people looking at, for example, a ramp which doesn't quite fit and isn't seamless and integrated, people could look at that and think, oh, well, that ramp is needed or required because of, for example, wheelchair users. And that can cause a bit of resentment. So the built environment can potentially shape people's views of other people. So we are also very aware of that one. And yet this final bullet point goes back to our original quote on the intro slide, which states that people should not even know the environment has been carefully shaped to be usable, inviting and comfortable. They will simply have a better experience. So, focusing in on neurodiversity and the creation of places and spaces, this slide is actually another example of the complicated equation behind our one-liner of making places work for people. I've clustered 3 of our elements together, so people-focused, welcoming, and usable. It makes sense to group these when considering the requirements of people with neurodiverse conditions, as in this specific context, they probably sit more as aims, so what we want to achieve. They're also interlinked, as an environment needs to be people-focused, so it takes into account people with neurodiverse conditions and experience of how a built environment can potentially exclude people, not be welcoming, and not be usable for them. So we take that into account to ensure that places we create are welcoming, usable instead. So we take into account people's experience of exclusion and negatives to make sure that doesn't happen again. It's interesting, people may not necessarily be able to pinpoint or describe a particular environment they've experienced which is welcoming and usable and positive in that way. But if we can capture the negatives and avoid them, hopefully people's experience will change going forwards. On screen, we also have relevant at the moment. Relevant and welcoming and that cluster are also very interlinked. So for a place to feel welcoming, including for people with neurodiverse conditions, it needs to feel relevant for that individual. For some people, that means it needs to provide a feeling and features they can relate to. This could mean familiarity for some people, potentially some recognisable features, or it may be a sense of comfort for some people as well. Future-proofed links into our people-focused cluster, but also relevant. Future-proofing, we take an anticipatory approach to future-proofing. We don't wait until someone puts in a request to change an environment to make it work for them. We design an environment from the outset, which takes into account the who piece on the previous slide, and the diversity of end user requirements this represents. And we do this from the outset to provide choice and a range of options. It's worth noting at this point, we would never describe an environment as fully inclusive. Firstly, it's not possible, partly because of the design guidance we use is based on between the 80th and 95th percentile of the population. But also, and this point's particularly relevant when we're talking about neurodiversity, people's experience of barriers and the built environment, they're so diverse, it's simply not possible to group everyone together and rubber stamp an environment as fully inclusive. So it's a term we tend not to use. Instead, we provide options, choice, and environments that are flexible and can change. So I'd just like to finish on a slide showing some sources of further information on inclusive design and the built environment. Many of these recommendations are from the team. My personal favourite at the moment on screen is Kat Holmes's Mismatch. I really like this book because it captures really well how we should be learning from people's experience of barriers and exclusion to create more inclusive places and spaces. So I'm going to finish there. Thank you very much for listening.
SDG 16, peace, justice, and strong institutions is essential for creating a world where everyone, including autistic individuals, can flourish. This vital goal advocates for inclusive societies, fair access to justice, and accountable institutions. For autistic individuals, SDG 16 plays a critical role by combating discrimination, ensuring equal access to justice, and promoting inclusion across all areas of life. It's about creating environments that are safe, equitable, inclusive for everyone. Today, I'm delighted to introduce Torkel Sonnet, a dedicated parent of an autistic son, visionary social entrepreneur, and global pioneer in the neurodiversity employment. He has personally advanced the inclusion of new minorities in workplaces around the world, and also previously served as the chairperson of the Danish Government's Council
on corporate social responsibility and SDGs, bringing new inclusion directly into policy discussions. We also had the privilege of collaborating closely with Torkel at ION for a number of years now, and this is also why we have specifically chosen to highlight SDG 16 at this year's United Nations World Autism Awareness Day event, to continue building a world where justice, peace, and inclusivity are realities for everyone.
Thanks so much, Sylvan, and hello, everyone. And thanks to ION for your important work to promote awareness and appreciation of autistic people and neurodiversity in all communities around the world. Your hard work is very much appreciated. It's an honor to be with you at the UN World Autism Awareness Observance Day, a day dedicated to recognition and celebration of the unique contributions of autistic people around the world. I'm here as the father of an autistic son, a grandparent, social entrepreneur, and as Sylvan mentioned, former organizer of UN World Autism Awareness events together with ION. I've done events in the UN headquarters in China, Indonesia, and India, and I really love this global community. Just like ION, my organization, Square Foundation, is enormously proud to have achieved the status as an NGO associated with the UN Department of Global Communication. I'm thrilled to continue working with ION on UN-related awareness initiatives. I love the SDGs. They're the world's promise to itself of a sustainable world where no one is left behind. The UN played a crucial role as convener and set the stage for all governments to make their commitments to themselves and each other in form of the SDGs at the UN General Assembly. Thereby, they have committed to working towards more sustainable communities and adjust their systems along the way. Beyond the SDGs lies a commitment to leave no one behind. This is the glue that make all SDGs stick together as different angles to the same commitment. It's important for me to point out that the SDGs do not belong to the UN. They belong to us, to you, to me, to your school, to your workplace, to your government and your community. We are all equally invested as global citizens in our joint commitments and efforts to realize the goals by 2030. The 17 goals can seem overwhelming, but there's a system behind it, with 169 targets and a number of indicators that governments are obligated to report on at the UN at regularly basis. The goals are interconnected and impact each other's and are organized under 5 Ps to cover different themes. There's the people part addressing goal number 1, no poverty, goal number 2, zero hunger, goal number 3, good health and well-being, goal number 4, quality education, and goal number 5, gender equality. And there's the theme planet addressing goal number 6, clean water and sanitation, goal number 7, affordable and clean energy, goal number 13, climate action, goal number 14, life below water, and goal number 15, life on land. And then there's the prosperity theme addressing SDG 8, decent work and economic growth, goal number 9, industry, innovation and infrastructure, goal number 10, reduced inequalities, goal number 11, sustainable cities and communities, and goal number 12, responsible consumption and production. And then there's the peace part, addressing goal number 16, peace, justice, and strong institutions that I'll be talking about today. And the last one, the partnership theme, addressing goal number 17, partnerships for the goals. It's important to stress that the commitment to the SDGs is for the whole package. We cannot just meet one or few goals. The world is dependent on us working together to realize all the goals at the same time by 2030. The SDGs are a result of long negotiations between experts and country representatives at the UN. They represent a compromise and do not cover all the issues that the world should work on to be sustainable. Every country is encouraged to make their own version of how they will implement the SDGs. Many large companies and civil society organizations have already made plans for their contributions, often by prioritizing some that are most relevant for their activities, while knowing that even though you for practical reasons focus on a few, all SDGs are equally important. Despite the many compromises, the SDGs represent a unity in the world, where the news seen tend to report more sad news than good news. So let's today focus on the good news regarding the SDGs, that there is a global commitment from all governments to work towards a more sustainable world, and we are all part of that solution. While other speakers today have focused on goals related to people and prosperity, I will focus on peace, justice, and strong institutions, while also touching on this partnership for the goals. SDG 16 is one of the most important goals. It aims to promote peaceful and inclusive societies, provide access to justice for all, and build strong institutions. Strong institutions are characterized by transparency, accountability, and inclusivity. Effective governance is essential for ensuring that all individuals, including autistic people, have equal access to opportunities and justice. This requires a commitment to education and awareness, as well as the implementation of policies that support neurodiversity. Policy recommendations for governments and organizations include the development of legal frameworks that protect the rights of autistic individuals, the establishment of support systems that provide access to education and employment, and the promotion of inclusive decision-making processes. By implementing these policies, we can create institutions that are not only strong, but also inclusive and just. Promoting peace and justice involves reducing violence and exploitation, ensuring equal access to justice, and encouraging community engagement. Autistic individuals are often vulnerable to violence and exploitation due to their unique needs and challenges. And protecting individuals require the development of legal frameworks and support systems that address their specific needs. Ensuring equal access to justice is another critical aspect of promoting peace and justice. Legal frameworks must be designed to protect the rights of autistic individuals and provide them with the support they need to navigate the systems. This includes training legal professionals, developing accessible legal resources, and creating support networks and inclusive decision-making processes that involve neurodistinct individuals that can lead to more effective and equitable outcomes. For me, SDG 16 is where we can evaluate and implement the results harvested under the other SDGs into national government systems and thereby anchor improvements for future generations. This will secure that we know that our efforts will live on for future generations without depending on the resources of people fighting for their loved ones. SDG 16 has 12 targets of which I'll focus on two. Target number 6, develop effective, accountable, and transparent institutions at all levels. This target calls for governments to make institutions work for all citizens, neurodistinct and neurotypical people alike. It is a goal that is easy to set, but how do we measure and evaluate it? Here we can use the target's indicator, which says promotion of population satisfied with their last experience of public services. Just imagine the impact it could have if we around the world could collaborate with academia and governments to measure how the SDGs work for the people who struggle, including autistic and neurodistinct people. This could give transparency and important knowledge of what works and what does not work, and create a knowledge base where best practices can be documented and shared for others to implement. This could be a significant role for the autistic and neurodistinct community to organize measure points and conduct surveys in collaboration with academia and governments in support of SDG 16, Target 6. Autistic people and their families have the right to get support from public service, but my experience is, as many other stories today will confirm, that autistic people and their families more often fight against support systems than with support systems. And this is the same pattern I see all over the world, regardless of where people live. Systems are filled with tension, and no one has the overview of what works and what does not. This is where we can use this target to measure satisfaction among autistic people and their families as an indicator of how well the community and government is living up to the SDGs' ambition of leaving no one behind. No one knows better about what works and what does not work than the people seeking support from local governments. Another important target is number 7. It says ensure responsive, inclusive, participatory, and representative decision-making at all levels. This target points out an issue that the autistic and neurodistinct community has been challenged by: how to make their voices heard. SDG 16, Target 7 shows a way for measuring and evaluating the participation in decision-making through the indicator, and it says proportion of population who believe decision-making is inclusive and responsive by sex, age, disability, and population group. Just imagine the value for the SDGs if we can organize measurements and surveys with academia and governments to assess and improve the level of inclusion and responsiveness of decision-making throughout the world. Goal 16 underscores the importance of governance, transparency, and protection of human rights. When every individual, regardless of their background and abilities, is given the opportunity to contribute, we'll create a more harmonious and equitable world. However, autistic and neurodistinct people often face barriers that prevent them from fully participating in society. These barriers include discrimination, lack of access to education and employment, and inadequate support systems. But how do we find out what works and what does not work? Who will know better than autistic people and neurodistinct people and their families when things work or not? How can we collect data about these targets and use that knowledge in collaboration with the government? And now to the conclusion. Embracing neurodiversity is key to achieving Goal 16 and thereby promote peaceful and inclusive societies for sustainable development, provide access to justice for all, and build effective, accountable, and inclusive institutions at all levels. Autistic individuals and communities have the potential to be a powerful advocate for SDG 16, which can be a tool for autistic people and neurodistinct communities to collect data for the indicators in a constructive collaboration with governments, academia, and civil society organizations. Neurodiverse environments will not just benefit autistic people, but everyone. I will finish by sharing a story of how an autistic person has already contributed to the SDGs and UN-based resolutions in an extraordinary way. The challenge for the UN Human Rights Department was, how do you manage the ever-growing amount of human rights guidance, including almost 180,000 individual observations and recommendations from the UN Human Rights Mechanism, and ensure easy access to everyone, including the general public, governments, NGOs, and UN agencies. At the same time, how do you ensure this guidance has a real and positive impact on the human rights worldwide? It was a massive challenge, but in a collaboration between the UN Human Rights, the Danish Institute of Human Rights, and Specialisterne, a brilliant autistic person took on the enormous challenge and came up with a solution that made human rights guidance available to inform the national policies needed to implement them. The result is that today, the Universal Human Rights Index, the world's largest and most comprehensive human rights database guidance from the human rights mechanism, is being powered by artificial intelligence, showing the links between this guidance and the SDGs. This is a stellar example of how the innovative mind of an autistic person made it possible for the first time to get an overview of the many goals and resolutions and how they interact and affect each other. Suddenly, it was transparent how all these decisions intervene with others. Let this be an example to follow for how many more contributions by autistic and neurodistinct people to governments' efforts to realize the ultimate ambitions of leaving no one behind. Thank you for your attention.
Thank you.
Hello, my name is Maureen Dunn. Just really briefly, I've been involved in the neurodiversity field for over 25 years. I'm both trained as a professional, did my doctorate at Oxford, but also come from the perspective of lived experience as well. I'm the author of a book called The Neurodiversity Edge, and I've worked with number of companies, top brands, but also scale-ups and universities and colleges. And I'm also the mom of triplets, two of the three which are neurodivergent. And I'm really excited today to introduce our amazing panelist for this fireside chat. The first panelist we have is Torkil Sane, and he has been a pioneer in neurodiversity employment for many years. He's a social entrepreneur. He's a parent of an autistic son, founder of Special Sterna, also the former chairperson of the Danish government's Council on Corporate Responsibility and SDGs. So really excited to have this conversation. And we also are honored to have Flavia Calafenge, who's Brazilian, and she's also the mother of a 15-year-old autistic girl. She's the director of the Hidden Disabilities Sunflower in Latin America and has done a lot of other amazing things in this space, including being an expert in Global Zero Project for 2025 for the UN in Vienna. So really excited to get started. Welcome to the Fireside Chat.
Thanks so much, Maureen.
Thank you.
And so I know there was a lot of really interesting conversations that we've been having with all the panelists right throughout this event, and it was really exciting to hear just such a diversity of perspectives, lots of different individuals coming from different angles, different geographies, different perspectives. And I was curious with the both of you, like, I mean, okay, obviously we're here to celebrate the UN Autism World Autism Awareness Day, and April's also, Autism Acceptance Month. And I was curious if you could both maybe elaborate a little bit and reflect on how the UN Sustainable Development Goals specifically relate to autism, and why, especially in this particular time, right, in history, why this conversation is really, really important.
If I may start, Maureen?
Absolutely, go ahead.
I'm super excited to be in this fireside chat with you ladies. I love the UN. It is like the global conscience of the world, and it's a true honor to contribute in any way I can. I was happy to be asked by the UN to help organize the UN World Autism Awareness Day event in 2015, which was my first really experience of going through the corridors in the UN headquarters, and you can feel the history, the legacy, and the humbling experience to be part of something much, much bigger. And I've been, together with Ion, I've also been part in organizing the other events under the observance of the UN World Autism Awareness Day event. It's an event that brings good people together, for sure. Mm-hmm. And this is also what we've seen today with so many who give their perspectives, volunteers from around the world who come together around a cause. And this is what makes the UN and the SDGs very interesting. And autism has a special place. There are no other diagnoses, as to my awareness, that has a special observance day at the UN.
Mm-hmm. Mm-hmm.
So I think this gives us an opportunity, fantastic opportunity to send our messages to the world. We have the platform, we have
mm-hmm.
The scene, and autistic people have, in my eyes, a huge and important role to play, not just as autistic people, but as representatives of people who face similar barriers, where
mm-hmm.
it may be difficult to see that they may be neurodistinct rather than
mm-hmm.
neurotypical. So I think the autism community, they have a special opportunity to address the world and to be advocates for those who feel like the square peg's not fitting in.
Mm-hmm.
And the SDGs is my second favorite subject,
mm-hmm.
because, as you mentioned, Maureen, we are living in a world where there's a lot of concerning news all the time.
Mm-hmm.
and the concerning news are widely spread, goes viral more than good news. So we have to make sure that more good news get into the scene. And one of the most important good news over the last many, many years, in my eyes, have been that the world had come together. 180 or 90 countries have actually agreed on something, agreed on a global commitment to itself in form of the Sustainable Development Goals. In today's world, it's a fantastic achievement, and this we have to really make the most out of. And my general experience is that if we can create environments where autistic people thrive, we will have reached the ultimate goal of the SDGs, namely leave no one behind. Behind all the SDGs, there are many, there are 17 Sustainable Development Goals. It's all, the glue behind it all is leave no one behind. And we have a lot of experiences, lived experiences as autistic individuals, family members who fight to overcome all the barriers that we meet every day. But I think this autism community is a key to make the SDGs tangible and a showcase of creating environments where no one is left behind.
Yeah, that's really powerful, and it makes me think a lot. There's something I've thought a lot about with, just this issue of how do you get there, right? And something I've been involved in a lot. I've been in some policy roles where I've, at least in my state in Illinois, and in the U.S., have been helping to shape, policy. Because there's the top-down perspective, right? How do you make a difference in policy to get there? And then there's the bottom-up perspective. I guess that's how I see it, where it's just the everyday, how do we influence people, shift mindsets? How do we get people to, to maybe understand autism in ways that go beyond what their stereotypical experiences have been in the past. And so I'm really curious, Flavia, what your insights are, given you have a lot of experience, and I'm sure given to your in your part of the world, that things are always contextualized culturally, and things work differently in different parts of the world. So really curious what your thoughts are on about all this.
So first of all, I'm very excited and anxious and emotional. Today in the morning, I was trying to explain to Felicia, my autistic daughter, what this is all about, because she saw I was preparing the material and studying. And I was trying to explain her what is the United Nations and everything. And it brought me from where I was a small girl thinking about the United Nations, right? So for me, it's like a dream. After passing through all the difficult situations that I had with her in the past years, being now side by side with Archio and you in this discussion is really unbelievable. So coming to the point that we are going to discuss the SDGs, and I will be giving my perspective. When you say bottom up, I'm really bottom. I'm really in the bottom. I'm going to give you my perspective and my experience as a mother. And because of this, I turned to be an activist, and now I'm fully dedicated on working in this awareness and this education, trying to make people's autistic families happier and safer and with more peace For me, I have no words. I'm really very, very emotional and very thankful for this opportunity. And I hope I can give another perspective from this side of the world.
Mm-hmm. Wonderful. Great. You know, it's wonderful to have. Yeah, I'm excited to be working with both of you, and it's such an important conversation. And so I guess the other thing I'd want to learn from both of you. So there's been again a lot of incredible insights from all the panelists. It's been a really interesting day in terms of all the different perspectives and research and things that are happening on the ground in different parts of the world. And do you have any thoughts on if you think there's specific regions or countries even that might be leading the way in integrating autism inclusion into their policy frameworks, which are aligned with SDGs? Just curious to see if you think that is the case, and if that is the case, are there things maybe we can learn? Are there approaches that we can learn from that could perhaps apply everywhere? Maybe that is not the case, but just curious to see what your thoughts are if there's countries or regions that you think are doing this particularly well.
If I may start again,
go first.
It's really a mixed picture for me, because there are countries with welfare systems that have been quite mature. I'm from Scandinavia, where we probably have some of the most mature welfare systems. But often it feels like the welfare systems have become machineries without much room for people whose needs are not obvious or may not be as expected by the system. So it's really hard to say, because you cannot just say Scandinavia had a mature welfare system, therefore conditions in Scandinavia will be good for autistic people. That's not necessarily the case. It can very well be so, because all the tools are in the toolbox. But do the person that you interact with understand you? Do they have a mindset of everyone is important, everyone is different, everyone is good at something, and you should not just be judged on the situation that you have ended up in, but on what you could become given the right understanding and support. So I know that in very mature welfare system, there's a lot of friction. So it's not, I cannot point to a country and say their welfare system is doing what we would expect them to do and what the SDGs would expect them to do. I've recently been to Cape Town in South Africa, where the expectations to the welfare system is lower than in Denmark. There's not a long tradition for welfare in South Africa, and there's a huge inequality. But there's also a history of hope. And this has actually also been formulated by the country as a country for hope. And the legacy of people like Nelson Mandela is just humbling and so much aligned with the emotion I get when I get into the headquarters of the UN, saying, wow, we are together in something that is bigger. We have more in common than what divides us. And there's also a long tradition way before Nelson Mandela came into the place in the Ubuntu culture, there's a saying, I am because you are. I love that saying. It says,
That's beautiful.
we are here because we are together. If
Right.
we are all individuals, single, in solitude, then it's not what we should be. So the mindset is there, the system is not there. And sometimes in Scandinavia, it could be the other way. The system is there, but the mindset is not there. So, but the very, I think the most important point is that we ask ourselves what works and where are there examples that work. And this is also, I have a speech on SDG 16, which is about peace and justice and fairness. And one of the targets there is about making sure that the systems work for everyone, that justice is for everyone, that everyone get the support. But we don't know. So this is also an area where I hope that the autism community maybe could catch that ball and say, well, how can we make people aware of what works and what does not work? Maybe ION as a global network organization, grassroots organization, maybe we could find a way to work together also with academia and government, because governments are actually obliged to measure what works, what does not work. But we don't have the statistics, and this is why we have these discussions. But from a general perspective, I cannot tell where it works particularly well, because one thing is what kind of system has been built. Another thing is, where does it work? Where does it not work? We have to do some more to find out.
Right, and I think to your point too, there's always that cultural context, right, and to be sensitive to how things, the cultural aspect of different parts of the world. So I've also spent some time. I've been fortunate enough to spend some time in South Africa. Actually met Nelson Mandela when I was a student at Oxford, and was very fortunate with that. But yeah, I mean, it just time that I've spent in Africa too. It's for Westerners, it is a very different mentality, right? To realize that just the idea of mental health, like there's such a community perspective. There isn't this, it's not as much of an individual treatment, right, perspective. And so there's a lot we can, I think, learn from each other and learn from that. And then I think, something you alluded to as well is just the idea that, with neurodiversity in particular, it's different than some physical disabilities, right, where things are very visible, right? There's invisible strengths, but there's also a lot of invisible challenges. And the more we can, I guess, have work towards the cultures where there's a mind shift of just appreciating all people. We all have strengths and challenges. How do we shift to supporting all people and valuing, I guess, all people? And then there's going to be different nuances, right, with different cultures. So yeah, it's really super interesting. And Flavia, what do you think? I mean, I'm sure you've had some pretty interesting experiences in your line of work, and just where the area of the world that you live in and operate in.
Yes, unfortunately here, we in Brazil and in Latin America, we are not in this leading list of countries that are really successful in any of the SDGs drivers. But after reading a little bit, I realized that Australia is doing very well. They had developed the first national autism strategy. I have heard that the UK had been pioneering in introducing autistic children to mainstream schools. They say that 70% of the autistic children are already in mainstream schools. So this sounds really high and really impressive. But I have some Brazilian friends that are autistic parents that had moved to Portugal, to US, just aiming to find a better life and better social understanding of their families and their children. And I'm afraid to say that even though they find a better environment compared to Brazil, they say that there's still a long way on having the good life with dignity, with respect, and peace that everyone needs to live, right? Everyone deserves. So I think that, as Torquil said, I think that the interesting thing on this cooperation, this collaboration, is we try to study, to be integrated in this research, to try to get best examples and just share them, right?
Wonderful. Yeah, and I know, education's been a focus, a big focus, right? In the SDG 4, quality education, obviously calls for inclusive and equitable education. And I was just curious, both of you having a lot of expertise in this space, what do you think in terms of like what would be some of the best practices where we can move in a direction where there's this mind shift that we were talking about, right? Trying to change how we think about autism, how we view autism, seeing it in a more representative way where there is really this incredibly rich diversity within even our community. But what are your thoughts? Like, what more can we do to make schools and universities more accessible, do you think, for autistic students in particular?
Well, for me,
do you want to go first? Yeah.
Yeah, so I have also experience with special tracks and special schools where autistic kids can attend. And in many cases, it's good, but the municipalities I talk with, they say that the likelihood for someone who get a job if they've been in special education is very low. So
would you say that do you think would you say that that's the case pretty much in most of the geographies you've worked in, that there's still these barriers?
Yes.
Regardless of geography.
Yeah, and I can tell you why. And it is because the problem is not, in my eyes, so much to get autistic people to get support for education. It's more, the problem is more that the other kids never learn how to be different and how to be together in the classroom and in the football club and in the grocery store and so on. So if all autistic kids are taken away from the neighborhood kids when they go to school, it's a problem. And I say problem is not so much the autistic kids.
Right.
It's that those who are not autistic never get the experience. And I'm privileged to be the oldest person here. And I can remember when, from my school time, we didn't know what autism and ADHD and so was. But we were together and we didn't have the internet. We didn't have computers and mobile phones, so we were also together in after school. In school, after school, and yes, we teased each others, but I don't think we bullied each others, at least not with a bad intention. We were together because there was no alternative than to be together. And in my class, with the knowledge I have today, probably at least one could qualify for an autism diagnosis. We knew that the kids in the neighboring classes, they could bully him. He would be a target for bullying. So we stood up for him.
Great. So
that
important.
was a natural thing to do. How can we get back to the situation where it's natural that we're all different?
And you think we've deteriorated as a society or culture in being, sort of more naturally together and having different neurotypes working together, and so now we have to work harder maybe to make sure we get to a place where we have more representative exposure. Would you say? I mean, what do you think? What do you think would be the next step to kind of go in the right direction? Do you think?
Well, I think we should consider how can we give the world a message that autistic kids are not the problem. It is those who never get to understand autistic kids.
Just like the double empathy problem, right? For those of you that is just is that it's it's also the world needs to we need to be developing like these shared, going in a direction where there's more shared experiences, so we have shared frameworks, right, to rely on, and it's not autistic people have their way of doing things and neurotypical people have their way of doing things, but we're at least working harder, right, to build these empathy and communication gaps. Would you say that's maybe makes sense in terms of some next steps?
Exactly, and but we already have a direction. It's called neurodiversity. A neurodiverse space is a place where everyone can be different and together. And the world is not enough aware of the importance for the world that we can be different and together. And after 20 years of experience on employment, helping companies being able to benefit from all the fantastic things that can come out of people being more different and more together. We want neurodiversity in the workplaces, but we won't solve the problem until the school system is also neurodiverse.
Right. Yeah, and I know a lot of these conversations start at the workplace and recruitment, but the philosophies that get ingrained in our systems end up starting much earlier. Yeah, Flavia, what do you think here? I know seem eager to. I'm sure you have a lot of important insights here.
So Felicia went to 3 kindergartens. The first one was closed because they found another baby, 2 years old baby, tied. So we went to the second. The second one, the director called me saying, come here to pick up your baby because she was like 20 and 20 kids, 20 babies. And I went there, she had a head injury, she was bleeding. And the director told me, look, your daughter is like an animal. if you don't give her heavy drugs, she will never come to school. Then I took her to the 3rd kindergarten, and it was a Waldorf kindergarten, with a good reputation. I said, come on now. I found my way, and I arrived there after 1 month, and the owner of the kindergarten was crying, saying, come on, today I spanked your Felicia because she was misbehaving. It was my first time in 30 years that I spanked a student. And I was like, come on, you spanked my children. So she's 15 years old. She has been in 14 different schools. We tried everything you can imagine, Maureen. And when we moved back to Chile, because she was born in Chile, then we came to Brazil. We went back to Chile, but we changed a lot. But when we arrived in Brazil, she was 5 years old. We went to a school where she was starting to socialize. So she chose her best friend, and she was very excited. And we were bringing this girl to the movies. Went to the beach together, and she got really obsessed with this girl. And after 1 month, mother came to school saying, please isolate Felicia from my daughter because she's perturbing her. She's harassing her, and we don't Alicia and her sitting together with her and everything. It was heartbreaking because it was her very first friend. Until today, she talks about this girl. So we changed to another school, and in this new big school, she was coming back home saying, get out of here, crazy. Get out of here, crazy. She was repeating what she was listening, and we decided she was aiming to do a pajama party. We still have this culture. I invited the 2 girls that I thought would be the best ones to come.
Yes.
When time came to go to bed, she put her small bed in the middle of both of them. And they said, no, I'm not going to sleep beside her. Neither do I. So party's over. She was crying. It was heartbreaking. And it was terrible. Then we went to Chile during pandemic. And there we went from, I would say we went to more than 30 different schools in the high part of the city, at the capital of Santiago. And people were saying to us, and I was bringing her because she's nice, she's happy, she loves to socialize, she's talkative. And they're saying, sorry, we don't accept autistics. So for Santa Claus, she asked for a tie as a gift. And I said, a tie? Why do you need a tie? Because in Chile, the uniforms have a tie. She said, I want to go to school. So I put her in a special child school where she was together with children that couldn't talk, couldn't walk. She's so positive that the first day she said, oh, Mom, I'm very happy because they have a microwave. She was very excited. But after 1 month, she told Mom, I'm special, but I'm not that much special. I know how to walk. I know how to read. I can read. I want to go to a classroom. I want books. I want homework. So it was again heartbreaking. And we trying and doing lots of tentatives. Finally, I decided to move to, we live in the middle of a national park in like 6,000 people city. And she goes to the school, is the only school here for her age. And thinking that here we have less competition and thinking that here she could be herself. But unfortunately, as Tarkio said, it's so important to understand how the environment and her peers are important to her. One boy said to her she had a meltdown the other day in the middle of the classroom, and the boy said, "Oh, if I knew I would have an autistic child, I would prefer to do an abortion." And
Wow.
and in a very isolated, in the middle of nothing. So we need to understand that the responsibility of the schools are the first social door that the children for their lives, and this is really, really important and really need to be. We need to have right directions and the right informations. I went to Vienna to the Zero Project in Vienna, and I got in contact with Beacon College in the US. They said they are now focused in neurodivergence, and this hope for me that maybe we will have places where they can feel comfortable and they can be themselves. It's quite difficult to think what is the ideal role to have her in the middle of this ambient that can be bad for her with not accepting her condition, or being with lots of people aiming to be understanding and to be respected. We don't have an answer, but it was a hope for me that things are developing.
If I may comment here, Flavia, thanks for sharing your very personal story. I've heard it before, but it touches me every time I hear it. But this is, so no one can have doubt that we are driven to leave no one behind. Absolutely. This is what we think of every day. What will be of our kids when we don't have the resources anymore? And there's a global commitment to sustainable development goals where the aim is also to leave no one behind. So how can we be inspired by South Africa and say, South Africa wants to be the country of hope? How can we be the community of hope? Because we know a thing or two about leaving no one behind. And this is what all governments have agreed upon at the UN. It's not the UN's Sustainable Development Goals. The UN just set the theme. It is the governments and it's the citizens of the nation's Sustainable Development Goals. It's all of us. It's our goals. So how can we come up with a grassroots initiative from the community of hope? Work with the UN, work with the governments, work with academia, because we know what works and what does not work. Just imagine how many resources you have spent, Flavia, trying to get what all the countries have agreed upon, that of course your daughter should have the same opportunities as everyone else. If we could help the governments with the knowledge that we are getting every day from the tension fighting with the systems, how can we turn this tension into something that is helpful for us and for the governments, and can help the governments with their obligations to live up to the Sustainable Development Goals? Because they promise to do so, but are they on the right track? Yes. But who will be the best partner for them to find out, are we on the right track or not? What works, what does not work? How can we how can we work together in a new constellations? For example, I'm a granddad now, 3.5 grandchildren, the fourth coming up in a couple of months. I'm trying to think like a grandfather also. At my age, there are many people who are getting close to retire. They are on top of their network and credibility as business persons, and they have more time than the busy young families. 2 examples here in the Fireside chat. How can maybe my generation be a new partner of a grassroots movement of hope? Because there's nothing we would rather do than to see our grandchildren thrive also with kids who are different than themselves.
Right, and I think
we need to say, yes, there's a lot of struggles in the world and we're all struggling. But SDGs is a statement of hope under the umbrella of the UN. And we could be the community of hope that could, from a grassroots angle, partner with new constellations of partners to do something that can turn much of the tension into something that is of knowledge and use for the systems and those representing the systems.
And I was going to bring up, we talk often about the SDGs, you know, sometimes in very separately, right? You know, there's SDG 4, quality education, there's SDG 8, decent work and economic growth, and 10, reducing inequalities. But, you know, I think there's a lot of value too in, you know, thinking about this in terms of with neurodiversity in particular, like there's specific goals and progress we would all like to see in the world, and there's more overlap, right? I think in some of these SDGs than maybe has been discussed in the past, and I'm curious. You know, we talked about the SDG 4 with the quality education, but it seems like, you know, as we mentioned early in the conversation, like even with just the barriers to achieving you know, meaningful work, right, for many autistic people, a lot of those barriers, they don't necessarily start right at the recruitment phase, or they start earlier in education, but they're, you know, the SDG 8, decent work and economic growth, right, the importance of being inclusive in employment, like what more can we do to increase, you know, fair and meaningful job opportunities for autistic individuals. So I was curious what you both thought about that, but also just wanted to bring up, I guess the way I've been thinking about it is that the direction the world's going in too is that that's not necessarily a separate question from some of the conversations we've been having and what more we need to do on the educational side.
If I may jump in again, because this is my ball game here. So the SDGs, they are bundled around people, planet, prosperity, peace, and partnerships. So that's something for people, that's something for the planet, and all the initiatives we are talking about, education, employment, and so, that they are parts of the puzzle.
Right.
But SDG 16 is really where you measure where are we heading. All the things we are doing in SDG 4 and 8 and so on, how can we make sure that it works? And what works, how can we make sure that that will be made available to other parts of the world and stakeholders. And so this is where the government needs someone, a global grassroots organization, a grassroots organization who knows the pains, know when things work and not. Number 17 is about partnership for change. This is where we can scale what works. First, we need to find out what works. And then another favorite SDG of mine is partnership for the goals, number 17. This is where we can go across stakeholders in the community. This is where companies, foundations, governments, social entrepreneurs, civil society organizations, academia can come together voluntarily and say, we commit to this. But no goal can be dealt with separately, because as you mentioned, Maureen, they all interact. So if you have a good education, then it will benefit employment and there'll be less poor people. Health will be better and so on. So it's all intervened. But the glue is and will forever be the leave no one behind. And we know a thing about that. So I think we have an opportunity to play an important role to help the governments, companies, all stakeholders realize the goals that they have committed to a long time ago. But as it looks now, there's not many years left to 2030, and more funds are being spent on military. So we really need to think differently, and we need to offer our insight in what works, what does not work.
Yeah, that's really insightful. And Flavia, what do you think?
Talking about work for autistic, because you said the way they are integrated, but as Thorkill said, it's a big
so obviously there's a lot of work that needs to be done just for how do we make work more accessible, right, for autism. And it was just the issue that that some of these SDGs they work together, and that some of these conversations obviously with education need to be happening earlier, ideally, right, if we're trying to really change things from a systems perspective. But yeah, I mean, what are your thoughts from your experiences with even just the employment aspect of this? How do we make work more meaningful, more accessible to more autistic people?
So here in Brazil, what I have seen is that we have quota systems. We have a law that companies need to follow. But unfortunately, they are focused on hiring people with evident disabilities. They are pretty much afraid about neurodiversity. They just don't know how to handle. They just don't know how to accommodate their workplaces. So the ESG agendas, they have a very clear agenda for gender, for race, for ethnic, but for disabled, it's still very incipient, I would say. And for autistics, we have the statistics is they are very sad. They say that 85% of the autistic adult population is out of the workplace here. And I would say that the other 15% are underemployed. So in Chile, they also have these quota systems, but they prefer sometimes to pay the penalties than to hire a person with a disability. And I also heard that this is really sad, that a specific company there contract the autistic and say, please, here's your salary, but don't come. Don't come to the office. You have your salary granted, but don't come to the office. So it's awful, right? As the director of Sunflower Hidden Disabilities, my work has been on changing this in the region, introducing the lanyard, the Sunflower lanyard, and doing the training to these companies to show what is a hidden disability and to understand that sometimes the person is there masking, pretending that they is okay, but they are suffering. Right. And it has been impressive that people are coming after me and sending me messages saying thank you very much, because I was suffering every day to come to work. So the other day I was doing a training session in Justice Tribunal here in Brazil, and my sponsor there said, please talk to people that don't know they don't have the diagnostic yet. Please try to give them, oh, maybe I'm autistic. Say if you are suffering, if you feel isolated, if you have lunch by yourself, if you are very honest and you are not having good relationships at work. So we know that lots of people are suffering in their workspace also when they have, I am ADHD myself. So know that there's lots of things to develop in here in the region. I have heard lots of good news in UN Vienna and Zero Project about companies that are changing the way they have their job description, for example, because job description, excellent communication skills. Is already out, then excellent communication skills could not be a must-have in all job offers. Right? Then they were changing their hiring processes. Instead of having the common interview, they were bringing these marshmallows and spaghettis for people to build castles, to see the teamwork, to see creativity. They were using Minecraft. And I have heard lots of good news about this and about the worries, as Torquil said, on leaving no one behind. So I think we are in our way, and it's good that people are already conscious about it, and some companies are already taking this attitude, right?
That's wonderful. Yeah, and it sounds like and if we had to wrap up all the other sessions, and there's so many rich conversations and insights that have been made throughout the event. It sounds like, as Torkel mentioned, like it's such a big focus ends up being on how do we build these stronger strategic partnerships? How do we collaborate? How do we work together? Which very much fits in with the SDG, set 17. And I guess along with that, one of the things we haven't talked as much about is maybe what more we can do, like even globally, in collaborating with knowledge sharing, right? Helping bridge these gaps with research and implementation, and how do we, do more in, the policy implementation. And then there, of course, is the geographic, there's different countries and different cultural scenarios we're all operating in it. But I mean, I don't know if it briefly, maybe you could each just briefly comment on, if there's one or two directions you would suggest that where we could make some progress there of bridging this sort of like knowledge sharing gap where we can learn more from evidence-based practices and, push things further into real world change, right, and implementation, and including policy.
Yeah, thank you. I think there's a lot of good initiatives, but they are, how can we bring them into the daily life of people all over the world. For example, employers. The organization I founded 21 years ago, Specialist, and has been working with 500 companies or so, and to help them employ and manage autistic people. They get it. They get it. But they've only seen a small piece of the value that they can get out of being a neurodiverse employer. What I'm trying to do now is to make companies aware that if they want to represent the community they are working in their organization, then expect that 1 out of 5 will probably need a neurodiverse environment to thrive. A place where the beliefs are that everyone are important, everyone are different, everyone is good at something, and it's not maybe documented in the resume or CV, but doesn't matter. Let's find out what you're good at and how you can go from being good at something to be great at something. What kind of respect, accommodation, clarity, availability is needed for you to thrive, not as an individual, yes, but also as a team member. This is what we've seen, that places where inclusion of autistic people have been successful, everyone thrive. It's a benefit, and this is also why so many companies have entered into employment programs. And we should not talk anymore about, does it make business sense to employ autistic people? The answer is yes. And you don't need to discuss that anymore. The evidence is 500 plus companies do it, and they don't do it if it does not give business sense. What we also need to make sure is that all the capabilities of employees can be made available to do as good as work as they can. And that will also require neurodiverse environments where you don't need to fear to be singled out as not fitting in, masking, as you mentioned, Flavia. And I think this is fantastic what you're doing with Sunflower. I love the concept. It's also a potential constellation of different partners from different view angles that are all driving towards the leaving the one behind. A very message of hope from working with many employers. Yes, they can be difficult at times to work with those employers. Their attention span are not so wide, but we have succeeded in jobs from pig farming to cybersecurity, from back office to front office, host of guests at museums. And what I've seen is that normally these companies, they are fierce competitors, but when it comes to sharing experience in employment programs for autistic and neurodistinct people, they are open to share because they know that the more talent will be made available for the labor market, the better it will be for them. So it's not a zero-sum game anymore. And we need to piggyback on that and say to the companies, work with us to work with the education system to make autistic kids or neurodistinct kids be the cool kids in the class, thrive, and tell all students that it will be important when they want to do a career in a modern, innovative labor market, that they're used to making the most out of the differences that we all have together. So we have to send a message of hope. And I'm catch many signals of hope from employers. And but there's of course also it's a contact sport. So sometimes it goes very well, sometimes you're pushed back. But there are so many people, including CEOs, top managers, middle managers, co-workers, who care deeply about neurodistinct people, family members, neighbors, friends. Maybe they have kids, maybe they are neurodistinct, and so it's a universal thing. And the companies who are best at understanding that and create these spaces for neurodiversity will be the most sustainable ones. They'll be here in 100 years from now. So I think we have messages that we need to get out to the world saying, stop thinking about autistic people as a minority.
Right.
Think together with all the other diagnoses under the neurodistinct umbrella, each person has two parents, maybe siblings, uncles, nephews, grandparents who want something new. So there's a new hope to make us talk about. There's a new majority on the way saying, we want a change. You should stop thinking of autistic people and neurodistinct people as a minority, because they're all loved by someone. It's
That's it.
To say that now there's a majority who want to change.
Right. It's a really incredibly important point. If Flavia, I know you've been. You have something to comment here.
Yes, I want to comment what he said. First, thank you very much for talking about the sunflower and why I am here. I was introduced to sunflower in a flight, Latin Airlines flight, when I said she was autistic, because we were always suffering a lot of prejudice because she was running, she was shouting. And this trip was completely different from the others because people were seeing that she was putting, I have a hidden disability, so they're laughing at her, asking her name. Where are you traveling? She didn't want to take the lanyard the first week, not even to sleep. She was very excited with her lanyard. Then I decided to get in contact with them in London, and I was surprised when I realized that they are in 300 airports, 20 airlines, in retail, in hospitals. So I offered myself to be the original. I said, if I knew this before, I wouldn't be passing through all these difficult situations on people saying, oh, if it's autistic, we shouldn't come to the club, to the movies, to the beach. We were also always fighting in the middle of the street with people with prejudice, with lack of empathy. So I offered myself, and Torquil said that he was excited because I showed him that we now have a Brazilian law. It's a federal law that recognizes the lanyard as the official instrument for people who wants to voluntarily disclose that they have a disability. In the day of the launch of the law, we projected the Christ the Redeemer with the sunflower. We have been in the stadiums in Maracanã, in Morumbi. Our football club is partnering with us. The big retailer, Multiplan, the biggest shopping malls, everyone is recognizing the lanyard. So we are taking the autistic population and the hidden disability population out of isolation. And this has been really farming here. In Chile, there is now a project of law. In Uruguay, there is a project of law to recognize the sunflower. So thank you, Torquil, to bringing this to the conversation, because it has been really, for me, I've been receiving messages daily about schools that the girl was having a heart attack and someone saw it was with a sunflower lanyard and saved her life. And thousands of messages and examples. But I would like to talk a little bit when you mention about the global cooperation and the global perspective. I want to give a little bit more information about health in Brazil. We didn't touch health, but here you must have a medical insurance to be assisted.
Right.
And you cannot go to a public hospital. So I was lying. I was omitting that Felicia was autistic because I was rejected from all the insurance companies. And the funny thing is that in the questionnaire, they said, do you have another disease that is not included here? And I saved my life because as for me, autism is not a disease. It was not a lie, but I omitted that she's autistic. But at the end, she would never be assisted if I said she was autistic. And what is happening now is that families are judicializing their treatments, and the biggest insurance problem are the lawsuits against the insurance companies because of unassisted autism. And the good news is that we have very beautiful and very well elaborated laws, but with no supervision, with no control. Then the laws are just there, but they are not followed. So 9 in 10 processes are win for families. Then this is good news. But we have lots of different crazy offers of ABBA, of all therapies that you can imagine, people that are influencers, there are YouTubers offering therapy. And there is a big market, a big economic market in Brazil on this, with no control, with no supervision. And nowadays, the costs of autism therapies for these insurance companies are higher than cancer treatments. So the number one cost for our countries. And sadly, when Torquil said, the children, they have 2 parents, I'm afraid to tell you that 78% of the fathers abandon the family when they get the diagnostic here. So these mothers, they have been working by themselves to survive, to create the children. The other day, I was passing here in the neighborhood, and I was hearing someone shouting, and a neighbor told me, "No, he's crazy." And I turned to know that it was an autistic, that he stays all day closed by himself, alone, home alone, and the mother goes to work, and he has no expectation. He's just there waiting to die. And talking about dying, suicide is very common here. That you know that autistic, they have 66% depression and high rates of suicides. But here it's very, very common that the mothers, they kill their child and they kill themselves. They suicide afterwards. We have very, very high rates of suicide here. So it's just a completely different world for you, but I want you to imagine how far away we are from a good reality for the autistic family.
Yeah, I appreciate it.
Yeah, if I may shortly comment it's thanks for sharing, and we actually see something similar in Denmark, at least on the suicide or considering suicide. We normally praise ourselves as one of the most happy countries. And I say to as many as I can, how about the mental health statistics? How do you think it's going here in Denmark? It's not good. Mental health statistics are just going through the roof. There's I think Denmark is a country with very high suicide rate or suicide syndrome. So again, Flavia, it's the same that we face, just in different settings. And I'm very aware about the challenge that so many fathers leave the spouse in situations like this. It's really sad, and it's also an ambition of mine. How can we make fathers play more with their kids? Because if there's one key thing that could change the lives for so many families around the world, it's if we could make fathers and kids more comfortable with each other. It's not fair for the mothers to be left with all the challenges, but no father wants to go away from the family. It's because they don't seem to be able to handle it. So what can we do? And there's so much to be done, but we are a global tribe of people in similar situations, regardless of where we are in this world, and we need to find ways to do things together. But how can we pinpoint where we can make the biggest change with the smallest effort? And one of those I would say is find a way to make fathers play more with their kids.
That's great, and it seems like one of the other themes that's been emerging here is just, especially in the kind of unpredictable world we have, and is just the importance of finding your tribe, right? Having a place where you feel like you belong, whoever you are, right? And it seems like it's just, a lot of the research and statistics also look that especially autistic girls are particularly vulnerable with mental health and suicide. Yes, and so there's we need to take this seriously, right? And just it's so important, even just us as a community, right? That whether we have lived experience or we're allies, that we come together and we have the same values, and we find we create these environments and these opportunities for people to feel like they belong. I think that there's and then Torkel, what you mentioned with fathers being more, like, there's so many different layers to this, it seems like. But I think the first step is just having conversations like this, right, where we're brainstorming, we're coming together as a global community, trying to figure out, well, what more can we do, and what I think regardless of our role or our title, we each could probably play a role, even if it's as simple as just showing more empathy, right, and being kinder, or there's just lots of different things. Lots of different layers here to unpack, and I know we have limited time. And I guess one of the, I guess we're starting to run out of time here, in terms of if there was a last question, and then feel free for both of you to add any details or bring up issues we haven't discussed, but. There's been so again, there's so many layers to this, but especially when we're thinking about, we can't completely ignore that we're in this very unusual time, right, in history, where so many things are changing very fast, and that will ultimately also change the employment landscape. And so there's a lot more uncertainty, I guess, than there has been historically. And I'm just, when you think about that context, I'm curious, if you had to decide on one major policy change that you could implement globally that would benefit autistic people and create more alignment with the SDGs for authentic inclusion. I know this is a tough question, but if you had to choose one major policy change, what would it be?
I'll probably not answer the question fairly, but I'd like to comment on what you just mentioned.
Okay.
So at times, there will be different signals from governments, but there's one universal understanding among all employers, and that is they want access to the most talent and most variation in talent, because they run a business that needs to be sustainable. And regardless of political messages and governmental decisions, this is a universal thing. There's a global need to make people realize that their talent. So we should not be sidetracked about from pushback and headwinds and so on, because we are onto something that is more important than that changing policies. We are working for a global commitment, and this is why I love the UN and I love discussions like this with members of what I see as my global tribe. It's very, 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 very big global tribe, but not many are aware of the size and the potential power in it.
Right.
So how can we make a global grassroots movement that has not been seen before? We are under the umbrella of the UN here. The SDGs are the topics for this discussion. We have alignment from the top level, from the SDGs. They have committed, all governments, all companies, all communities have committed to leave no one behind.
Right.
Then there's a lot of moving parts. But under that, there's a grassroots, there's a tribe, and that is us. So what can we do? We know at top level, we have backing, but all company, everyone have decided on leaving no one behind. And we feel it every day. We know what works, what does not work. How can we make a patchwork of partners in the operational phase so we can help the world with what the world has decided they want?
That's great, and obviously this goes beyond like obviously the political considerations and environments where we're the world we live in now. It seems increasingly there may be just a lot of the innovation and leadership may be coming from private sector, whether that's corporations, whether that's from hopefully governments too. We all partner together, right, with nonprofits, governments, corporate sector, but beyond the sort of more political considerations, it seems like just the direction things are going in with this being really the first time in history where so much cognitive work is going to be taken over much more swiftly than we've maybe seen, in the past. So it's just like a lot of disruption than we've used to seeing. But even it seems like, to me anyway, I have a lot of hope that when things are disruptive like that, that maybe people do come together more and are more open-minded, and there's an opportunity, right, where we can make faster change, right, and hopefully make the world and the corporate world and the governments and where we all partner and see particularly neurodiversity in a new light, and why it's maybe increasingly even much more valuable to business. At least that's my view. And Flavio, from your perspective and your experiences, I don't know, what would you agree with that, or do you disagree with that? What do you, or have some other insights?
I always agree with Arkio, of course. He's an authority here for me. But if I needed to choose one policy, I'm really aiming to have a global health direction.
Right.
Because since I lived two realities in Brazil and in Chile. In Brazil, the diagnosis was given in a private, very expensive doctor that gave when she was 2 years old. In Chile, they wouldn't give a diagnostic before 6. So it would be too late for her to have intervention and treatments. And as I mentioned, I tried everything. She was nonverbal, and she started to talk because of music therapy. She did horse therapy. We did everything there, but we need to have a guidance through ages, to know in the development of the child. I'm going to give another example. She had her first period, and I took her to the doctor because we have the statistics here say that 1 in 3 are abused. That's why when you said girls, 1 in 3 disabled people are abused. So I took her, they put her this anti-conceptive implant, and she was saying, "Oh, Mom, I'm now like our dog, like Maggie. I'm not going to get lost. I have a sheep." She thought it was a sheep. And even though she's in 8th grade and she has been passing through the school, and I thought she knew about reproduction because we talked about reproduction, I couldn't understand her knowledge in what we were talking about. What was that? Because she thought it was a chip, and she wouldn't. So, and she's coming to adult life. I'm worried about her future. I also saw in Vienna new universities in Spain that have new assisted homes for people with disabilities, where they keep their autonomy and their independence, and they just receive mentorship for these groups in the university. And I love this because, of course, as all other mothers, I don't want to kill my daughter, and I don't want to suicide. I want her future to her. And then if I need to choose, this would be the number one policy, the health, to see what's going to happen when she's alive, right?
Right.
Thank you.
Well, thank you so much. Both of you have just been amazing, and I feel so honored to moderate this conversation. It's been a lot of insights, and valuable contributions. So if there's I don't know if there's anything else you'd want to add, but I think we covered a lot of material here. And so just wanted to thank both of you for participating.
Thank you, Maureen. You did fantastic. Thank you.
Thank you.
Dear participants and esteemed guests, as we conclude this important gathering marking the United Nations World Autism Awareness Day, we reflect on the incredible potential unlocked through shared purpose and commitment. Today has highlighted powerful stories and inspiring examples of progress, clearly demonstrating that autism inclusion is integral to achieving many of the Sustainable Development Goals. Central to our discussion is the SDG 17, Partnerships for the Goals, which means recognizing that meaningful progress relies fundamentally on collective action and collaboration. No single organization, no community, no country can accomplish the ambitious targets of the SDGs by themselves. The Institute of Neurodiversity ION is proudly co-hosting today's global event for the third consecutive year, exemplifying the transformative power of collaboration. With now a network spanning over 40 countries across every region of the world, ION connects a global community of neuro minorities working with governments, civil society, the private sector, and academia. It is through these partnerships that ION actively promotes policy coherence, as inclusive policies enhance global macroeconomic stability, as outlined in Target 17.13. Moreover, aligning with the Sustainable Development Goal Target number 17, ION initiates, promotes, and enhances effective public-private and civil society partnerships. By building on shared experience and resources, we strengthen collective capacity, fostering environments where autistic and neuro-minority communities are empowered, heard, and valued globally. Furthermore, consistent with the target 17.6, we recognize the critical importance of enhancing international cooperation, North-South, South-South, and triangular, particularly in science, technology, and innovation. By facilitating knowledge sharing and improved coordination, especially through mechanisms such as the United Nations, we accelerate inclusive and sustainable progress worldwide. However, the journey ahead calls for even deeper collaboration. To realize our ambitious vision for the genuine inclusion and equity, we must invite more countries, organizations, and leaders to join our expanding global network. Together, we can drive impactful and lasting change. As we leave today's event, let us reaffirm our commitment to these vital partnerships and collective goals. United in purpose and vision, let us continue building a sustainable, inclusive, and equitable world for both autistic and non-autistic individuals alike. Thank you for your dedication, your collaboration, and your unwavering commitment. Let us move forward together in building a universally inclusive society that works for everyone. Thank you.